Spirituality and Mental Health under the aegis of Indian Psychiatry Society. The scientific committee, under the guidance of Dr. P. Raghuram Reddy sir and Dr. Vijay Gangadhar sir, had chalked out the program and kept academic sessions from various legendaries. These legends have been actively working in the field of spirituality, and they're going to transfer their wisdom to us. Spirituality and mental health cannot be separated, and we require this issue to address and bring back our patients from illness to wellness domain. Psychiatric symptoms can be reduced with the various existing treatments. Spiritual domain will help our clients to get into this wellness domain. Let me welcome our first chairpersons. The first session is Science of Spirituality. We welcome Dr. Gautam Saha sir. Gautam Saha sir is currently Director of Clinic Brain Neuropsychiatry Institute and Research Center, Kolkata. He is President, SARC Psychiatry Federation. He is President, Indian Association for Geriatric Mental Health. He is immediate past President of Indian Psychiatry Society, Member Standing Committee of World Psychiatry Association, International Fellow of American Psychiatry Association. Sir had authored 4 books and is having many publications of national and international level. We welcome you, sir. The next chairperson is Professor Nirmal Namchane, sir. He is Professor and Head of the Department of Gandaki Medical College, Nepal. He is Vice President of Psychiatry Association of Nepal. He is having many scientific papers and presentations in national and international conferences, journals, and books. His hobbies include movies and literature, advocacy of mental health in media. He is not only an exceptional professor, but he also acted in Nepali and regional language films. We welcome you, sir. Now I request Gautam Saha, sir, to introduce the speaker and take over the session. Thank you, sir.
Good morning, everybody. At the outset, I must say it is a great privilege to be here, and it's an honor to me to chair the sessions. Dr. Inaugural Basurai, who was really active in this field for a long time. Thank you, Dr. Kishan, Dr. Raghuram, and the full team for choosing me as a chairperson in this lecture. You know that Dr. Inaugural Basurai is the founder chairperson of the American Academy of Yoga and Meditation, and he is a well-known cardiologist, cardio-electrophysiologist, and the director of the cardiovascular research at the VM Medical Center in Memphis, TN, USA. Dr. Basu is also the visiting professor of cardiology and the head of the integrative cardiology at the All India Institute of Medical Science at Rishikesh, India, and a professor at the School of Public Health, the University of Memphis. Dr. Basu was chosen by the American Heart Association as an eminent cardiologist worldwide to write the practice guideline on the role of meditation in the cardiovascular disease. He is the author of over 100 peer-reviewed articles in academic journals of cardiology and the medicine. I welcome Dr. Basurai for this session. It is a great privilege. Again, I am telling, and regarding spirituality, you know that previously we are talking about the biopsychosocial model. Right now, whenever we talk about the biopsychosocial and spiritual model, because spiritual and science go side by side. In fact, it is a part of science, you can say. Spiritual and science, somebody explained it is the 2 wheels of the same cart. Spiritual is the substratum in which the science and the scientists and the facts they prove are together sitting on. So I'm not taking much time. I hand over the mic to my co-chair, Dr. Nirmal. Dr. Nirmal, please.
Thank you. Thank you very much. It's indeed a privilege for me as well to be here among so many eminent personalities here. And I think without much, Dr. Gautam Sai has spoken whatever was required, and I would straight away like to give the mic to Dr. Indranil Basu Ray to start the session. Thank you.
Thank you very much. Let me just share my screen. Can you guys hear me clearly? Can
Yes,
everybody
sir.
hear me? Okay, thank you very much. I'm really thankful to Dr. Kishan for giving me this opportunity to speak to such a eminent crowd. I'm also thankful to my friend, a really famous psychiatrist, Dr. Gautam Shah. Really pleasure to see him again, for all his help, support in this work that we do in the field of spirituality, medicine, and spread of yoga. Thanks, Dr. Nirmal, for your kind words. And of course, I'll be failing to my own self if I don't say my pleasure to meet one of my mentors again here today, Dr. Gangadhar. With his blessings and with blessings of all the gurus, let's start this talk. I hope you guys can see my screen, correct?
We can see your slides, sir.
Perfect. So you see, spirituality, whether it's experienced at a personal level or within the community, it impacts patients' well-being. It impacts how patient is satisfied with the care that you as a doctor provide. It's also important both for medical decision-making and also, unfortunately or fortunately, with medical care outcomes. Yes, my dear friends, famous psychiatrists from all over India and other countries, it's true that which we neglected for so many years, now it is very clear that spirituality does affect medical care outcomes. Unfortunately, despite this evidence, it is clear that medical profession at large, doesn't matter whether it's a psychiatrist, it is a cardiologist, internal medicine, they have completely neglected the spiritual dimension of patient well-being and illness. And I'm really, really thankful to the Psychiatric Society of India. I'm really proud and privileged to find that they have a complete working group to spread the world of spirituality. So it is important because, as we shall find out today, that we need to reevaluate how medicine interfaces with spirituality and religion. And that will be most of what I shall be talking today. So in this talk, I will present in the science of spirituality in medicine, I will present the need for patient having spirituality in their care based on medical research. The fact that spirituality is not a favorite pastime of some physician or some patient. It is a basic survival mechanism in every human being. So as doctors, we should give it its due importance. Second is medicine neglects spirituality, and that's a very unfortunate part. This is true for all over the world, even some of the world's topmost academic medical centers. And last but not the least, with my limited knowledge, I'll try to close the gap and try to conclude with recommendation of how medicine can better respond to a patient-centric care by providing spiritual need if called for, based on the actual science of spirituality in medicine. Now, this is, as I said, not a story that I am creating or somebody like me who's biased with yoga, with spirituality, and with medical sciences, but this is an actual true story or actual true incident. And these are the real research that proves it. 100 terminally ill cancer patients from what is called the world's #1 cancer hospital, MD Anderson in Houston, were asked if their spirituality was important to them. 80% reported that spirituality is extremely important to them in their life. We had in a Boston teaching hospital, this study had over 200 patients from all the top, which is including Dana-Farber, which is world's third most famous cancer hospital, other top hospitals in the world like Mass General. In this, over 200 patients, they are all patients of major teaching hospital. 78% considered spirituality important in their cancer experience. That's a very important point to note. 78% did not say spirituality was just important to them. It was important to their cancer experience for which they were admitted to these hospitals. And more than half considered themselves both spiritual and religious. Delving a little further so that we can understand the entire gamut of the problem, it is important to understand it is not just terminal patients to whom spirituality is important. In this study at the Duke University Medical Center with around 800 patients, and these are patients from different services, general medicine, ICU, psychiatry, neurology, stroke patient, heart attack patient, schizophrenic patients. 79% reported having at least one spiritual needs. So I don't think we have any more. I mean, if I was given the whole day to give you scientific research that proves the importance of spirituality in clinical medicine, I can actually spend the whole day doing that, because there are that many studies from all over the world, not only from India, not only from US, not only from Europe, but from all over the world, from the most advanced, technologically advanced country to the most technologically backward country, because human beings, in a sense, is the same. It doesn't matter what sort of environment you are in. Having said that, it is important to understand the reason for this. Spirituality is important to understand is a survival mechanism. In this study with 108 patients with significant gynecological malignancies like ovarian cancer, endometrial cancer, who are in their in different stages, 49% reported they becoming more religious after their diagnosis of their illness came in. This is reported in, as you can see, one of the world's topmost obstetric and gynecology journal, that is the American Journal of Obstetrics and Gynecology. And you will note throughout the study, because of this feeling among doctors that this is not an important topic, but some people are trying to push us into this topic. I have quoted some of the world's topmost journal to prove my point and how important this topic is and how every doctor should be cognizant of that. So there is an understanding that that whenever people are faced with a direct fear of death, or when their hope for immortality breaks down, as long back as even Freud had said that, people tend to get more religious. So there's an old saying, nobody is without God, which is known as the foxhole effect. The foxhole effect basically is the hole that you have in the battlefield when you're facing the enemy. When you're sitting in that foxhole, even the worst atheist becomes a believer in God. So that effect is seen in medicine quite often. And not only in terminal illnesses, as I showed you, even in other cases where people start fearing whether they'll live for another day, what is going to happen to their treatment, whether the bypass surgery they're going to have tomorrow, after that, would they still be alive? Would they be there to see their parents, their son, their children, their family? Despite this importance, unfortunately, medicine has constantly, to some extent, purposely neglected the science of spirituality. Studies have found a majority of serious ill patient view spiritual inquiry and engagement within the patient-clinician relationship is both important, appropriate, and supportive. Patients' desire for spiritual interaction was also found in any disease that is severe. So I will show you proof in ICU patients. I mean, having simple pneumonia, but they think they might die. They think they may not remain to see back their family. So if you think it's only the terminal cancer patient who we need to talk about, that's not true. Every severe illness patient thinks about spirituality. And over 80% of normal patient who has to go to a hospital thinks about spirituality and religion. And the sad part is that very few patients are actually engaged by clinician. Even when they say they require spiritual help, they are not engaged in that. As I said, if in this particular study in Boston, where they took all the top academic hospital in Boston, Dana-Farber, Mass General Hospital, Brigham, only 6% of physicians talked about spiritual care, where 80% of patients wanted them to actually talk about spiritual care. Despite that, only 6% of patients talked about talked about spiritual care, and another very poor number, only 13% of nurses at any point in their cancer care. And that's the important point. As all of you know, cancer care is one of those care in medicine that you need prolonged care, prolonged stay at the hospital, multiple admissions, multiple emergencies, all the scary treatments, whether it is surgery, whether it is radiation, whether it is toxic chemotherapy. So despite having such a long interaction with clinical medicine, only 6% physicians interacted with their patients spiritually. This is an important point to remember. So the medicine neglect of spirituality, talking further, is further proved by one important study. And I thought this is important because, as you know, in this country, you talk with the patient's family. This is a study with over 250 people who are decision makers on behalf of their patient. So as physicians, you have family meeting with them. 78% of the family thought that they wanted spiritual connection with their doctors. And unfortunately, less than 20% of the talk between the physician and the physician family was talking about spirituality to the patient. So this is a situation where a physician does not have to create a need. A physician doesn't have to invent a new thing. This is something that the patient and the families are wanting from him, but he is lacking. And that's what is the tragedy of modern day medicine, and we'll find out why. First and foremost, there's an unstated assumption that is rooted in particular social process that medicine and spirituality cannot go together. And this is an unquestioned thought. Who created this thought, God only knows, but this thought is frequented over and over again, especially even in the world's topmost academic medical schools. For example, there are multiple papers from Harvard, from Duke, which shows the doctors tend to avoid spiritual topics even when they are comfortable doing it and patient wants them to do it. That is the worst part. Patient wants them to talk about it, but they don't, even if they are comfortable. Yes, if you are not comfortable, you don't have to. Nobody is forcing you. But if you are comfortable and your patient wants it, there is no reason why. Second is that clinician regularly at different parts of the care, whether it's a first clinical visit, when somebody is visiting you and you're going to treat him as a psychiatrist for psychiatry, and I am as a cardiologist going to treat him for chest pain, am I not going to ask if he doesn't have diabetes? Am I not going to ask if he has other illnesses which might affect? Why can't we ask if spiritual, about his religiosity or spiritualism? It just could be a part of the clinical questioning that we can have. And we'll talk a little bit about that as we go forward. So it's important to understand how and why physicians have developed this psyche. What are the key beliefs? Because of that, physicians have tended to shun spirituality in their practice of medicine. One is hospitals are thought to be primarily institution of technology and cure, rather than organization aimed towards humanistic care. How paradoxical and how tragic that can be. To me, a hospital is the temple of humanistic care. It is the church of humanistic care. It is where the best part of humanistic care is shown by a loving physician, a caring physician who is appropriately trained, who uses a good mix of good personality, love, care, as well as technology and science to effect cure. So thinking hospital as dead institution of technology is the worst shameful thing we can think of. Second is physicians conceptualize themselves primarily as scientists. Nothing wrong in that. Secondarily, as health managers, rather than primarily as healers attentive to the whole person. This is another big problem in medicine. It doesn't matter what sort of a physician are you, what sort of a physician scientist are you. If you are treating patient, you are a healer. And if that basic idea of being a healer is lost, then 50% of you as a physician is gone. And unfortunately, super specialization and subspecialization has ingrained these wrong concepts in physician. Okay, so I am a cardiologist. I don't care about somebody having uncontrolled diabetes. That's not correct, because his next heart attack is going to be from diabetes. Oh, I am a cardiac electrophysiologist, so I am busy doing VT ablation, atrial fibrillation ablation, putting in a pacemaker, so I don't care if he has hyperlipidemia. Well, he will need a pacemaker if he has a massive heart attack that kills his conduction system. So it's not the human being. It's the complete human being which is important. Modern medicine itself, as Gautam Shah was telling, Dr. Shah was saying, has started retracing its steps. We went from a human being to a system. So we became a gastroenterologist, cardiologist, etc., etc. Then we went to a particular semi-system like liver. So we became hepatologist. First we became gastroenterologist, then we became hepatologist. And then we realized in the last 500 years that we have lost the human being itself. So today you're a cardiologist, tomorrow you're an interventional cardiologist or an interventional cardiac electrophysiologist, then you're a myocardial specialist, and then what? You lose the whole human being. What are you treating? Are you treating a single cell? So super specialization and subspecialization has, other than making the whole concept of human being more true, it has unfortunately taken a wrong influence. And now modern medicine has understood that in the last 50 to 100 years. That's why things like yoga in medicine, things like spirituality in medicine, things like whole human being, things like neuropsychoimmunology have started creeping back, and people have started talking in terms of integrative medicine. Medicine as a whole. Medicine where the whole person is most important, not what the doctor knows. And doctor should treat a person, not as a myocardial, as a biological organism with one myocardium or one hepatocyte or one brain cell or one psychiatric disease. Third important thing is that human being, typically by most Western trained physicians, are treated as a material and immaterial things. So at the anthropological level, they don't believe there's a connection between the body and the soul. Physical disease and physical health have no connection whatsoever with spiritual factors. This is the biggest tragedy of us, even people from the Indian subcontinent, leave alone the Westerners. Westerners can give an excuse because modern medicine is 500 years old and they have all this concept. But we from the Indian subcontinent, we have a 5,000 years old concept of physical body and the soul working together. How can we completely divorce it, get so much married to Western medicine that we forget our own basis, forget our own root, our own DNA, our own genes? And the tragedy is the Western medicine is picking up these DNA, the genes that we had for 5,000 years. And we are picking up not only the good things in Western medicine, but also the bad things. So it's time for us to retrace our step. Our physician being trained in allopathic medicine, being trained in Western medicine does not mean that we divorce the reality that has been true for 5,000 years, which modern medicine itself is trying to retrace, because 500 years of modern medicine, separating spirituality from human being, separating body and the soul, you may not understand the science of soul. What does it matter? Till today, I might have prescribed, a few million prescription of colchicine. Till today, I do not know how colchicine works. There are diabetologists in every small villages in the universe. I mean, there are millions of diabetic patients. Everybody prescribes metformin. Till now, I do not know how metformin works. And any one of you can prove that, you'll get a Nobel Prize. Have we stopped using metformin? No, because we know it works. So it doesn't matter if there is no science behind the soul, or the science behind the soul might take another 200 years for us to understand. But the fact is, at the spiritual level, at the individual level, we know these things has to be taken together for better treatment of the human being as a whole. And purposely negating that, that too arbitrarily, especially when patient also wants it, needs it, and that is what will give him the best care, is not part of the real game. Last but not important point is, oh, I'm a doctor, I mean, I'm a high-tech, highly intelligent person. I can't get bothered with fear, finitude, death. Let some stupid temple clergy or some priest, let him deal with it. No, you're the healer. If you can't deal with fear, finitude, and death, you should stop being a physician in the first place, because that's your first job. Diagnosing job is your second job. First job is making sure, telling the patient that he is in good hands and you will take care of him. That doesn't mean that you're telling him you're God, you can do everything for him. But that just gives him the understanding that you're going to be in his side as a healer. And that healer does mean supporting morally, supporting spiritually, supporting medically, supporting technologically, and certainly supporting him scientifically, which is part and parcel of being a doctor in the first place. Third, which is a very tragic development and especially seen with Western medicine, and unfortunately it has been creeping up all over the world, including India, despite having 5,000 years of such a powerful civilization, is entire health sector is getting driven by market science. We want to be secular, but we want to be secular in the wrong way. We want to be secular by talking about market, science, technology. Spirituality and religion is a non-secular term. That's not true. Spirituality and secular is as secular as anything else, because that is inherent in human being. So it is important to understand that medicine has to take up science. Medicine has to progress in technology, but not at the cost of throwing out spirituality and religion, because that is part and parcel of the human being. And even if you want to, you cannot throw it out, because basically your job is to treat a human being. So how do we close the gap? And that's the most important part that we need to understand. So as empirical evidence mount, medicine can no longer allow neglect of spirituality and religion to remain status quo. Simplistic and that too arbitrary division between body and soul fail to account patient experience of illness or how medical lesions are approached by many patients. And we have no right to make such arbitrary division. If the patient thinks they are one, they are one. Just because you cannot say, as I just said, you don't have the scientific proof of how metformin works, has that stopped you from using metformin? No, it has not. Every single day since the time I started talking to now, couple of million prescriptions should have come out all over the world, because there are billions of diabetic sufferers all over the world. 1 out of every 4 patients in India suffers from diabetes. Same is the story with all the Western nations, including United States. So this logic, oh, I don't understand soul, I'm a doctor, I'm a scientist, that is arbitrary and completely irrelevant concept. Second is, this dichotomous approach fails to make it patient-centric. Today's everybody is talking about medicine that is patient-centric, medicine that is care-centric, medicine that is cost-effective. And these things fail to happen if you fail to close this gap. How then can medicine constructively and without defensiveness respond to patient's spiritual experience of illness? That's how you take the science of spirituality to the patient. First is, a simple minimal standard is that clinician should be expected to ask his question to each patient, just like when you're doing a normal examination of the patient, how spirituality or religion might be important for their illness. If the patient says it's not important to them at all, fine. Don't talk to them about it. Story is done. You've done your job, finished. If the patient appears to be struggling, then with the patient permission, you can go a little more. You can talk about if he wants to go and visit a chaplain in the hospital, or his own private priest in his temple who can come and talk with him, or any trusted community spiritual supporter who he'd like to see, and who you could also bring together along with him to see his treatment plans. But if the patient says that he is willing to talk about spirituality, he wants to talk about spirituality, he wants to engage with you, and you are also willing to engage, then you can sensitively engage with him. That doesn't mean you talk non-science. That doesn't mean you do not point out to him the real, his actual disease, the prognosis, but that you do everything like a physician, scientist, as a doctor. But at the same time, do also take the trouble to get your one arm out to help him out if he needs, or if he has a spiritual need that you can settle. Now, how do we close the gap? There are different methods. I'll just bring out a couple. We don't have a lot of time today. First thing is by training. A key structural change in socialization of clinician is important, which means that, like exactly what IPS is doing, every society should have spiritual care training for physicians and nurses. Every society, whether it is psychiatry, cardiology, endocrinology, name it, because spiritual care is part and parcel of medicine. There's enough proof, enough research to prove that. Second is, one of the most powerful predictor of a nurse or a physician care in seriously ill patient has been spiritual care. You have not heard that wrong. This is based on studies in some of the world's topmost hospitals. This is not based on some stupid doctor sitting in some small places doing his own private practice and talking a bunch of nonsense. No, this is based from research in top academic centers. So it's important, if spirituality is such a powerful predictor, then nurses and physicians should be trained in that. We are not trained, we are just trained in the dry science of medicine, which is thus 30% of patient care. Patient care involves having that sympathy, having that empathy, having the love, having the widespread knowledge, having the spiritual bent of mind, which you can help the patient with, despite being in scientific. I'm not saying you leave science and go into all sort of ritual and nonsense. I'm not saying that. Don't misunderstand me. Last is, if trained, even who are not religious were more likely to provide spiritual care to seriously ill patient. Even a minimum level of mandatory clinical training would likely help to overcome biases sustained through a systemic silence. That's a very important point. After ages of systemic silence propagated by Western medicine, we have come to this stage that something a patient needs from us and are crying to get it and we cannot provide it. Or that's even better. It's not that we cannot provide it. We do not want to provide it because we think that it is beyond me as a physician. But that's where the fallacy lies. It's important to change our concepts. It's important to change our learning. It's important to change our teaching so that we become better healers. Next is research. While the field of spirituality and health is young, evidence of its clinical implications have begun to be noted. It's over 20 years. There are hundreds of papers on the role of spirituality from some of the best institutions in the country and worldwide. I mean, people in India, many top institutions in India have done tons of studies on this. So why are we not implementing the research into clinical practice? Nobody does clinical research to publish an article. People do clinical research to incorporate clinical research findings into practical medicine. So clinicians should respond by moving forward using empirical research as a clinical tool. And these should be appropriately funded. Now, there are a lot of institutions which are coming forward to fund spirituality in medicine. And people who are interested should take part in those. What sort of research is important? Couple of things that is very important is research needs to include greater description of the patient experience of spirituality within varied culture and clinical context. That's very important. Whether it's a psychiatric disease, whether it's heart failure, whether it's cancer, you have to have research exclusively for these diseases because the mind field is completely different and one cannot be replaced by the other. The patient profile is different. The disease profile is different. The science of treating them is different. And you also have to put in spiritual care intervention and see the research based on that. Create new hypotheses. Nothing strange in that. That's how we do scientific research in our everyday medicine anyway. All that we need is to implement there in spirituality. So at the end of my talk, if there's one slide I want all of you, my dear friends, to take home is this. Evidence of the role of spirituality within illness and patient outcomes should serve as a trigger for the medical system to constructively respond to patient spirituality, religion, as part of patient-centered and culturally sensitive care. And I'm really, really thankful, and it's a proud and privilege to be to give this talk to a set of psychiatrists who I think have transcended every boundaries to go and give such an important topic as a conference, to have such an important topic as a topic of their seminar. I think, my friends, you are in the frontiers of medicine. A lot of people all over the world need to follow suit and do exactly this sort of seminars so that we can carry forward this message. Not only every doctor is practicing, but also every medical student entering medical school. For your information, a couple of years back, I was involved in one of those projects where one of the topmost universities, medical school in the world, actually wanted to, and that they are not in India, it's in Boston. They wanted to incorporate yoga for teaching their medical students. So things are picking up all over the world, but you guys are carrying the light and showing the world forward. Continue to do as you guys are doing. Before I thank you, I'd like to introduce you to this book of ours. This is the world's first book on the role of yoga in cardiovascular medicine. It is for physicians, written by almost 80 specialists from all over the world, including top hospital. Dr. Gangadhar himself has contributed chapter to this book. Thank you very much. I'll be more than happy to take questions.
Thank you, sir. That was an excellent session. We are posting question answers in the chat session. Chairpersons can see the questions and ask the speaker. Thank you.
Thank you, Dr. Basurai. It was an excellent presentation. And before asking any question, Dr. Nirmal, you want to comment something?
Yes, Dr. Gautam. Thank you, Dr. Indranil. As a psychiatrist, I always have been telling our other fraternity, that we psychiatrists are like a joker in the game of cards. You know, if you don't have the joker, you'll never be able to solve, or you'll never be able to win the game. By that, what I'm trying to say is we can amalgamate with every other specialty in medicine. And whenever, today also I have students, residents listening to this talk, I believe that knowledge of psychiatry will always help every other fraternity to be a better whatever. You know, if gynecologists, they can be better gynecologists. I'm saying this because before entering in psychiatry, I had practiced about 5 years as a medical officer in remote area in Nepal, where the lack of psychiatry knowledge really made me a very bad doctor, I must confess. So with that knowledge, I always tell other fraternity that you should have knowledge of psychiatry, mental health, to be a good surgeon, to be a good physician, whatever. So I'm very glad that in this session we had a renowned cardiologist talking about the spirituality, which is very much apt to my understanding of psychiatry. Thank you very much, sir. Once again, I think we are getting a lot of questions in the chat. So may I read it out?
Yes, but before asking this question, there are eminent personalities with us like Dr. B.N. Gangadhar, Dr. Murthy, Dr. Alan Fong, and Dr. S.C. Tiwari. If there are any comments, please short 1 or 2 line comments from them, then we will ask the questions. Right?
Right, sir.
Dr. Gangadhar, please.
Comments from B.N. Gangadhar, sir.
Professor Pratima Murthy was also there.
Sir, you can go to question and answer session, sir.
Okay, no problem.
Can I come in, Saha?
Dr. Srinivasa Murthy, yeah.
Okay.
Sir, please.
Dr. Masu, it was a brilliant presentation. You took away everything that I would have said and hopefully say a little bit in the next session. I think you have really hit the nail on the head by pointing out the inherent purpose of spirituality, inherent place of spirituality. I want to add just one idea. India has been always a pioneer in looking at resources other than the traditional resources for mental health care. Let me give you the idea of Vidyasagar, how he brought family into the treatment when the rest of the world was talking family as toxic. Similarly, 30 years back when Deepak Chopra went to America and started talking about yoga, I still remember Jama wrote a lot of negative articles saying that, why are you publishing it? This is all nonsense and other things. Today it's become mainstream. But I agree with you that you made a very interesting observation. Spirituality care is part and parcel of medicine. We must go beyond just thinking of it as a resource, making it an integral part of the resource, like we have done it with various other psychosocial interventions. Thank you very much. And I think we'll have a much better understanding by the end of the day, all of these things. And I only urge the Indian Psychiatric Society to take up an action plan rather than just hold seminars and forget about it. Develop a 5-year plan to collate stories of ordinary people, patients, and therapists and disseminate it to people, because stories go a long way. I'll mention some of them in my work with cancer later. Thank you very much. Brilliant presentation.
Thank you, sir.
Saha, sir, your audio is mute, sir. Please unmute, sir.
Yes. It is a question from Dr. Harihar. Is there a need to train our medicos in their undergraduate course? Elements of spirituality building up a cultural competence across all major religions or school of spirituality. Sir, please.
Oh, absolutely. I think there's an old saying, always catch them young. You know, their brain has not been devastated with a bunch of nonsense. So it's better to catch them young. I think there should be at the end of their non-clinical years, which is 1.5 years in most places like United States of America or in India. At least in my time, that was first MBBS is after 1.5 years. Before you start clinical medicine, I think there should be a topic where you should be taught about yoga, you should be taught about spirituality and how to treat patients. Another important thing that Dr. Srinivasa Murthy, I think indirectly also pointed that the whole concept of palliative care, and I can't more agree with Dr. Nirmal that psychiatry is one specialty that goes into every aspects of medicine. So if you are not appropriately trained to understand psychiatry and patients, you become a failure as a medicine. So these are the topics that should be taught at the beginning of their clinical years. which should include palliative care, rehabilitation, spirituality, yoga, should be taught all over the world. And as I said, even Harvard Medical School is trying to see how they can incorporate yoga into their medical school. There's no reason why every institutions in India should be having this, whether it is allopathy or any other pathy, I don't care. But every medical student should not come out of the gates of medicine without having a formal training in these subjects.
I think we don't have much more question.
Thank you, sir.
Dr. Tiwari, sir. Dr. S.C. Tiwari, sir. Sir, unmute yourself, sir. Dr. Tiwari, please unmute yourself.
Can I be heard now?
Yeah, sir, you can.
Okay. So it was a great presentation by Dr. Basu about spirituality and how it can enhance different aspects of medical practice and mental health practice. We know that spirituality plays a great role. We have
A small request from the
saying-
organizing committee, as this is an international conference, we want to be on time. Question and answers can be kept on hold for some time. I am very sorry for saying so. We thank Dr. Indranil Basura sir and Gautam Saha sir and Dr. Professor Nirmal Lamchan sir for their excellent presentation. Gautam Saha
Yeah.
sir, we request you to kindly accept our token of appreciation for being part as a chairperson. Thank you, sir. Thank you, Gautam Saha, sir. We thank Dr. Nirmal Lamchane, sir, for accepting to be part of the chairperson. Thank you, sir.
Thank you.
Thank
Thank
you.
We thank Dr. Indranil Basura, sir, for delivering an excellent session and being the first batsman. Thank you, sir.
Thank you.
Thank you, sir. Now, we want to go to the next session by Professor Alan Fung. He's going to talk on collaborations between mental health and faith communities in enhancing global mental health. Now, I call on to the stage our chairperson, Dr. Arvind Brahma, sir, from India. We welcome you, sir. Dr. Arvind Brahma, sir, is Director, Consultant Psychiatrist at Girindra Shekhar Clinic, Kolkata. He is Lecturer, Indian Psychoanalytical Society, Kolkata, and is Honorary General Secretary, Indian Psychiatry Society. Sir is GC member, Rehabilitation Council of India. He is fellow, NAB, Indian Association of Private Psychiatry. He received several awards like Siddharth Memorial Award, Dr. Bohra IAPP Award, Leelavati Bolnath Award, IRS Reddy Award, Varanasi Award, Bhagavat Award, Marfati Award, Mother Teresa Sadbhavana Award, Dr. R.B. Davis Oration Award. He has more than 50 publications in international and national medical journals, including 4 book chapters. We welcome you, sir. We welcome our second chairperson, Dr. Shihan Williams. He is professor in psychiatry in the Faculty of Medicine of National University in Sri Lanka. He is currently Secretary General of SARC Psychiatry Federation. He is immediate past president, Sri Lanka College of Psychiatrists. He is fellow of Royal College of Psychiatrists, UK. He had his postgraduate training in research from University of Oxford, UK. He is a researcher with more than 60 peer-reviewed publications and won Presidential Research Award in Sri Lanka. He is involved in development of psychiatry services in Sri Lanka and is a consultant to government and NGO organization. His areas of interest are geriatric psychiatry and dementia. We welcome you, sir. Now I request Arvind Brahma, sir, to introduce our speaker.
Sorry. Dr. Shihan William is the Vice President of the SARC Psychiatric Federation.
Sorry, sir.
Okay.
So, good morning and welcome everyone in the second session of today's conference. That is on a very important topic, the faith healer's role and the spirituality and this mental health, its effect on mental health. And today we have speaker, Professor Alan Fung from Canada, who is currently the chair, World Psychiatric Association section on religion, spirituality, and psychiatry. He's also the vice chair, American Psychiatric Association caucus on spirituality, religion, and psychiatry. He is president, APA Ontario District Branch, medical director, Mount Sinai Hospital Wellness Center, University of Toronto, Faculty of Medicine, Toronto, Canada. He's a professional fellow, Wildlife College, University of Toronto, research professor, Tyndall University, Toronto, and steering committee member, APA Mental Health and Faith Community Partnership, co-editor of the book Ethical Consideration in Psychiatry and Religion, advisory board member, Conference on Medicine and Religion in USA, fellow of Royal College of Physicians of Canada, diplomat, American Board of Psychiatry and Neurology, and diplomat in Behavioral Neurology and Neuropsychiatry, United Council for Neurology Subspecialty. So may I request Dr. Alan Fung to start his deliberation without wasting much time. Over to you, Dr. Fung.
Thank you very much. So good morning, everyone. It's my great pleasure to be here with all of you today, talking about the collaborations between mental health professionals and community and faith communities in enhancing global mental health. And these are some of my disclosures, no financial conflicts. Once again, I want to thank the organizers, Professor Reddy, Professor Kishan, for their kind invitation to be here at the International Conference on Spirituality, Mental Health and Wellness. Before I formally begin my talk, I would like to just spend a moment to pay tribute to the late Dr. F. Sharma, who was the chair of the WPA section on religion, spirituality, and psychiatry, and who unfortunately passed away in March last year. He was a global guru in the field of spirituality, religion, and psychiatry, and we all miss him dearly, and his passing is a great loss to the field. I would like to again just thank Dr. Ray, for the excellent talk on spirituality, the science of spirituality. If you ask 10 people the definition of spirituality, you may actually get 12 different definitions, because everyone has their own definitions of spirituality, and some people may have more than one definition of spirituality. I like this definition, which talks about spirituality as a feeling of connection to something greater or simply connectedness. With technology, it's great that I am connected with all of you, even though I'm on a different continent, and we are connected through the internet. So for my talk today, I would like to briefly go through the topic of spirituality and religion and mental health and illness, and briefly talk about the professional guidelines on this topic and psychiatry. I'm going to spend most time talking about collaborations between mental health professionals and faith communities. We'll briefly touch upon some ethical considerations when we approach these collaborations. And I'll just mention about some implications for international and national psychiatric associations. So why care about spirituality and religion or religiosity? Most people worldwide identify with some form of spirituality or religiosity. So in America, at least 4 in 5 Americans self-identify with spirituality or religiosity. More than 80% of the world's population identifies with a religious tradition, even though there is an increase in the group called spiritual but not religious in the US. Certainly in South Asia, we know that spirituality and religion has a long tradition and plays an important role in different societies, even though there are a lot of diversities in terms of religious faith traditions. In psychiatry or mental health, I think we can all think about different areas, how spirituality will intersect with mental health or mental health care. For example, in the caring for patients with psychiatric disorders, end-of-life issues, bereavement issues, the use of spirituality in treatment modalities like meditation, mindfulness-based interventions or prayers, or in the treatment of addictions like the 12-step programs. And Blas wrote in this article that psychiatry and religion can intersect in different ways in assessment, intervention, and in understanding each other, but there could be some confrontations as well. In this book, Blossoms in the Valley, my colleague, retired psychiatrist Dr. Thomas Choi from Toronto, have written some common grounds shared by psychiatry and religious faith. So both interested in human person as a uniquely integrated being with multiple domains of facets, both point to an immaterial aspect, the psyche or the soul, beyond the physical body. Both are concerned with well-being of the whole person. Both seek to help individuals achieve a better life by acquiring better health or becoming a better person. Both stress the importance of community. And certainly from the research literature, we know that patients want spirituality addressed. More than 80% of Americans or Canadians stated that religion or spirituality is important. 53% of psychiatric patients in Canada in this study thought it was important to have spiritual religious issues addressed. 80% of older adults in the States preferred including religion and spirituality into therapy for anxiety and depression. In this Canadian study, Marilyn Bass, she actually surveyed 1,200 psychiatrists registered with the Royal College of Physicians and Surgeons of Canada, and also more than 150 inpatients, psychiatric patients. And more than 50% of psychiatrists reported belief in God, but 71% of patients actually reported belief in God. Psychiatrists were significantly less likely than patients to attend religious services or engage in private spiritual religious activity. Now, 47% of psychiatrists indicated that it was appropriate to often or always include spirituality or religion as part of a psychiatric assessment. 50% said they often or always did so, although only 17% of the patients said that psychiatrists would often or always do so. Also, even though 55% of psychiatrists said they would at least occasionally do referrals to clergy members, 83% of patients said that psychiatrists never did so. So this is what we could say a religiosity gap between psychiatrists and patients. And indeed, almost half of patients thought it's important to know the religious orientation of the psychiatrist. Also, different studies have reported both protective and maybe some harmful influence of spirituality and religion on health. For example, high level of spirituality and religiosity have been associated with happiness, lower rates of depression, lower rates of suicide, decreased substance use, decreased mortality, but might also have been associated with higher rates of obesity, decreased adherence to medical treatment, or even justification of neglect, abuse, violence, or persecution. Again, these data, come from different studies, and one could dispute the findings, but we can say for sure that there are actually different roles how spirituality and religion can affect health and mental health. Professor Harold Koenig, who is a speaker later today, has stated the following: persons with high level of spirituality and religiosity are typically those with the least resources. They could be the minority groups, the poor, the uneducated, both in terms of finances and access to healthcare resources. So SR could actually be viewed as acting counter to an evolutionary force that's trying to weed genetically vulnerable people from the population. And SR involvement is providing the weak with a powerful belief system and a supportive community that enables them to survive. So I want you to keep that in mind, as we talk about the mental health and faith community collaborations. Certainly, the role of spiritual well-being for mental health has been especially important during the COVID. This was a study from Italy. They found that SR practices protective factors connected not only with psychological and mental, but also physical health. And Harvard Divinity School actually put together, some spiritual resources during the COVID pandemic. So I think I hope I have convinced you that SR is important for mental health and illness. What should psychiatrists do? So the American Psychiatric Association, among other national organizations, have published some guidelines on the role of how psychiatrists should approach spirituality and religion. This book, A Religion and Psychiatry Beyond Boundaries, edited by Peter Verhagen, among others, from the WPA, had also touched upon some professional guidelines. But the Royal College of Psychiatrists in the UK have put together concretely some recommendations for psychiatrists on spirituality and religion. And the position statement was authored by Professor Chris Cook from the UK. Later, the WPA had developed this position statement on spirituality and religion in psychiatry, spearheaded by Professor Alexander Moreira Almeida, who is also a speaker later on today. Many of you might be familiar with this position statement. So I'm not going to go into details, but I want to say that in this position statement, there are 7 points emphasized on how psychiatrists should approach spirituality and religion. Point number 5 in particular is most relevant for today's discussion. Psychiatrists, whatever their personal beliefs, should be willing to work with leaders or members of faith communities, chaplains, and pastoral workers, and others in the community in support of the well-being of their patients, and should encourage their multidisciplinary colleagues to do likewise. So you can see that internationally, it's actually recommended that psychiatrists collaborate with faith communities. So how do we do that? A couple of years ago, my colleagues and I at the WPA, we have published this article talking about the importance of international partnerships for international well-being. Back in 2011, I had published in an op-ed article in the Globe and Mail in Canada. In that article, I was talking about the role of culture in mental health. I have emphasized that collaborations with respected community leaders, such as clergy members, could significantly assist in both the recognition of mental health issues and adherence to treatment. And indeed, studies have shown that clergy members play an important role in mental health care. For example, this study published back in 2003 had talked about that clergy members actually provided more depression counseling than physicians. This article published in 2008 talked about how often faith leaders or clergy members have been sought to provide interventions in mental health, though most, 71% reported feeling inadequately trained to recognize mental illness. And it called for the need for collaboration between mental health professionals and clergy members. This is another article from the UK talking about the barriers and opportunities for clergy members to become a resource for mental health. And they also found that a lot of the clergy members, they had low confidence about managing psychiatric problems, as some might have anxiety and fear and stereotyped attitudes towards mental illness. So in 2014, the American Psychiatric Association, at that time under the presidency of Dr. Paul Summergrad, had actually formed something called the Mental Health and Faith Community Partnership with the Interfaith Disability Advocacy Coalition. And this partnership had different goals as listed here. Mainly, they want to establish a platform for mental health professionals, especially psychiatrists, to have dialogues with faith leaders. And you can see that, they were very ambitious, in the goals. So create new resources to train religious leaders about mental health issues, create new resources that are useful to psychiatrists about faith and faith communities in mental health recovery, acknowledge and address the stress and mental health needs of clergy members, improve mental health education offered in seminaries and pastoral and continuing education programs, and explore ways for medical schools and psychiatric residency programs to address the importance of faith and spirituality, etc. So, like I said, the main goal is to facilitate collaboration among the two professions. And it's important to keep in mind that faith leaders are often gatekeepers or first responders when individuals and families face mental health or substance use problems. So the partnership has a website from the American Psychiatric Association website. It's www.psychiatry.org/faith. And on that website, you can find a video about this partnership that was formed in 2014. We actually had a meeting of around 40 psychiatrists and faith leaders in Washington, D.C. at that time. So for those interested, you can take a look at the video. But I think the more important thing is, at that time, we, as the steering committee of the partnership, had actually developed a guideline, a guidebook, and quick reference guide for faith leaders, mental health, a guide for faith leaders, and quick reference guide on mental health for faith leaders. And both documents are downloadable for free from this website. So in this guide, we had laid out the basic information about different mental health conditions. And also this quick reference guide, provides some fast facts and important facts for faith leaders, and also, warning signs that they should be watching for, and some statistics. We are not trying to turn faith leaders into mental health professionals. They are not, and they should not regard themselves as mental health professionals unless they've also been trained in the mental health profession. But they should be first responders, and they should know how to respond to crisis situations. And in the quick reference guide, we have put down, what are some red flags to raise immediate concerns that urgent mental health care should be sought. Suicide certainly is a big topic, and how and when to make referrals. At that time, we had also collaborated with political figures like Representative Patrick Kennedy from the States. We had also partnered with local organizations to hold conferences to train faith leaders in mental health issues. That was a conference that the partnership had co-organized with a group in Toronto, working group for the promotion of mental health in faith communities. And we had a conference held in Toronto to train faith leaders on mental health issues. So that was back in 2014, 2015. In the ensuing years, there were some activities of the partnership, but the APA has, as you can imagine, many different agendas. So spirituality and religion is not the top priority for them. But fortunately, last year, there's been renewed interest in this topic. So we had another meeting just in October last year in Washington, D.C. again. It's kind of like a follow-up to the original partnership meeting back in 2014. And 35 psychiatrists and mental health and faith leaders gathered together in Washington, D.C. To talk about has this kind of partnership evolved over the years, or what are some opportunities and barriers for these kind of collaborations to happen. So I just want to mention that we actually had a Hindu representative, Swami Sravapriyana, from the Vedanta Society of New York, who was present at the convening. So at that conference, there were many different sessions, but I just want to highlight one session on that day that would be relevant to today's discussion. In that session, we had actually invited several psychiatrists and also representatives from the US government to talk about building bridges, models for creating faith-based community connections to mental health care. So these were some of the speakers. But I want to highlight this document and this organization. They are the US Department of Health and Human Services Center for Faith and Opportunity Initiatives. They're called the Partnership Center. They have actually published this excellent document, Compassion in Action, a guide for faith communities serving people experiencing mental illness and their caregivers. So we won't have time to go into all the details of this document, but I highly recommend that you actually Google this document, and the whole PDF file, 44 pages, is available for free. Because in this document, they have actually provided very helpful guidelines and principles for faith community leaders who are interested in doing more work in the area of mental health. And we know that faith communities, faith traditions are very important for people who might be experiencing mental health issues and also the caregivers. So in this document, they have actually organized 7 different principles. I'm just going to touch upon them briefly one by one. The first principle is the inherent dignity principle. So for faith leaders who are wanting to work with people with mental health issues, they should affirm the inherent dignity of every person, recognizing that mental illness affects a large number of people and many may be at risk for experiencing mental illness. So the principle asks that we consider the language we use to talk about and to people with mental illness, and that we include the gifts, experiences, and abilities of those experiencing mental illness in the ongoing life of our community. And the guidelines recommend that faith leaders know the facts about mental illness, listen, speak respectfully, and try the best to reduce social isolation of these people. So what are some facts that faith leaders should keep in mind? Now, again, these statistics are from the US, but in 100 people, 20 may have mental illness, 8 may have received mental health services, 4 may be living with serious mental illness like bipolar disorder or schizophrenia. The second principle that faith leaders should keep in mind is the illness principle, which is the acknowledgement of mental illness as an illness. So faith leaders are encouraged to know that mental illnesses result from a complex interaction of biological, psychological, and environmental factors. So mental illness is not a lack of belief in a higher power or the result of sin or wrongdoing. So with this illness principle, faith leaders are encouraged to take advantage of opportunities to learn about different mental health conditions, as well as the signs and symptoms, so that they can know how to participate in the lives of people with mental illness and to provide care and support when needed. Action items for the faith leaders include affirm a definition of mental illness for their community, put compassion into action, and pursue education and training in mental health concerns, and leverage the expertise in the community. These are 3 areas that faith leaders are encouraged to know about mental illness. So number 1, mental illnesses result from a complex interaction of biological, psychological, and environmental factors. Number 2, mental illness can be serious illness. Number 3, mental illness can be diagnosed by a mental health or medical professional. So these sound simple, but I can tell you that, if faith leaders can keep these principles in mind in their work, that would really help a lot of people. The third principle that faith leaders are asked to keep in mind would be the caregiver principle. We understand mental illness impacts families and caregivers. So this principle recognizes the need for faith leaders and faith communities to affirm the responsibility to all families, including families experiencing mental illness. So they should leverage the strength of the faith communities to connect with caregivers and may consider respite care. The fourth principle, the professional assistance principle. So it's important for faith leaders to recognize that mental illness requires professional assistance. So the professional assistance principle asks faith leaders to encourage someone who have signs and symptoms of mental illness to connect with a licensed mental health professional and provide assistance in gaining access to care when necessary. So again, these are some action items for the faith leaders. Know the signs and symptoms of mental health concerns. Identify mental health professionals in the area. Connect with mental health professionals and support access to care. So these are some of the signs and symptoms that faith leaders are asked to recognize. And also in that document, faith leaders are provided information on the different types of mental health professionals. Again, these are from the American context, and also resources about professional mental health organizations. The fifth principle that faith leaders are asked to keep in mind would be the treatment and medication principle. So faith leaders are asked to encourage participating in recommended psychiatric treatment, including therapy and, if necessary, medications. And it's important that faith leaders keep in mind that this is part of person-centered care. Again, you can go into the document for details. The sixth principle that faith leaders are asked to keep in mind would be the complexity principles. We understand mental illness can be a challenging, lifelong journey. So through the complexity principle, faith leaders are asked to keep in mind that people experiencing mental health challenges and their loved ones have complex issues, and faith leaders should enter these relationships with humility, empathy, and compassion to learn about the challenges that these people are facing. The last principle is the hope principle. Faith leaders are asked to recognize and celebrate that people with mental illness can get better. So people with mental illness, they are characterized by stability, not cure. As the wellness journey begins and moves towards stability, faith leaders have the opportunity and privilege to walk with them through peer support and other volunteers in the faith communities. So this document is the most comprehensive document that I've seen in providing some guidelines for faith leaders and faith communities who might be interested in helping mental health, like individuals with mental health issues. In this Washington, DC convening that I was talking about for October, some psychiatrists also talk about their own work in this area of building collaborations with faith communities. So Dr. Green and Dr. Hankerson, for example, they talk about their work in New York City in the Harlem area. They had collaborated with a large Baptist church with more than 10,000 congregants in developing a center called the Hope Center in providing mental health care to a lot of people in the Harlem community. And they had actually developed this principle called the faith model of community engagement, FAITH. Form a strong partnership, assess the community's need, identify leaders who will support, take time to set the context, honor the community's culture. Another psychiatrist, Dr. Farha Abbasi from Michigan, also talked about her work over the past 2 decades in establishing collaboration with the Muslim community in terms of mental health and faith community partnership. So she had helped inaugurated the Muslim Mental Health Consortium. And for those interested, you can take a look at the website for further details. In Canada, I've also done various work in this mental health and faith community partnership. I had organized conferences in this area, partnering with hospitals, University of Toronto, and also through co-founding this working group for the promotion of mental health in faith communities. I've organized conferences. I'm not going to have time to go into details, but just to say that as psychiatrists, I think we can all try to do our part in establishing collaboration with faith communities. I also have faculty appointments at Tyndale University, which is a large Christian university, and also at the Wycliffe College at the University of Toronto, which is an Anglican theological college at the University of Toronto. So in these institutions, I've taught courses on mental health to seminary trainees, and I've been asked to speak at different events. So these are just some, ways of how, as psychiatrists, we can do our part to collaborate with the faith community. For further information, we have a chapter in this book, Spirituality and Mental Health Across Cultures, edited by doctors Maria Almeida, Paz Mosquero, and also Dr. Dennis Brewer. So we have this chapter talking about collaborations between the mental health and faith communities and international perspectives. So I've shared my perspective, but also my co-authors have shared their perspectives as well. In particular, in this chapter, you'll find more information about the work that Dr. F. Sharma and his wife, Dr. Sujitha Sharma, had done over many decades with the Brahma Kumaris in mental health promotion. Also, I will just quickly mention that the WPA had organized a roundtable discussion between psychiatrists and faith leaders. That was back in 2016. It was chaired by Dr. Sharma and Dr. Sujitha Sharma and myself. We have also played key roles in this roundtable discussion, and we had generated some themes and principles when we want to think about this kind of collaborations. So we know that SR plays an important role in mental health for coping with human sufferings, as well as for facilitating the pursuit and attainment of purpose and meaning of life. Both professions have long been working together with similar goals in caregiving and mitigating human sufferings and enhancing human well-being. There are different paradigms and parlance used in the two professions, which have at times led to conflicts, and it would be important for the two professions to collaborate in order to address mental health needs of the general population. So some steps in establishing and enhancing collaborations could be building trust, identify facilitators and barriers of collaborations, and also identify and establish best practice models for integrative or collaborative care between spiritual care and mental health professionals. Also identifying core competencies, establishing best practices for training for both the mental health and spiritual care professions. So just in the interest of time, I'm just going to quickly mention that whenever we approach this kind of collaborative work, it's important to keep the core bioethical principles in mind. So autonomy, beneficence, non-beneficence, and justice. The APA had published recently in 2021 this resource document on ethics at the interface of religion, spirituality, and psychiatric practice, which has partly addressed...
Professor Allen, 5 minutes more. Okay.
Sure, thank you. Yeah, so which partly addressed some of the ethical considerations. This book that I had edited with Dr. John Petit and Marilyn Dell had also addressed some ethical considerations at this intersection. Lastly, I just want to mention about some potential implications. So at the WPA, we have the section on religion, spirituality, and psychiatry. And I'm the current chair. Professor Chris Cook is the co-chair, and Dr. Bruno Paz Mosquero is the secretary. And we are trying to do something similar as the APA in terms of mental health and faith community partnership. We're trying to collaborate with APA on these endeavors, and also to encourage individual countries to establish similar partnerships. So since the IPS has organized this conference, I would strongly encourage the IPS to consider whether it might be feasible, or what might be what might be feasible, for the Indian or the South Asia context in terms of such mental health and faith community partnership. So I just want to thank all of you for your attention, and I welcome any questions. Thank you.
Thank you, Professor Allen, for your very elaborative discussion on this very important aspect of collaboration between mental health professionals and the faith communities at different level. Basically, we know that throughout the history, we have seen this different religious and spiritual leaders and also these faith communities. They have played a very crucial role in promoting mental health. And I can say in our country, where we have more than 140 crores population and we have only 8,000 plus psychiatrists, it is nearly impossible to provide mental health care at all levels, especially people who are residing in the remote rural areas. It is not possible for them to get the proper mental care. And a major chunk of the population, they are treated by these traditional faith healers for a long time. And while I was also involved in the community mental health project in Sundarban region, which is a very remote area. So I found the 70% of the people, they are treated by these traditional faith healers. So we cannot ignore their role. Rather, what now we have mentioned, this WHO has started and other professional organizations have started, that we should collaborate with them, we should train them. That is most important. We should train them, and then they can be of very useful tool for promoting mental health. They will not treat, but at least they can identify and they can give a positive advice to the persons who are suffering from different mental illnesses or mental problems. And you have rightly pointed out that WHO has also recognized this. So they have started this specialty section on religion and spirituality in psychiatry, though at one point of time it was debatable. And in India also, Indian Psychiatric Society has started a similar type of task force on spirituality, you know. So thank you once again for your nice talk. May I request my co-chairperson, Dr. Shen, for a brief comment. Over to you, Shen.
Thank you, Professor Fang. I think very clear lecture. You had nicely formulated the ground, the basis of our collaboration, because it is no doubt a very tricky area. And we need to be clear on the guidelines, the ethics, and the collaboration. It opens a wide array of questions as to what extent we should collaborate and to what extent we should set our boundaries, and where we need to make sure that psychiatry is not also diluted and mistaken to be just a part of spirituality and wellness, but beyond that, where we need to address key mental health illness issues. So thank you very much for putting it in perspective. And I think we should encourage more space for spirituality and religion in our forum for discussion. Thank you.
Thank you.
Professor Allen, there is a question from Suhasini Reddy. That is, Western countries have a well-placed system where the clergy or chaplain is associated with the hospital to address the mental health issues of the clientele or patients. The same is lacking in India. How do we take this forward in a hospital setup?
So, so I should mention that. So first of all, I think certainly in Western countries, chaplains are available in hospitals, but the partnership that I'm talking about are not limited to the hospital settings. And we are talking about wide collaborations like with faith leaders in the community beyond the hospital settings as well. So, so I think such kind of collaborations are possible, not only in health institutions, but in terms of the specific issue of chaplaincy in hospitals in India, I have to say that, you know, I'm not familiar with the local factors limiting the setting up of faith leaders in hospitals in India. So I don't know if other faculty members, you know, would have any insight on that.
Okay, there is another question from Dr. Gurvinder Pal Singh. Is like hyper-religiosity, hyper-spirituality has any clinical implications or adverse effects?
certainly, as I mentioned, there could be potential benefits and also harms from spirituality, religion on mental health. So I think later on today, Professor Harold Koenig, in his lecture, he will address in greater details the potential benefits, but also harms of spirituality and religion. But definitely, there could be clinical implications and adverse effects of hyper-religiosity, which could affect adherence to mental health treatments, or also even hope. Some people, when they are undergoing mental health issues, they may feel hopeless. So if they're hyper-religious, they may have excessive guilt, and they could, have poorer prognosis. But I'm going to defer to Dr. Koenig, for more detailed discussions on these.
Thank you. I think there is no more question. So we can now close this session. So thank you very much, Professor Allen, once again for the wonderful talk. Thank you. And thanks to my co-chair, Dr. Sheehan, also for joining. Okay, over to the organizers.
Thank you.
Thank you to Professor Alan Fink for giving an excellent session on collaborations between mental health, faith communities in enhancing global mental health. Now I request Dr. B.N. Gangadhar sir to felicitate our chairperson, Dr. Arvind Brahma sir. Felicitation material. I request Kishan sir to join. Thank you, Arvind Brahma sir. We thank Dr. Shehan Williams sir for accepting to chair this session. Thank you, sir. Shehan sir, please kindly accept our felicitation material.
Thank you very much. I am in receipt of the felicitation material. Very privileged and honored. Thank you.
Thank you, sir. Now I request Professor Alan Fink to accept our felicitation material.
Thank you very much for sending this to me. Thank you very much.
Yeah. Thank you, sir. In 2 minutes, we are going to start the inaugural session. Thank you, sir.
Since we have this 2 minutes interval, first of all, Assalamu alaikum to Professor Afzal Javed. Such a joy to see you. And my respects to my esteemed teacher, Professor R. Srinivas Murthy, whom I can see here. Sir Pranam. To my very dear friends, Dr. Gambhira, Dr. Mohandas, Dr. Tiwari, Dr. Shehan Williams. Well, I also see in the group people who have really made it happen, and my pranam to Dr. P. Raghurami Reddy, my dear friend, Dr. Gangadhar, my younger brother, Dr. G. Prasad Rao, and above all, the real workforce, that is Dr. Kishan and Dr. Sai Krishnan, for making this event happen. Thank you very much, all of you, and a very good morning.
We are starting the inaugural function. Sabak Namaskaram. I'm requesting Dr. N.N. Raju, today's presiding officer and president, IPS National. Sir, please come over to the dais, occupy the chair. Today's chief guest, Dr. Abdul Javed, President, World Psychiatric Association. Sir, welcome you, sir. Sir joined us in by Zoom, and is always well-wisher. In the last year also, he joined as a chief guest of SARC Conference of Spirituality. Thank you, sir. And as today's guest of honor, Dr. B.N. Gangadhar, President, National Medical NMC, and Dr. Peter J. Verhagen, another guest of honor. He came from Netherlands. Then my elder brother and chief advisor of this conference, Dr. Prasad Rao, President, Asian Federation of Psychiatric Associations. Next, I'm requesting Dr. Arabinda Brahma, Vinay Kumar, sir, President-elect, National IPS. Dr. Arabinda Brahma, very dynamic secretary of National IPS. Sir, please come over to this. And, thank you very much for all national office members who came personally, Arabinda Brahma, N.N. Raju, sir, and Vinay Kumar, sir. Now I am requesting Treasurer of IPS, Dr. Alim Siddiqui, to join by Zoom. There is some emergency in the family, but still, Alim, thank you, Alim ji, for joining, because some...
Thank you, sir. Thank you for the invitation.
For a brief time, he may stay, and thank you, sir, for joining with the respect of your difficulties. Now I am requesting editor, national editor, Dr. Om Prakash Singh, IPS editor. Thank you, sir.
Thank you, sir.
Yeah. Now I am requesting Naresh Varlamani. There is also an emergency in the family of Varlamani. He was in village, remote area. Probably he may join shortly. And I'm requesting Dr. George Reddy is joining shortly, physically. Before handing over to the presiding officer, respected N.N. Raju, Naresh Varmani, welcome you, sir. He's a national coordinator for my section, EC coordinator. There is some emergency problem. They went to village, but still he joined. Thank you. Respected presiding officer, Dr. N.N. Raju, President IPS, and Secretary Arabinda Brahma, and today's chief guest, Dr. Abdul Javed, and guest of honors, Dr. B.N. Gangadhar, Dr. Prasad Rao, chief advisor of this conference, and Dr. Peter J. Verhagen, as guest of honor. And I'm welcoming Dr. Raghuram Reddy as a distinguished guest and organizing chair of this conference. Delegates, psychiatrists, and other medical practitioners. There are 700 registrations till now, and welcome George to come out to the dais. Telangana State Branch President, Indian Psychiatric Society, Telangana State Branch. Please come out to the dais. Bouquet to George. and editor Om Prakash Singh ji, and treasurer Alim Siddiqui, and Naresh, George. Thank you very much for all for joining this inaugural function. And good evening to everybody who are observing. Almost 700 doctors, even other medical practitioners, including psychiatrists. Good morning, everybody. First of all, I want to express my thanks to N.N. Raju sir and his EC has given complete freedom for me to arrange all these things. Thank you, sir. I'm really, since last 6 months, he's encouraging me to go ahead, whatever you, that is a really affectionate touch for me, for whole EC members of IPS National. And thank you very much to Dr. Prasad Rao, who is guiding me always as a chief advisor. Dr. B.N. Gangadhar is the chief patron of this conference, and Dr. Raghuram Reddy. Both are my gurus and legendary psychiatrists who are guiding me in selection of the speakers, as well as about organizing this conference. Thank you, sir. I bow my head, and you are always for your blessings for me. And another guest of honor, Dr. Peter Javaragan, he came all the way from Netherlands to attend this function. He is very interested to, actually, he has to participate in the evening function, but he came one day back only to join in our conference from morning to evening. He is not moving anywhere. Thank you, sir. And thank you very much to Telangana State Branch, under the leadership of Dr. Raj Reddy and Telangana State Branch EC for giving cooperation and guidance to me. And I'm also telling thanks to Uday Kumar, President. He came here, just went to temple visit, and for his cooperation and guidance for me. I think organizing, we have done a wonderful job under guidance of both Gangadhar and Raghuram Reddy. Here I'm quoting Dr. Ajit Awasthi and Mohan Das sir. They are guided me in selection of speakers. We selected all speakers are from different countries, not from India. That is a significantly you can see. And we have, under guidance of Ajit Awasthi and other senior doctors, most of the panelists are very, very senior legendary psychiatrists from India. We are going to listen their wisdom today in panel discussion. I bow my head. I think their acceptance as a panelist and for their humility and their spiritual evolution. And they're all my well-wishers, and I think MS Reddy is going to have a very big show after inaugural function, as usual, by wonderful moderating skills. And with this few remarks, thank you very much for all my department, Prathama Institute of Medical Sciences, postgraduates, Dr. Spurti, Dr. Shweta, all these persons, and Dr. Pavan, Secretary, Telangana State Branch, all these persons helped me, Dr. Sai Krishna, a wonderful team we are having. All credit goes to my team, my well-wishers, blessings of Raghuram Reddy and Gangadhar. Whatever the credit goes to them, and if any mistakes, I will try to certainly own the mistakes which happen. I think it may not happen anything. Thank you. With this, I'm handing over to the proceedings presiding officer, Dr. N.N. Raju sir, President, National President, Indian Psychiatry Society.
Very good morning, all. Might be afternoon or evening in some other parts of the world. Real pleasure to see the chief guest, Dr. Afzal Javed, who has been continuously supporting the activities of Indian Psychiatric Society. Welcome, sir. The luminaries who are sitting on the dais, Dr. Gangadhar, the friend of every one of us here. Happy to see Dr. Peter, I'm sure Vahan, or the way in which it is pronounced. Welcome to you, sir, for having traveled all the way to India. Dr. Prasad Rao, the guide, the driving force of all these meeting, and also I think he has been specifically interested in the spirituality and psychiatry, and he was literally, literally planning the entire how best the spirituality can be imbibed and can be part of psychiatric education. Thank you, Dr. Prasad Rao, to be here. My colleagues, Dr. Vinay Kumar and Dr. Arvinda Brahma, and friends and supporters, or whatever name you give it, Dr. George Reddy and his group, and of course, Dr. Kishan, who has been single-handedly doing this job, which is amazing. Amazing when you see the list of guest lectures or the people attending online. I think it really wonderful, I would say that. This is something which we cannot really, no words of appreciation is enough to, I think IPS is grateful to you, Dr. Kishan, and also we are happy that you could be able to bring so many people together. I think this is what basically, finally, the spirituality would teach us, bring all people together and have the pleasures of sharing whatever it is. So I'm happy to see the group of people who are all good friends of ours online, both physically, what we have addressed, and online I have Dr. Lakshmi Naresh Vadlamani. I'm sorry that there is something urgent which he needs to attend, and Dr. Om Prakash and Dr. Aleem Siddiqui, and rest of the people on various platforms and also in various corners of the world. I think, as I said, Dr. IPS has always, Indian Psychiatric Society has always been enriched with people who would work, individually and can bring laurels to the society. Today, only yesterday we were observing Foundation Day in Mysore, where Indian Psychiatric Society was established along with, I think, the independence of the country. So over the years, many senior colleagues, many senior teachers, like our own teachers, have worked very hard to bring to the stage where it is a powerful force to reckon with. So I'm happy that younger generation are trying and their best to carry the legacy for which the Indian Psychiatric Society was established. So once again, I see a lot of senior friends like Dr. Ajit Avasthi, Dr. Mohandas, and others who can guide us, who can give us in crisis, who can really give proper advices to see that what best that can be done. At the end of the day, the health of the society is paramount. Both the members of Indian Psychiatric Society and the society, the public, whom we owe everything what we are today, to serve them. So we are happy about that. And as a president, I think this is a high of at the fag end of my tenure. I'm really happy that I still have people who invite you to the meetings, even though you're almost on the way out. So when I was seeing, Google was telling me that I had visited 82 cities in the last 1 year, that means a big number for me. That means almost two cities in a week is something which is amazing. Thank you so much. So once again, spirituality, as we said, is one thing which Dr. Kishan has been working, almost as an individual mission. And we can show today's meeting, all his hard work, all his efforts, and the team he has, so nice. The hospitality, the arrangements are absolutely top class. So once again, I invite all the international speakers and I'm really happy to have the leader of every one of us, the president of World Psychiatric Association, Dr. Professor Afzal Javed. Sir, welcome to you for on this very nice, beautiful morning in Hyderabad. I'm sure you must have, why I'm sure, I know that you have visited us many number of times, and we seek your guidance, blessings in further achieving the goals of IPS. Thank you, sir, being here. And I see series of, very many number of internationally very, what would I say, very highly intellectual speakers in the list. And I thank them for having agreed to deliver lectures across. So thank you so much. And without much we'll go ahead with our program. I request all the guests on the dais to come and lighten the lamp and to inaugurate the function.
Kurutvam kalyanam arogyam dhanasampadam Shubham kurutvam kalyanam arogyam dhanasampadam Shatru buddhi vinashaya Deepajyotir namostute Deepajyotir namostute Shubham kurutvam kalyanam आरोग्यं धनसम्पदम् शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदम् शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोस्तुते दीपज्योतिर्नमोस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदम् शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदम् शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोस्तुते दीपज्योतिर्नमोस्तुते शुभं कुरु
I request the President, Telangana State Branch, Dr. George Reddy, for his brief message.
Sorry, sir, there is a prayer song.
गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि गानचतुराय गानप्राणाय गानान्तरात्मने गानोत्सुकाय गानमत्ताय गानोत्सुकमनसे गुरुपूजिताय गुरुपताय गुरुकुलस्थायिने गुरुविक्रमाय गुह्यप्रवराय गुरवे गुणगुरवे गुरुदैत्यकलक्षेत्रे गुरुधर्मसदाराध्याय गुरुपुत्रपरित्राद्रे गुरुपाखण्डखण्डकाय गीतसाराय गीततत्त्वाय गीतगोत्राय धीमहि गूढगुल्फाय गन्धमत्ताय गोजयप्रदाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि
Respected chief guest for today's program, Professor Afzal Javed Saab, President WPA. Namaste Saab. And today's guest of honor, Dr. B.N. Gangadhar sir, Dr. G. Prasad Rao sir, and Dr. Peter J. Vahagan sir, and our beloved President of the IPS National, Dr. N. Raju sir, and our Honorary General Secretary, Dr. Arvinda Dada, and our beloved President-elect, Dr. Vinay Kumar sir, and Dr. Alimbai, who is over Zoom, Dr. Om Prakash sir, and the organizing secretary for today's program, Dr. Kishan sir. I think he definitely deserves that. And Dr. Raghuram Reddy sir, the International Conference on Spirituality and Mental Health and Wellness. At least I thought I'll just take a few minutes to talk from my heart. I think the way I am looking at spirituality and my practice, I see that there is a bipolarity in the practice. That's how I see, because in our Indian context, the two yes, one is spirituality, other is superstition. I think that's where I think we see the two poles. So when we try to see spirituality and superstition, I think that's where our role stands as psychiatrists, particularly in Indian context. The role of spirituality and when mental health and wellness, I think we should be the people who should take the forefront. And thanks to Dr. Gangadhar sir, because the way he's trying to project the spirituality and mental health on scientific basis, I think that's where we are really trying to look at spirituality in a new way. And his great Shishya, Dr. Kishan sir, I think he's influencing me, and definitely Dr. Raghuram Reddy sir, who is a Jiddi Krishnamurti follower, but still he defines spirituality in his way. So I thought, why not we look at spirituality in our daily practice? And I think it's really helping me to get more connected to our patients, particularly Indian context. It could be any religion. They come from Christianity, they come from Hinduism, they come from Muslim. But there I always try to emphasize the two poles. Spirituality and superstition are two different things. And I think we need to really look at spirituality as a subject which needs to be discussed, and we should talk about the scientific basis of mental health and spirituality. Without taking much time, I should really thank Dr. N.N. Raju sir, Dr. Arvinda Dada, and the entire IPS team for giving us through Dr. Kishan sir, allowing Telangana State Branch, and Hyderabad being a favorite place for many of us. I think, hope Dr. Peter sir will enjoy our hospitality here, and the good feedback Dr. Kishan sir gave about Dr. Peter, I think it was overwhelming. A person who came with a lot of expertise to talk about this subject. I think definitely we are lucky, sir. Hyderabad, we are lucky to have you here. And my last word will end. I think the IPS will have an pre-Dr. G. Prasad Rao sir era and post-Dr. G. Prasad Rao sir era. I think he has been doing a lot of things, and he's after his presidentship, at least I'm seeing all the presidents after that very active, and everyone are doing wonderful job to see that we people are getting more active into IPS, and at least youngsters are showing inclination towards being a part of IPS. And Dr. N.N. Raju sir, I think we had a wonderful term with you, sir. And Dada, Arvinda Dada, I think really we enjoyed your term, and hope we will continue to be with Dr. Vinay Kumar sir and take up the IPS to new heights, and a wonderful program. With these few words, and I think I'll end my talk. Thank you one and all for giving me this opportunity.
Thank you, Dr. George. Dr. Naresh, are you online? Dr. Naresh, are you available? Yeah, you are there. Please. He's the EC coordinator of this section, and I request him to. I can see your screen, Dr. Naresh. Okay, then we'll come back to you. Dr. Om Prakash, our editor, Indian Psychiatric Society. Yes, Om Prakash, OP Singh.
Good morning, sir. Respected President Dr. N.N. Raju, the guest of honor, our respected Dr. B.M. Nandar, sir, Dr. Rao, Dr. Peter J., Dr. Vinay Kumar, Dr. Arvindo, and a lot of dignitaries, WPA President, Professor Afzal Javed, Dr. Professor Ajit Awasthi. So there are a lot of dignitaries, and my pranam to everyone, my respect to everyone. This is such a program where we see the changing the landscape of psychiatry. And this program organized by Dr. Raghuram Reddy and Dr. We know that whatever he does with heart, commitment, and appreciation is such. And he's also very meticulous. How many calls we have got, we don't know. In his busy schedule, he has time to check everything. So again, my regard to P. Kishan sir. And we know that spirituality is going to be very, very important because a lot of patients, when they're some thought, some talk, something to go beyond themselves helps them. So I will not take much time. And again, I give my regard to Dr. Ellen Fang, who is also the Asian American Caucus member, and he has presented well. So my regards to everyone, and I know that this conference will be a milestone in this. Thank you, sir.
Thank you. Naresh, are you back?
Yes, sir.
Yeah, please give your message, Dr. Naresh.
Thank you, sir. Thank you very much, sir. Respected President, sir, Dr. N. Raju Garu, and the Honorary Secretary, Dr. Brahma, sir, and the Organizing Secretary, Dr. P. Kishan, Organizing Chairperson, Dr. Prasad Rao Garu, and the Chief Guest of Honor, Dr. B. N. Gangadhar Garu, and the Vice President, Dr. Vinay Kumar, and our State President, Dr. George Reddy, who are on the dais, and Dr. Peter, who is on the dais. It's my privilege to have few words on this conference. It's a fantastic conference. I think it's the second in the series. I think the first one we had last year as well, and it was well received. And this year as well, continuing the same, the spirituality conference, the theme being the health and wellness. And I wish it a grand success. It is well organized. The organizing committee has made every effort. And one of the chief architects, one of the chief backbones is Dr. Sri Krishna, who has done a wonderful job. And I wish it a grand success. Thank you very much.
Thank you, Dr. Naresh. Now I request the Treasurer of Indian Psychiatric Society, Dr. Alim Siddiqui, to say a few words.
Thank you so much, sir, for inviting me. My respect and regards for Dr. B. N. Gangadhar, sir, Dr. Afzal Javed, sir, Dr. Peter, the team IPS being ably led by Dr. N. Raju, sir, and all the senior members. I see Dr. Ajit Awasthi, sir, P. Mohandas, sir, G. Prasad Rao, sir. So all the dignitaries on and off the dais, my respect and regards to you. I think spirituality is one of the component of a comprehensive mental care package, if you can say that. So in that regard, this conference is very important. As already has been told, that many people are delving into it, sometimes rightly, sometimes wrongly. So I think by the time the conference ends, we have a path how to take care of this aspect and how to bring it to our patients and to improve the well-being in general. So my respect and regard to all of you, especially Raghurami Reddy sir and P. Kishan sir. As OP sir just said, so many calls and reminders that you just cannot miss this conference. Over to you. Thank you, sir.
Thank you, Dr. Alim. And we have
a small request from the organizing committee to give brief messages in view of time management. Thank you, sir. And please don't repeat all the names in view of time management. Thank you, sir. Sorry, sir.
Thank you, Dr. Sai Krishna. But the people in positions, in chair, it is good music for them to listen to the voice repeatedly that you are doing well, you are doing well, you are doing well. And I am enjoying that. Anyway, thank you so much for reminding it. Anyway, so we have Honorary General Secretary of Indian Psychiatric Society physically here. I request Dr. Arvind Brahma to it.
Namaskar. Good morning. I am not repeating all the names as just now suggested, but respected Dr. N. Raju, the President of Indian Psychiatric Society, and the entire office bearers team of the Indian Psychiatric Society, in short. Our today's guest of honor, respected Dr. Gangadhar sir, my mentor, my guide, Dr. Prasad Rao sir, Dr. Peter, and also the Telangana State Branch led by Dr. George, my dear brother, along with, I can see Minaj, Pawan, Vishal, everyone is present here, and the organizing secretary, Dr. Kishan, who is really doing a wonderful job on this particular topic, this spirituality, for a long time on behalf of Indian Psychiatric Society. So give a big hand to Dr. Kishan. So as we know that like Royal College of Psychiatry or like American Psychiatric Association or World Psychiatric Association, they all have given the importance of religion, spirituality, and psychiatry. Indian Psychiatric Society has also started this spirituality and mental health task force, and this task force is really doing wonderful job for last few years. And we are always blessed that we are guided by Professor Dr. Gangadhar sir. And today I can see here Professor Ajit Awasthi sir, Professor Dr. Mohandas, Professor S.C. Tiwari said, the senior psychiatrists, our mentors, our guide in IPS, who are always helping us, guiding us, especially while we are doing something which is a bit deviation from the original track of psychiatry, like this religion and spirituality. Because we know till date, in most of the textbook, there is nothing about religion and the role of spirituality in psychiatry, in most of the textbook. But from Indian Psychiatric Society, we always want that the spiritual history taking should be included. It should be incorporated in the history taking, because in our context, this is very important. And I hope Professor Gangadhar sir is here, so we can, in future, we can incorporate this. And also in the textbook, the importance of spirituality and religion. Basically, in this biological era, while we are talking only about DSM, ICD, and all these neurochemicals and neuroreceptors, but it has been found that some non-dominant areas of brain that are involved in the, while we are talking about the spiritual values, that is working there. So there is some biological basis also. Maybe in the future, the research will reveal that. So I don't want to take much time. Once again, I want to thank the Telangana State Branch and the conference team led by Professor Dr. G. Prasad Rao sir and Dr. Kishan sir for inviting us today here. Thank you. Thank you very much. I hope the conference would be a great success.
Thank you, Dr. Arvinda. I request Dr. Vinay Kumar, the President-elect, and who would be,
President of IPS, Dr. N. Raju, and entire team IPS, including our spirituality section team, led by Dr. Kishan, advised by Dr. Prasad Rao sir. And the most important thing, we have a guest from the land of Van Gogh. From the land of Van Gogh, I think. Am I right, sir? So that is a very important thing for me, that you are representing a country which gave such a genius to the field of art. Probably art lies in between material world and the spiritual world. It connects. Poetry lies in between material world and the spiritual world. Afzal Javed Sahab, President of World Psychiatric Association, is listening. I would like to dedicate a couplet of Firak Gorakhpuri to him. That couplet says, "Tu khudi mein doob kar paja surage zindagi, tu agar mera na ban sakta, na ban apna to ban." Tu khudi mein doob ke paja surage zindagi. If you want to know the clue of life, be of yourself. Delve in yourself. If you are not mine, doesn't matter. Be yours at least. I think this talks about spirituality, and this also indicates that all cultures, all religions have talked about spirituality in some or different way. Rather, I would say in this way that all religious practices, all religions talk things in a different way, but when the component of spirituality comes, when they talk about the spirituality, they talk in similar language. So that is the beauty of spirituality. Dr. George Reddy was saying that at one end superstition, another spirituality. I would like to correct him by telling this, that one end religious practices, other end spirituality. Superstition, I think, is another kind of, it goes down to another level, not up. So so why this has happened? Because science of psychiatry was not all the time something. But all cultures have taken care of physical health, mental health, well-being, using their own resources. And spirituality is the most effective inner resource. All religions, all cultures have realized this. That is the reason all cultures and all religions talk about spirituality. And real saints always talk about spirituality. And real saints of all cultures, all religions talk in same language, and they don't believe in fighting and other things. So this is the message I would like to communicate, that spirituality has been a very important component in taking care of mental health for centuries and centuries and centuries. Now, with the advent of scientific knowledge, things have changed, but the amount of treatment gap we have, we must realize that science cannot give answer to all the questions. You need to look towards other disciplines, other way of thinking, other dimensions of human intellect and human feelings and all. So that is important. With this, I congratulate our team spirituality section led by Dr. Kishan and advised by Dr. G. Prasad Rao and convened by Dr. Sanchari Rai, that the team is doing extremely well, and you are continuing the tradition which was started by late Dr. Avdesh Sharma, and we published a very important book on spirituality and psychiatry, and this book was having more than 600 pages, and now we are going to have second edition. Our lead editor is Dr. Gangadhar Saab, coupled with Dr. Anju from in AIMS, and Rajshri Rai from Kolkata. And on 6th only, we had a meeting of all the authors. I must tell you that authorship again is international one. So there was a kind of international meeting on 6th. And by the end of this year, or probably during midterm CME, we will be releasing this book on spirituality. Thank you very much for inviting me.
Thank you, Dr. Vinay. Your literary skills are all to the fore. We request now the guest of honor who has traveled all the way from Netherlands, Dr. Peter Varajan.
Well, dear colleagues, it's said that your country is the center of spirituality in this world. So it's almost a pilgrimage to travel from the Netherlands to India and to be here. I thank you very, very much for the invitation and the opportunity to be here. It's, of course, an honor and a pleasure to be involved and to take part in this international conference on spirituality and well-being, mental health and wellness. And I congratulate, of course, the organizers and the task force on spirituality and mental health, especially Dr. Reddy and Dr. Kishan for their efforts. And they managed really to create an extraordinary program. And of course, we also thank all the volunteers for their assistance. One of the tasks we had set ourselves as we founded the World Psychiatric Association section on religion, spirituality, and psychiatry was to connect with special interest groups on spirituality and religion around the world. And colleagues from India became involved from the very beginning. And among others, I want to mention the name of Professor Emeritus Srinivasa Murthy. He was and still is one of our first advisors. And I'm very grateful for his support and the support of many others. Unfortunately, as Dr. Basu Rai already explained, despite the abundant amount of evidence with regard to the importance of spirituality and religion in mental health, mainstream psychiatry still seems to be reluctant to integrate these findings and data in clinical practice. And therefore, a lot of work still needs to be done. And for that reason, of course, we welcome conferences like today's international conferences. And again, I congratulate you with this conference. I wish you all a very inspiring event. Thank you so much.
Thank you, Peter, for your nice words and also explaining the spiritual across the world. Now I request Dr. G. Prasadarao, man of all places and all seasons.
Mr. President, this is an Indian Psychiatric Society, and I respectfully greet all the executive who has given the opportunity to me and Kishan to conduct this wonderful international congress. I am particularly happy that I might remember this day once more, apart from my other days which happened in my life. Mainly because I'm personally connected to spirituality and religion. And not only that, me and Kishan in Jerusalem for about 4 years back wanted to do a standalone congress. Unfortunately, because of COVID, it did not happen. But both of us did not lose heart. We lost our dear friend Avadesh Sharma during this time. But COVID also lost an standalone congress at Hyderabad. We have done last year an international congress, and today once again we are doing an international congress. So one of the happiest day for me. The other reason, I don't want to talk about spirituality because there are a lot more. I'm particularly happy because all the people connected, starting from my elder brother, my mentor, Professor Afzal Javed, WPA, has been giving a helping hand all through this year and supporting us. Thank you, Afzal Bhai. I know we wake you up at 5 o'clock. Apologies. But I know today you will remember Hyderabad and this meeting for a much longer time. We have with us Peter, who probably can be considered as a historic figure in the WPA for life. You were the founder, secretary and chair also, if I remember. You started the session. So thank you for coming and being here. I know you have come a long way. The only message for us, apart from the happiness further, is my 3 teachers are being felicitated in this Congress. It's always a pleasure that I'm sitting with my own teacher on the dais, Professor B.N. Gangadhar. Very mild person to look at, but very serious and intelligent person inside. I learned my first baby steps of spirituality at Bangalore from him. Then I have Professor Ajit Awasthi, who has mentored me in psychiatry and spirituality. If everyone remembers, his presidential address is Spirituality in Elderly. He is another person who does silent interlinking of spirituality to the psychiatric curriculum. And my third teacher, I would say, there are a lot of teachers. Today we are felicitating Dr. S.C. Tiwari, who is my PhD guide. And all of these people contributed to spirituality. I have the whole IPS team supporting us. And particular thanks to Kishan. He is always there. He somehow brings everyone from the world. We miss Avadesh Sharma today. But this particular Congress I want to dedicate to Avadesh Sharma with all your permission. Thank you very much.
Thank you, Dr. Prasadarao. Now I request our guest of honor, Dr. B.N. Gangadhar, the face every one of us knows pretty well.
Yeah, I wish the entire organizers the very best for the conduct of this meeting. I personally congratulate Dr. Kishan. To be very brief, I quote a Sanskrit verse. Kshanasha kanashaschaiva vidyamarthancha sadhayet gruhita iva kesheshu mrityuna dharma macharet. Lead a spiritual way of life, expecting that your death is around the corner. Just as much as you spend every minute and every pie to earn knowledge and earn money. So with this message from the Subhashitas, let's all practice ourselves first the spiritual way of life before putting that into practice for our patient care. And wish you all the best once again. Thank you so much.
Thank you, Dr. Gangadhar. And we have Dr. Raghuram Reddy sir online, who, as Dr. Kishan was telling, is a teacher of every one of us, a highly respected figure, and guide wherever, whenever. I think all of us had taken help from him, be it spiritual or be it professional or be it personal. So, sir, are you able to listen? Are you there, sir? Yes, you are there, sir. Sir, please go ahead. Give your message, sir. And blessings.
All right. Presiding officer, my friend, Dr. N.N. Raju, the chief guest, Dr. Afzal Javed, dignitaries on the dais are like enlightening stars on the sky, enlightening the inaugural function of the conference. The Dr. Afzal Javed, South Asian origin, he has a soft corner for Indians, psychiatrists, and I know him. Many people know him. He is a great figure. He is the president of the World Psychiatric Association. Then we have Dr. N.N. Raju, presiding officer. He is a great clinician. He was an administrator in Vizag, superintendent of the Government Hospital for Mental Care, and vice principal of the Andhra Medical College. And he was a backbone of the IPS, also as a national secretary and now president of the Indian Psychiatric Society. He is a very friendly and approachable person. Thank you, sir, for permitting us to organize this conference. Then we have Dr. B.N. Gangadhar. A great psychiatrist. He was interested in biological psychiatry research, ECT, etc. Later on, a lot he has done in the area of spirituality and particularly yoga and mental health. There is a saying, in simplicity, there is subtlety and depth. And that's what we observe in Dr. B.N. Gangadhar. He's a very deep person with great humbleness. If I join the young psychiatrists, when I say young psychiatrists should probably emulate him in many things. He was rightly the director of the NIMHANS, and he did many things. He transformed many things there, and he has now special assignment in mental health at the national level in Delhi. Thank you for coming. And Dr. Ajit Avesti, I know him from a long time, and he was the past president of the IPS in 2010, and at that time he had talked about spirituality, and he has conducted 50 funded projects and 350 scientific papers, and he is being rightly felicitated along with Dr. B.N. Gangadhar. We are very proud of the fact that Dr. Verhagen is attending from Netherlands, and he has written a great book on spirituality and psychiatry, and he is interested in Islamism and Islam, and also Indian perspectives of spirituality. And he has said in his speech that India is the center of the spirituality. And Dr. G. Prasad Rao, past president of the IPS, he is founder director of the Asha Hospital, and his special interests are schizophrenia and psychopharmacology and spirituality too. We have with us the honorary director, the secretary of the secretary, treasurer, and editor of the IPS. Thank them for coming. And a few observations, if I am permitted to make. Psychiatry is supposed to have two sources of knowledge. One is clinical case study of psychiatric cases, and number two, philosophy, which included psychology. Psychology as a separate discipline has come hardly in the last 200 or 300 years back. Till then, it was dealt with by philosophy. Philosophy is sort of wrongly understood. Philosophy included basic sciences like physics, etc. And it means understanding and knowledge. It included scientific way of knowledge. See, mainstream psychiatry, in my opinion, has missed many important elements, like William James, Bertrand Russell, who wrote about analysis of mind in 1940s, and David Bohm, a psychophysicist who has talked about dialogue in therapy and particularly about thinking and thought, and what is called necessity of the role, or necessity as a phenomenon guiding the human behavior. Unconscious, not Freudian unconscious, but the original unconscious. Bilardinov has written a lot about it recently. We don't find a mention of these things. And Buddha is known as the first cognitive therapist, rightly. He, very in brief way, he said dependent identifications are at the center of suffering of the humanity. The spirituality and religion were misunderstood, and there was bias against their practices by initial psychiatrists. Freud went on to say it is the opium of and when he said it's an opium, he was referring to not the original religion, but organized religions. I think one thing basically, spirituality and religion are unitive. The whole humanity comes under their consideration and suffering of the humanity. Whereas almost every religion, major religion, has later gone into the hands of organized psychiatry and division. Instead of unitive, original religion, it was divisive. Individuals became more important than human beings, and groupism. In the name of, as the thinker said, in the name of religion, we are trained to kill each other. That is the role of different perspective of religion, where hierarchy, prejudices, authorities, who started interpreting Buddha, Prophet's teachings, instead of interpreting, they were intervening and downgraded their teachings. Every prophet was for human suffering, mitigating human suffering. And once it passed on from the organic psychiatry, organized psychiatry, whole problem started. And for example, Prophet Muhammad said of what is called brotherhood. All human beings come under that. For example, Swami Ranganathananda said, Islamism is a very democratic religion where brotherhood exists. Similarly, Advaita Vedanta of India, where there is no inequality. But once these things went into organized religions, there were divisions. Buddhas went on to Hinayana and Mahayana, Hinduism, Shaivism, Vaishnavism, etc., etc. So division groups. And we should, the cognitive element in spirituality. Spirituality, somebody defined as freedom from prejudice and divisions, and lot of cognition. You see, the organized religions depend upon belief and faith and less on cognition. That's where Buddha differed, and he became the first cognitive therapist. I think as now the interest and cognition of spirituality and religion are increasing, we are becoming more aware of their role. We would be again, probably, we will be not only mitigating an individual suffering, but the whole humanity will come under our attention, and we will be able to prevent wars and violence, etc. And see,
Sir, there seems to be some internet disruption. Go ahead. Okay, sir, I think as we are running short of time, probably we'll come back to Dr. Raghuram Reddy Garu once he gets reconnected, because can't wait, because we don't know how long will it take for us. Shall we go ahead? Thank you, sir, Dr. Raghuram Reddy Garu, for giving us details not only about the spirituality, but about all the speakers who are part of this program. And I think for the audience, I should tell that he was the medical superintendent at the age of 32 or 33 and has been a professor since then. And he worked for more than 26, 27 years as administrator, professor, and lot of roles he has done, principal, and all. Right, thank you. So we find the most important message and of our leader, Dr. Professor Afzal Javed. Sir, you're welcome.
Thank you very much, Professor Anand Raju. Respected members and officers of Indian Psychiatric Society, President of Asian Psychiatric Federation, President of SARC Psychiatric Federation, and dear friends. Once again, our colleagues from India has really done a marvelous job in organizing and repeating this particular message about the importance of spirituality and religion in mental health. I'm impressed that at this meeting, apart from those who have got a special interest in spirituality and religion, the meeting is attended by many past presidents of IPS. That certainly shows the continuity of leadership that is prevalent, and that is very, very a moment of proud for all of us at a professional society level. And then having people from the neighboring countries, Sri Lanka, Bangladesh, Pakistan, Nepal, that again shows the leadership of Indian psychiatry in terms of taking this particular topic across the region. And I'm personally grateful to the members of the WPA section on spirituality and religion, especially Peter, who has come all the way from Netherlands. And actually, WPA owes a lot to this section for highlighting the importance of this particular topic in the field of mental health. I always say, and I mean it, spirituality and India, that goes side by side. India is the motherland of this particular concept of spirituality and religiosity. And thanks to people like Professor Gangadhar, who have brought this particular topic, which was more a socio-cultural topic, into the science. And I think this is what is required at this moment, that we need to highlight the importance of this particular topic, bringing into the scientific field and making it a scientific discipline in terms of promoting the concept and the practice of this particular area. I would like to thank our Indian Psychiatric Society and other psychiatric societies who are represented in this meeting to kindly follow what Indian psychiatry is doing in promoting this particular concept. And I do hope a couple of things the organizers and all those who are interested in the field of spirituality will look into it. For example, we want to promote this field in the curriculum of our psychiatric trainees. But a step further, some exposure of this particular topic in the undergraduate medical education will also be very helpful for our future dimensions. I do hope that this particular group, and especially the members of WPA section on religion and spirituality, they will be able to formulate some modules for medical students, trainees, and higher trainees on this particular topic. And we will be very pleased to add those modules on the WPA's educational portal. Dr. O.P. Singh is here, who leads a very important journal, not only in the regional psychiatry, but also at the international level. I think it may not be a bad idea to have a special supplement of this very prestigious Indian Journal of Psychiatry, especially asking people from different parts of the world to bring this particular topic to the attention of scientists, to the practicing psychiatrists, and to the academicians. I once again thank the organizers on my personal behalf and on behalf of the World Psychiatric Association. And of course, today is a very important day that Indian psychiatry is emphasizing on the role of religion and spirituality. But at the same time, we do miss our dear friend Avdesh Sharma, who was a very important international person in this field, and he was just highlighting the importance and the contribution of Indian psychiatrists and the Indian subcontinent psychiatrists in this particular field. Avdesh, we miss you, but at the same time, whatever you have started, I can assure you that not only your Indian colleagues, but also your international colleagues will continue highlighting this particular subject and topic in our future discussions. Thank you very much, Professor Raju. Thank you very much, IPS. And we hope that Vinay Kumar will continue the legacy of the Indian Psychiatric Society like many other presidents that we have seen and who are present here. Thank you very much. And hopefully all of us will be gathering soon at the NSIP as well as at the Kolkata South Federation of Psychiatrists meeting. Thank you very much.
Yeah, thank you, Professor Afzal Javed. And it's indeed a matter of pleasure to recall that World Psychiatric Association has been in the forefront in organizing many psychiatry and spirituality webinars. And thank you, sir, for all your messages and good blessings. Would be happy to see you in Bhubaneswar in ANSIPS. Thank you all, and we have a very pleasant duty now to felicitate two of the giants in Indian Psychiatric Society, Dr. B.N. Gangadhar and Dr. Ajit Avasthi. I request Dr. B.N. Gangadhar to occupy the chair to have us the pleasure of felicitating you.
We are doing felicitations to B.N. Gangadhar and Ajit Avasthi in the inaugural function. This is a decision of organizing committee to celebrate their contribution to spirituality and psychiatry in general. Now, I'm requesting the organizing team, please. Please. Now I'll come. Shall by the President and Peter, as well as please. Certificate by Dr. Jaj Reddy and Prasad Rao. Minhas, please come over here. Rajesh, President, HPS. Citation. Now I'm requesting Sharanya to read the citation.
Good morning, everybody. I take the privilege of reading the citation of Dr. B.N. Gangadhar sir, who is a well-renowned psychiatrist in the field of research nationally and internationally. He was born on 3rd of October 1955 in Bangalore, India. He received a degree of Bachelor of Medicine and Surgery from Bangalore Medical College in the year 1977 and a Doctorate of Medicine in Psychiatry from NIMHANS in the year 1981. He then joined as a faculty in the Department of Psychiatry at NIMHANS in 1982 and got promoted over the years as professor and head of the department. He also underwent specialized training in psychiatry for a year at Vienna University, USA in 1987. He received Doctor of Science from Vyasa University for research work in the field of yoga and mental health in 2012 and from Rajiv Gandhi University of Health Sciences in 2022. He is a former senior professor of psychiatry and director at NIMHANS, Bangalore. He is currently Professor Emeritus for the Department of Integrative Medicine. He has been appointed as the President for Medical Assessment and Rating Board, National Medical Commission India in 2020. Dr. B.N. Gangadhar held many prestigious positions. He served as the chairman of the Biological Psychiatry Section, Indian Psychiatric Society from 2009 to 10 and was the president of IPS Karnataka chapter in 2012-13. He is the chairman of the Ethics Committee at Indian Institute of Science and Rajiv Gandhi Institute of Chest Diseases since 2013 and chairman of section on yoga, Indian Psychiatric Society since 2015. He served as the associate editor of the journal Acta Psychiatrica Scandinavica for 12 years and is presently the deputy editor, Asian Journal of Psychiatry since 2008. He has been an examiner of MD and DPM examinations for several universities since 1999. Dr. B.N. Gangadhar is a recipient of more than 150 awards for several publications and works. Among them, some prestigious ones are the Padma Shri Award, M. Visvesvaraya Lifetime Achievement Award, C.V. Raman Award, Dr. D.S. Raju Memorial Oration Award, Professor N.N. Vig Oration Award, and Dr. D.L.N. Murthy Rao Oration Award. He is the co-author for about 29 PG award papers and 74 other award-winning presentations. Dr. B.N. Gangadhar is a member of several organizations like Indian Psychiatric Society, Indian Brain Research Organization, Indian Association of Biological Psychiatry, World Federation of Societies of Biological Psychiatry, Central Council for Research on Yoga and Naturopathy, Task Force for Integration of Ayush with Allopathy, etc. He is a fellow of IPS, National Academy of Medical Sciences, and Royal College of Physicians, Edinburgh. Dr. B.N. Gangadhar has pioneered in integrating yoga as therapy for treating mental and neurological disorders and established an advanced center for research in yoga. He has guided several PhD, MD, and PG students along with students who are currently doing research work. He received major research grants from several national and international agencies and was the principal investigator in many research projects. He has over 420 publications in high impact factor journals, published 3 books and 24 book chapters. He is actively involved in science popularization programs on the radio and TV and has written many popular science articles. He organized numerous national and international conferences, symposiums, workshops, and delivered over 350 public, plenary, and invited guest lectures. Sir, with great honor, the organizing committee of the International Conference on Spirituality in Mental Health and Wellness has unanimously decided to felicitate you for your contributions in the field of psychiatry and spirituality, for spreading mental health awareness among the public, and also in educating many young psychiatrists in becoming successful in their careers. Thank you, sir.
Please come and join. Photograph. Yes. Please come here, sir. Come here, sir. Response from Gangadhar, sir.
Thank you, sir. At the outset, let me thank profusely the organizers for felicitating me. I'm also very happy for the liberal citation that was read out. Not that I necessarily deserve it, but hopefully that would be some form of, as was mentioned by Dr. Raghuram Reddy Garu, this could be some example for younger people to follow. Not that I want them to necessarily follow this either. Thank you very much.
Thank you, sir, for your blessings and accepting our invitation to get for the facilitation. Thank you very much.
Thank you very much, sir. Sir, I'm requesting all the dignitaries on the dais only. Next felicitation to Ajit Avasti, sir.
I wish, Professor Avasti, sir, I wish you are here physically.
Yeah.
Thank you.
Yeah, this is a material we sent to Ajit Avasti, but I'm requesting Madam Avasti to do felicitation. And I'm requesting technical team to focus on the Ajit Avasti's video. Yeah. Madam, thank you, madam, for giving bouquet. And sir, please sit down, sir. The technical team. Yeah. So, shawl. Is there any, if there is a garland, you can do.
It's okay. I think bouquet is good enough. I had once put garland on around her neck, and she had put one around my neck, and that is the eternal bond between the two of us. So that's good enough.
Memento, sir. Memento. Memento certificate.
Yes, there it is, sir.
Then citation. Then over to Sharanya to read the citation.
I take the privilege to read the citation of Dr. Ajit Avasti, sir. He is a very well-renowned psychiatrist in the field of research in psychiatry, nationally and internationally. He was born on 12th of August in 1954 at Srinagar. He received degree of Bachelor of Medicine and Surgery from Government Medical College, Jammu in 1978 and Doctorate of Medicine in Psychiatry from Postgraduate Institute of Medical Education and Research, Chandigarh in 1981. He was a former head and senior professor, Department of Psychiatry, PGI, Chandigarh, India. He is presently engaged as a consultant psychiatrist with TTVC Charitable Trust and CMC Hospital, Chandigarh and Fortis Hospital, Mohali. Dr. Ajit Avasti held many prestigious positions. He served as the chairperson of Indian Psychiatric Society Research, Education and Training Foundation from 2011 till 2021. He was the president, Indian Association for Geriatric Mental Health from 2017 to 2019, co-chairperson of the IPS Task Force on Revision of Clinical Practice Guidelines from 2015 to 2018, past president of IPS in the year 2010, and convener of task force set up by the IPS on formulating clinical practice guidelines from 2003 to 2009. Presently, he is the chairman tribunal of Indian Psychiatric Society. He was the associate editor of Indian Journal of Social Psychiatry and is on the editorial boards of many scientific journals published in India and abroad. He was the regional editor for South Asia of the Asian Journal of Psychiatry from 2008 to 2014. He was a member of Task Force Group and Project Review Committee of the Indian Council of Medical Research and was expert consultant to Government of Punjab for the State Institute of Mental Health, Amritsar, and member of project formulation committees for setting up state institutes of mental health in the state of Haryana and Union Territory of Chandigarh. He served as the chairman of Academic Committee of Government Medical College, Amritsar from 2012 to 2018. He is currently serving as a member in the institute body of JIPMER, Puducherry from 2019. Dr. Ajit Avasti is a recipient of more than 40 awards and orations. Among them, some prestigious ones are Marphasia Awards, which he received in 1989 and 2012, PPAI Awards, 1990, 99, 2005, 2008, and 2015 of the Indian Psychiatric Society, Dr. B.B. Sethi Award, 2012, Dr. G.C. Borrell Award, 2012 and 2017, and Dr. V.K. Verma Award, 2017 of Indian Association for Social Psychiatry. IAGMH Intas Award of Indian Association of Geriatric Mental Health in the years 2012, 2014, 2015, 2016, 17, and 18. He has delivered many orations, including the prestigious DLN Murthy Rao Oration of Indian Psychiatric Society and Venkoba Rao Oration of Indian Association of Social Psychiatry. He was awarded JKT Lifetime Achievement Award, Oration of Indian Psychiatric Society in 2021. He also won ICMR Dr. Vidyasagar Award for outstanding contribution to the field of mental health in 2014. He is a member of various national and international professional bodies. Among them, few are Life Fellow of Indian Psychiatric Society, Life Fellow of Indian Association for Social Psychiatry, Fellow International Society for Affective Disorders, founding member of Indian Society for Biological Psychiatry, member World Federation of Societies of Biological Psychiatry, and member of American Psychiatric Association. Dr. Ajit Awasthi was the organizing chair and secretary of more than 50 national and international conferences, CMEs, and workshops, including the Annual National Conference of Indian Psychiatric Society in 1990 and 2005, and Geron in 2017. He delivered more than 200 guest or invited lectures in meetings of professional bodies, has read more than 250 papers in national and international conferences, and served as faculty of nearly 200 professional developmental programs. He was the investigator of more than 50 funded research projects, has guided nearly 60 theses for PhD, MD, MS, MSc, DM, and MCH. He has published over 400 original research papers in reputed journals, edited 14 books in the field of psychiatry, and has contributed more than 60 book chapters. His areas of research interest are schizophrenia, anxiety and mood disorders, human sexuality and its dysfunctions, and consultation lies in psychiatry. Sir, with great honor, the organizing committee of International Conference on Spirituality in Mental Health and Wellness has unanimously decided to felicitate you for your contributions in the field of psychiatry and spirituality, for spreading mental health awareness among the public, and also in educating many young psychiatrists in becoming successful in their careers. Thank you, sir.
Thank you, sir.
Thank you, sir. Sir, would you like to give a response, sir?
Sir, a very brief response since we are running late and the rest of the program has to follow. A big thank you for this felicitation. Thank you very much. I hardly deserve it. Thank you.
Thank you very much. And today, Indian Psychiatric Society itself get honored by the presence of you two giants of Indian Psychiatric Society, sir. We have felicitated ourselves. Thank you very much, sir. Thank you, sir, and felicitation. Felicitations to the. I request Dr. George Reddy to come on to the dais.
George Reddy, please take out. President N.N. Raju sir and Gangadhar sir and Aravinda.
I think Dr. Naresh, I think we'll send the memento to him.
Naresh, felicitation already material sent to the Naresh.
And
Naresh is there?
Yes, sir.
Organize game to display the felicitation material to Naresh. Next. Yeah, go first.
Yeah, I think Dr. Om Prakash Singh is online. Dr. Aleem Siddiqui is online. I request Dr. Aravinda Brahma to.
Yeah,
we will send.
Madam Om Prakash doing felicitation.
Sir.
And even Naresh also got the felicitation material.
Somebody is with Naresh. Aleem
Siddiqui. Some problem is there. He may not participate and gone out.
No, that is
there. Thank you, Naresh. Thank you, Om Prakash ji, for accepting the.
Thank you.
By post.
Aleem, are you there?
Aleem, sir. Actually, he has to attend some. He told me that he is attending something.
Now we have Dr.
Function.
Aravinda, felicitation to the Honorary Secretary, Dr. Aravinda Brahma.
Sir Prasad Rao, sir, please. And Vinay Kumar, sir, for Aravind, future secretary.
Here is future.
Yeah.
Dr. Vinay Kumar, your turn now.
Yeah. Be fast.
Please.
Gangadhar sir, Prasad sir. And our president next. Memento by George Reddy.
Dr. Peter. Your turn. I'm sure Dr. Dr. Prasad Rao.
Prasad Rao. Sir, no, please. You are the important. Yeah. Let's list of it. Material. Sir, run, sir. Requesting MSRD to accept the felicitation. In advance, we are giving, sir. We will felicitate in a panel discussion. So this we are making in advance to take over. So Peter, please.
Thank you. Thank you for accepting our felicitations and
so yeah. No, first be done. So now the felicitation to N.N. Raju sir, President. Yeah, by B.N. Gangadhar, Prasad Rao, and Peter G. Sir has given freedom to our organizing committee. Thank you very much, sir, for giving free hand and encouragement and total EC of IPS. Arvinda ji, aye. I think we sent the felicitation material to the chief guest, Abdul Javed Sahab.
I've already received that. Thank you very much for that.
Please display technical team to display the. Next, vote of thanks by Pawan Kumar Kulakarni as the Secretary, Telangana State Branch.
I think.
Sharanya, please come and join. Thanks to everybody. And now vote of thanks by Pawan Kulkarni, Secretary,
1 minute.
Telangana State Branch, Indian
Just
Psychiatric
one.
Society. Yes, before that.
I think I know Dr. Pawan Kumar would be proposing vote of thanks, but before that, I think I, as a president of Indian Psychiatric Society, I have that responsibility and pleasure of thanking everyone who participated in this fantastic program. Already I thanked in my early message, but I think at the end, it has been a fantastic function, and all credit to Dr. Kishan and his good team of young people. Dr. Pawan is there, Dr. Sai is there, Sai Krishna is there, everyone. I think we have done, and Telangana Psychiatric Society branch under Dr. George Reddy has done a wonderful job. So we thank you, Dr. George Reddy, and of course the senior guidance like Dr. Prasad Rao, Dr. M.S. Reddy, and we are happy to have Dr. Gangadhar here and Dr. Avasti, who has always been our friends, and Dr. Vinay, our own team, Dr. Vinay Kumar, and also we see a lot of seniors, Dr. Shiv Gautam, I can see him, sir, your work for the Indian Psychiatric Society and sustained effort continuously. I think there are very few presidents who continue to contribute to the Indian Psychiatric Society. So even after relinquishing their offices. Thank you very much, sir. Dr. Mohandas is there. So thank you, Dr. Mohandas, for being there. And for I think teacher of every one of us here, Dr. Srinivasamurthy is there. I can see him. So, sir, thank you very much for showering your blessings silently. Thank you very much, sir. And I'm sure many, many seniors are there. If I miss their names, please do excuse me for that. But I'm Dr. S.C. Tiwari is there. As I said, I might be missing a few names, whichever I can see on the screen only. I am quoting them, but otherwise, on behalf of Indian Psychiatric Society and on my personal behalf, I thank every one of you for being there. And I also thank, of course, as I said, no words of appreciation would be good for Dr. Kishan for organizing such a wonderful, wonderful program. Thank you so much. So over to Dr. Pawan Kumar for the vote of thanks.
And it's indeed a great privilege and honor to deliver the vote of thanks for the conference of this magnanimity. And on behalf of the organizing committee, I thank today's chief guest, Dr. Afzal Javed, President, World Psychiatric Association, for gracing this occasion and sharing your thoughts. I thank today's guests of honor, Dr. B.N. Gangadhar sir, Dr. Prasad Rao sir, and Dr. Peter G. Vargan for accepting to be here. I thank IPS President, Dr. N. Raju sir, Dr. Vinay Kumar sir, President-elect, Dr. Arvind Brahma, Honorary General Secretary, Dr. O.P. Singh sir, Honorary Editor, Dr. Alim Siddiqui sir, Honorary Treasurer IPS, for all the support and guidance and being here with us today. I thank Dr. V.L. Naresh, EC Coordinator, and Dr. Sanchita Ray, Spirituality and Mental Health Specialty Section, for all the help extended. I thank our teacher, Dr. P. Raghuram Reddy, sir, for blessing this program and sharing his wisdom. I thank Dr. George Reddy, President, IPS Telangana State Branch, for his support. I once again thank Dr. B.N. Gangadhar, sir, and Dr. Ajit Avasti, sir, for accepting our felicitation, sir. I express a deep sense of gratitude and appreciation to all the distinguished speakers, chairpersons, panelists, and delegates and students who have come here and are online from different places of the world and making this event grand success. I thank all our organizing team patrons, advisors for their timely guidance and advices. I thank all our team members who have been working for the success of this program. I thank Sun Pharma for coming forward to sponsor this program, and I thank all the technical staffs who have been working at the ground level and hospitality section of Taj Deccan. Thank you all once again. Thank you, sir.
Next national.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
जय हिंद.
Excellent. I don't know what that is. Not the public announcement, it's personally. Good.
The inaugural ceremony is closed. Now in 2 minutes, we are going to start the next panel discussion. CV of MS Reddy, sir. Good afternoon. Now I welcome to the next session, panel discussion, spirituality in mental health and wellness. Now I request our moderator, Dr. MS Reddy sir from India, onto the dais. We welcome Dr. MS Reddy sir. MS Reddy sir had done his MD Psychiatry from Christian Medical College, CMC Vellore. He had done healthcare management at Indian School of Business. He's director of Asha Bipolar Clinic, Hyderabad. He's past president of Indian Association of Private Psychiatry, Indian Association of Biological Psychiatry, honorary secretary to Society for Bipolar Disorders, India. He's editor of Indian Journal of Psychological Medicine from 2006 to 2017, council member, Asian Network of Bipolar Disorders. He's council member for Asian Association of Neuropsychopharmacology. He's member of editorial board of World Journal of Biological Psychiatry and Asian Journal of Psychiatry. We welcome you, sir. Organizing team, Varsha. We welcome you, sir. Now invite next panelist, Dr. B.N. Gangadhar, sir. Next, I invite Dr. Shiv Gautam, sir. Sir is a legendary in Indian psychiatry. He is currently chairman of Committee on Clinical Practice Guidelines on Indian Psychiatry Society from 2005. We welcome you, Shiv Gautam, sir. Next, I invite Dr. R.S. Murthy, sir. He is currently working on developing emotional health self-care materials for persons living with cancer and caregivers of developmental disabilities. We welcome you, sir. Next, I invite Dr. E. Mohandas, sir. Next, I invite Dr. S.C. Tiwari, sir. Welcome, sir. There are 720 members online. This is a huge success for the organizing committee. Now I hand over to Dr. M.S. Reddy, sir.
Took it there. Guardian article.
Good afternoon, everyone. Actually, I should have told good morning, Now let us say good afternoon. Yeah. Now Sai Krishna here is an excellent room coordinator. I very sincerely follow his advice not to keep mentioning the names of all the people here, but I thank everyone for giving us the opportunity. Yeah, I specifically mentioned Professor Raju's name. He is the president of IPS here. And I must mention Padma Shri B.N. Gangadhar's name because he is the panelist here who is come here all the way to participate in that. Thank you very much, sir. Right, I had a brief chat with all the panelists. Today, I must name the panelists because all of them are very senior members. I can say legends in psychiatry, Indian Psychiatric Society. Professor Srinivas Murthy, actually, he was my examiner. He gave me the degree. Thank you, sir. And Professor Tiwari, Professor Shivagautam, Mohandas, you all know that. Walking encyclopedia. And Professor Gangadhar, I don't have to name Padma Shri Gangadhar, who is a professor and currently the chairman of NMC. Here, maybe in the Western parlance and Western language, we call them as maybe legends and then KOLs, but I call them gurus. We are going to have the wisdom of the gurus. I must say before I start my moderation, which I'm going to take about 5 minutes, Guru Brahma, Guru Vishnu, Guru Devo, Maheshwara, Guru Sakshat Parabrahma, Tasmai Sri Guruve Namaha. I do include Professor Raghuram Reddy also in this because he was my guru. Then on the lighter side, before I go on to the main topic, I was wondering actually, my basic interest is in bipolar disorders. What am I doing here in the topic of spirituality? I must thank Dr. George Reddy, who made a link. He said that in the spirituality, there seemed to be a bipolarity on one side, superstition, and on one side, spirituality. Thank you very much, George Reddy, for making me feel happy to stand here. And then also thank Vinay Kumar for now bringing out that one of the guests of honor today is Professor Peter. He's from Netherlands, the land of Vincent van Gogh. I think most of you know World Bipolar Day is on the birthday of Vincent van Gogh. So beautiful. I think I'm not missing my bipolarity even though standing on the stage here for the talk and for the moderation on spirituality. And I was trying to see what exactly is spirituality and trying to get the a definition. I think I'm going to take the wisdom from all the panelists. But there's in the previous two speakers, one of them said connectedness. Beautiful. Spirituality is connectedness. It's nothing like that. And then Vinay Kumar read out a couplet. I don't understand much of Urdu, but part of it I could understand. Khud mera in myself. I think that's one of the very important thing in spirituality. Here, 2 slokas I quote and then hand over to my seniors and gurus. Number 1, all the gurus here, why must we listen to them? There's one sloka in Bhagavad Gita. Yadyad acharati sresto tatta devetaro jano sayat pramanam kurute lokastad anuvartate. Sreshta, all these 5 words sreshtas, they're legends, they're wise people. Yadyad acharati sresto, what they do, how they follow, how they conduct their lives, and then what they teach. Tatta devetaro jano, all the rest of the people follow that. Sayat pramanam kurute, what their lives, what they talk is going to be the pramanam for the rest of the group. I think it's a beautiful sloka which amply justifies today the panelists in this moderation group. I am the youngest of all. So all the gurus, once again, pranam. Vinay Kumar made a very interesting observation there. He said that what he talked is walk the talk. What I myself has to go through the journey to see what is spirituality. Here again, one more sloka I quote. When Arjuna asks Krishna about what is Sthita Prajnasya, There's a beautiful sloka. Prajahati yada kaman sarvan partha manogatan atmanye vatmana tustaha sita pragnasya dosyate atmanye vatmana tustaha. The one who learns by this journey, he is the sita pragna. I think spirituality comes like that. Now, there are certain interesting points which I thought I will go later into the topic, like what is religiosity, what is spirituality? Can we talk about spirituality without having the undertones of religiosity? And in the famous Guru-Chela relationship, can we explain that counseling in the terminology of spirituality? And do we have to have this so-called spiritual mindedness to be having that spirituality? These are some of the thoughts which I have. But before all that, one interesting point, one of the speakers in that survey, what he did, I think he mentioned 46% psychiatrists do not have belief in God. This is, I don't know which country is that and where the survey was done. 75% of the patients had belief in God. 46% of psychiatrists did not believe in God. I do not know. It's a significant number. Now, with this brief introduction, I would request our panelists to start with Professor Gangadhar, who is here, who has visited. No, first preference to Professor Gangadhar, who is here. Share their perspective on, number one, spirituality, positive mental health and well-being. I am sure that you know that we have about, now we had about 100 minutes, but has been cut down to now about only 70, 80 minutes. So each of you take about 5 minutes time. And then we move on to the next points of the discussion. Now I request Professor Gangadhar to share his views on. I being the youngest, I'll stand in front of the gurus. So I'll continue to stand here with all respect to the gurus there. Professor Gangadhar sir.
Yeah, this is a great opportunity. We have heard that a spiritual need has been expressed by a lot of people, patients in particular, those with terminally ill, seriously ill, and so on and so forth. There is no two opinions that spiritual need has to be met. In fact, the Ayurveda definition of health includes not only psychological, but also a spiritual health. Prasanna Atmendriya Manaha Swasthya iti abhidiyate. So it looks like there is a need to inculcate spiritual component in our questioning of the patient's history and then meet the demands. In fact, forget the seriously ill people, terminally ill people, etc., etc. Even on a general outpatient population, in NIMHANS, one of our colleagues did a survey of about 500 consecutive outpatients in psychiatry and found that almost 90% believed in prayer. And among, they said almost all of them used prayer once or twice or many other times when they were seriously or otherwise ill. And even for the current psychiatric consultation, more than 70% of them had sought prayer as one of the means of getting over the problem. So it looks like some method of spiritual practice has been a need which patients have been expressing, and I think we have to meet this requirement. There are, of course, several practices for advancing spiritual life. One of them is yoga. Like he was saying, connectedness, yoga facilitates connectedness. And in fact, one of the young students who was practicing yoga told me when I asked him what benefit he got, he said, I feel connected with the guru, connected with the teachers, connected with my classmates, with my family. And when I'm walking, I don't feel alone. I feel connected with everybody. Vasudhaiva Kutumbakam. So it goes on and on and on. This connectedness is one thing that amongst the top 3 benefits of yoga, which people express when they are practicing yoga. And we know today, this connectedness phenomenon facilitates treatment of depression, as has been researched by elsewhere. Connectedness is missing in individuals of schizophrenia, where if yoga is practiced, that empathy comes back, negative symptoms come down, connected feeling gets facilitated by increase of oxytocin as a mediator of connectedness, the cuddling hormone, not just behavioral connectedness, even connectedness in the brain circuits gets better. The default mode network coherence improves following the practice of yoga. Looking at all these things, people have pointed out there is a need to inculcate yoga in our routine medical curriculum. I want to state 2-3 examples which have happened in this regard. For example, NIMHANS has generated what is called as the Department of Integrative Medicine. For the first time in an allopathic hospital, integrative medicine as the department has been set up. The National Medical Commission has made it a policy that all undergraduate students go through a short course of yoga as part of the International Day of Yoga. And more importantly, they can get legitimately 1 week or even longer, up to 1 month exposure in yoga as part of the internship. All interns have a 1 month elective internship, and if their college has a yoga service, they can legitimately get themselves exposed as an option, of course, not as a mandate, but yoga training has been possible. And I just heard yesterday, and last almost 2 years, Dr. Kishan and his college have been sending postgraduate students to get a 2-week exposure in yoga and integrative medicine at NIMHANS. And the experience of one of the students, I asked him, how did you find it? He said, these changes, these experiences are very positive, and I think we should inculcate these practices in our clinical work. And I'm very happy that this panel discussion going to make this issue even more popular, and we have to ensure that our trainees get adequate exposure to components of yoga and, of course, as part of the spiritual practice. Thank you so much.
Thank you, sir. Thank you. I think you did mention about yoga. I'll come back to you later on that, specifically on that yoga journey, sir. Now, I would request Professor Srinivas Murthy, maybe this is a bias because he has given me the MD degree, and so that I'm able to stand here and conduct the panel today. Thank you very much, sir. Sir, you worked in the community as main area of research. Now, looking at spirituality and then religious mindedness, and also we had a talk in the morning about faith healers. Faith healing in the community, and religiosity is always a group journey. Spirituality is a lonely journey. Now, how do you look at this component in your like an experience in community psychiatry and the spirituality practice and mental well health? Thank you, sir. Professor Srinivas Murthy, sir. Sir, you have to unmute, sir. You have to unmute, sir.
Greetings to all the people. I'm sorry I'm not there in person, and I look at this as a very important opportunity to share some of my personal journey as well as professional thinking. I want to make one important point in the beginning. Contrary to or in complement to many of the things that has been said from the morning, that spirituality is a need, I make an assertion, and I'll talk about it in the next 5 minutes, that it is a built-in resource which is available for mental health, which we must utilize it. It is not a need, it is not a service, it is a built-in resource that is available. You will ask me, why am I saying this? I'm standing on the shoulders of Swami Vivekananda. It is the 160th year, Sri Aurobindo, 150th anniversary, and people like Dr. Satyananda, who wrote Positive Mental Health in 1964 for ICMR, Dr. Venkobarao, who wrote Culture and Mental Health, Dr. Vig, who talked about Vanaprastha, Dr. Kapoor, who talked about another way of life. I can go on and on, but all of these people have talked about mental health, not as a service, not as a collaboration, not as a dilution, but an essence of India. The essence of India, Sri Aurobindo says this one sentence, which is central to India. Spirituality is indeed the master key of the Indian mind. The sense of the infinite is native to it. He goes on to talk about this 120 years back. He talks about how Indians think of themselves beyond the physical self. That particular quote is a little long and is worth reading it. Now you will say, is this something which we only are talking because we are Indians? No. If you remember, Thomas Insel has written this new book, Healing from Mental Illness to Mental Health. A person who was with the National Institute of Mental Health for 14 years, talking about mental health. And if you see it, spirituality is a very, very important part of it. Similarly, last month, there was an article in the Guardian called Beyond Belief, Does Religion Help Lead to a Happier and Healthier Life? If you want, this is called the Expectation Effect book by David Robson. Fantastic book, which is that. But I want to cover this a little more practically to get across my viewpoint. That is, usually when we think of religion, even I thought of it till about 15 years back. I'll tell you why I did that. We often think of religion as superstition. And even my friend C.R. Chandrasekhar is very, very vocal about it, saying that we must replace it with modern ideas, as though there is some issue. The other group of people are who say spirituality is everything, spirituality will solve everything, leave it to God, everything will become all right. I personally think that there is a third way of looking at it, that spirituality is a source, a resource for mental health and mental health care. As a community psychiatrist, in the last 50 years, I have seen movement away from restraining people, controlling people, either physically or chemically, to using the resources within them for mental health. Let me just give you 4 or 5, which is very well known. For example, when life stress and life events and social support occurred, it was again recognizing that there is a personal component. You all know about Goldberg's excellent work in 1980, where he found when there was no life event or good support, it was 1% depression, while both of them were, when there is a life event and no social support, it was 30% in migrants in London. Second one, Julian Leff came up and said, in schizophrenia, the expressed emotion in the family is very important. Then, of course, you saw in 80s and 90s, behavior therapy, cognitive behavior therapy, all of those things. What I'm trying to say is that there is enough evidence to show in the last 50 years that innovations, thinking beyond the control of the person to empowering the person. To me, spirituality comes there. You will ask me, why did you arrive at this problem? Interestingly, I started this journey into spirituality about 15 years back when Peter asked me write the book chapter for the religion and psychiatry, of the WPA. And I spent nearly 2 years trying to write that one, and I've never spent more time on any article than that one. The interesting thing that I ended up, I don't know why I ended up that way. The first conclusion of the 5 I ended up was the spirituality, the essence of Hinduism, and relevance to mental health. But that was at a theoretical level. But I faced the reality when I developed cancer in 2013. Then I realized that besides the problem of accepting the illness, coping with all the things that goes with it, it is a terrible journey. Take it from me. And we have lost 3 colleagues, Dr. Avdesh, Dr. Chavan, and Dr. Rajiv Gupta to cancer. So we know what it is. There is a third dimension which I noticed it of the value crisis. One is the novelty, the other one is the reality, novelty crisis, finding meaning and purpose against the background of an adversity. And I learned a lot, and my teacher, guru, Dr. Reddy was very, very helpful. Time doesn't allow me to tell you about that. But then I started working with cancer patients in the Sri Shankara Cancer Hospital. When I went there, something very interesting happened. There was already a psychiatrist, a social worker. They said, why are you coming? I said, I'm coming as a volunteer. No, no one comes. No referrals occur. Even if they refer, no one comes. Then I said, look, you don't know what it means to live with cancer. So I stopped expecting referrals and started going to the bedside and asking them, tell me, what is your need? Next, instead of saying that I will give you medicines or do that, I said, where are you getting your strength? And I learned so much. The most important thing that every one of them said, that it is the spirituality that is helping me. Whether it is Ramana Maharshi saying that there is no pain in my body, pain is in the body but not in my mind, or a terminal cancer patient saying that I listen to Sundar Kanda every day to find solace, thinking of Sita. I can give you any number of examples in the discussion because I see that I'm almost covering my 5 minutes over. So I found that spirituality is something which people are going automatically to resource to understand their things. Then two other things happened. I'm coming to the end of the presentation. Dr. Amrit Bakshi, a remarkable caregiver, has brought out a book of stories of caregivers, 22 stories written by themselves, not dictated, not manufactured. When he sent it to me and my colleagues sat down and said, let's analyze it to see what are the themes. And one of the important themes that comes up is spirituality. Automatically saying that it is spirituality which is helping me. For example, I'll just give one quote. My religious upbringing has helped me endure adversity. My strong belief in God has helped me with my self-sacrifice. I have helped my husband to recover, Mrs. Sangeeta. Similarly, in the last 1 year, we have done 25 stories of caregivers of developmental disabilities. We call it as loss, love, and growth. Again, you will have any number of that type of statements. One statement by a parent, when I asked, what has this done to you to bring up a child with special needs? My faith has become stronger. That was a spontaneous thing. And literally, we were overwhelmed to see there is so much that they are drawing their resources from. So, more important than that, when I had a very intense relationship with Rajiv, both my student as well as colleague. During his last 1 year, we must have had at least 50 long sessions. In one of the sessions, I asked him, what does it feel to think of death? He said, how hard one may strive to live, death is a reality. Even a Hiranyakashipu, Ravana, who were given blessings of immortality, had to die. Death is a blessing. It creates space for new viable life. And went on to talk about it. And similar things, I have had conversation with Tavdesh as well as Chavan. So the point which I'm making is, please don't think of spirituality as something which we have to import it. Like sunshine, we don't have to import it. Like coal, it is there everywhere. Only thing is we did not know it can be converted into electricity till recently. So similarly, we must now move from thinking of spirituality as something alien or something which is terrible to thinking of as the essence of the person to become a mental health person. Okay,
yeah,
just two questions. If only we had, just imagine in 2017-18, if we had done a 1 million population-based survey of people and kept it ready to see what happens to them when the disaster occurs, and those who are practicing yoga, those not practicing yoga. And if we had found, as we now have some very little evidence, that yoga practitioners were less affected by COVID, India's contribution would have been great. I'm just making it for record, not anything. I did write a note for this in 2017 to Dr. Gangadhar, but unfortunately we missed it. But we must not miss it. Now we must start looking at this spirituality, yoga, and all these things as positive things which are there in our culture, in our spirit. The second thing that we have to do, I end up with
maybe we'll come back to you. I think we have now like another panelist. Okay. I'll come back to you, sir.
Yeah.
I think you have raised some important points like resource, not as a source from outside, resource and personal experience also you have added to that. Now, maybe I will request Professor Mohandas to now give his perspective, maybe a very brief talk about the so-called G-spot, God spot and spirituality, whether there's any relation. Mohandas, very briefly.
Now, first of all, the moderator, you have asked some question. People have got a misconception. What is spirituality? What is religiosity? What is a religious affiliation? These are all interchangeable in the research purview as we have got so far. But spirituality has come from the word spiritualitas, meaning breath. That means it is the search or the quest for meaning and purpose. What am I? What am I to do? Then the connectedness, which Gangadhar has told, connected to what? Connected to the moment, connected to others, connected to the society, connected to the nature, and everything that is connectedness. It is based on values. Basically, what are the values? It is the moral values, moral cognition. That has really come from Jean Piaget moral development theory, from Lawrence Kohlberg in 56, the moral development. Then it has distilled down to something called a spiritual intelligence. Spiritual intelligence, it was coined by Dana Zohar in 97, the same time the Kenneth O'Donnell also put spiritual intelligence. Many terms are there. There's something called the moral cognition. In between, Gangadhar coined about some neurohormone, especially he's talking about oxytocin, that is affiliation. That is called affiliation networks in spirituality. Now, coming to the pursuit of what is spirituality, it is a complex, positive, emotional, mainly positive. There are negative emotions. Positive emotion, joy, happiness, forgiveness, generosity, gratitude, empathy, compassion, everything will cluster around to make you happiness. Which happiness? That's the eudaimonic happiness that usually the Aristotelian, Nicomachean ethics, rather than the Epicurean model of hedonic happiness. Hedonic happiness is only a part of it. The other is called eudaimonic happiness. Now, basically, when we talk about spirituality in different religions, in our Hindu Shastra, in Hindu philosophy, dharma, artha, karma, and moksha, that is the transcendence, moksha. In Buddhist philosophy, it is a nirvana, and in Hindu philosophy called Om, or even the Anandamaya Kosha in Vedic philosophy, in Islamic philosophy, Bhakwa, and in Christianity is called Unio Mystica. That is the transcendence. That is from the meta consciousness to the transcendence. How many people have got transcendence is a very difficult thing to do it. Now, we talk about, some people say India is the main center. As far as the world global spirituality index, Canada ranks first, second is Italy, third is India. Among the first 10 countries, Japan, Germany, USA, UK, all this come with the recent global spirituality index. How to do the spirituality index? I will not discuss it. It will come to that. There are many scales for that, many scales for religiosity. I will not come to that. Regarding the neural correlates, plenty of articles come. And summarizing, what we are talking is the clinical application Gangadhar told. We talk about the downstream effects. That is what happens in the coping mechanism or a spiritually assisted therapies and the outcome, which is important. But what we are interested in is basically the upstream effect. What positive things we can do for the wellness rather than the illness related thing, that we will come to when the discussion progresses. I will not go to the further histories, and I stop short there for the other panelists to contribute. Thank you very much.
Right.
But last moment, the last point, Reddy has asked whether spirituality and religion, you can be spiritual without religion. They talk not only the God, it can be any other superpower or something beyond it. 80 to 90% of the world really believe in something like that. That is why the statistics say whether religion or spirituality. Religion is basically by the organized community. So what is the relationship? It is a conduit to reach spirituality, need not be. All religion may not really empower to reach the transcendence. But there are so many other modalities like ritual, prayers, different mechanisms, which I will discuss whenever the question comes. Oh, thank you.
Okay. Thank you, Dr. Mohandas. Now, I would request Professor Shivagautam very clearly sort of give us some wisdom about being positive mental health and wellness. This is going to be the main part of the topic today. how is it related to spirituality? Positive mental health and being well, and connection to spirituality and spiritual mindedness. Over to you, sir.
Thank you very much. Let me share this screen with you, how spirituality for mental health and well-being can be applied to. People have talked about spirituality. I'm really happy that I'm sharing this platform with the Guru of Gurus, Dr. Srinivas Murthy, and my other dear friends, Mohandas Tiwari, and other panelists. This spirituality word is used in abundance of contexts. Just now, Mohandas said that it can be without religion. But let me make few things clear, because people talk about religion, spirituality so often. Well, although expressed through the religions, art, nature, and the built environment for centuries, recent expressions of spirituality have become more varied and diffuse. The definition of religion is a controversial and complicated subject in religious studies. I have gone through a couple of religious studies which have and reviewed recently for one of my forthcoming books. Oxford Dictionaries defines religion as a belief in or worship of a superhuman controlling power, especially a personal god or gods. Thinkers such as Daniel Debussy and others have doubted that the term religious has any meaning outside of the Western culture, while others such as Ernst feel even doubt that it has any specific universal meaning even there. So, dharma is not religion. In our culture, we have used the word dharma, which means one who bears it, jo dharan karta hai. What does dharma mean? Dharma is an important Hindu, Buddhist, and yogic concept referring to a law or principle which governs the universe. For an individual who live in their dharma is for them to act in accordance with this law. Dharma is considered to be one of the three jewels of Buddhist, alongside Sangha, Buddha, together paying the path of enlightenment. In Hinduism, it is one of the four main philosophical principles: dharma, artha, kam, and moksha. It can also be understood as a law of righteousness, satya, truth, giving order to the customs, behaviors, and ethics which make life possible. There is a lack of distinction between religion and spirituality. People have at times even used it interchangeably. There is a recognition, at least theoretically, that there are differences between religion and spirituality that either can be practiced without the necessary involvement of the other. Operationally, however, distinction between religious practices and spirituality is often blurred, with much of the research using measures of religious practices as a proxy of spirituality. Now, people have talked only about connectedness, but there are other themes which are also included in spirituality. And the first and foremost is sense of purpose. What is the purpose of life? Who am I? What is going to be? We find answer in many of the ancient Indian literature, which I'll come to later when it comes to discussion. A sense of connectedness. It has been talked a lot to self, others, nature, God, or other. Then a quest for wholeness. That is important theme in spirituality. A search for hope or harmony. A belief in a higher being or beings. What is that higher? Is it God? Is it something else? Is it some power? Some level of transcendence, or the sense that there is more life than material or practical. Those activities that give meaning and value to people's life They are all included in spirituality. Religions offer set traditions, rituals to perform activities in a particular manner. All religions have their set traditions, set rituals, set ways of performing activity, while spirituality is beyond religiosity. All religions ultimately lead to a state of transcendence which make a person spiritual. But what I feel that religiosity is an instrument of spirituality. Let us look at this picture. These are all religious symbols. Christian, Islam, Hindu, Buddhism, Jew, and all the religions which exist. These symbols, all the religions which use a common instrument, that is mala. In all the culture, everybody uses a 108 beats mala and pronounces the mantra of his own religion. But ultimately what leads to the effect in the mind is similar, whether you speak Om, whether you speak Arham, or whether you speak any other word for meditation. Then, application of spirituality in psychiatric disorders, I searched for the evidence base also. What is the evidence base? In depression, there is loss of meaning and hope, loss of meaning in life, intrinsic values, belief in transcendence and spiritual community. There are studies by Swinton and Holtz describe qualitative research that these dimensions of depression have an inverse relationship to the course of recovery. Then in anxiety and panic disorder, there is ample evidence that spiritual techniques like yoga, pranayam, preksha dhyan, vipassana, raj yoga techniques, there are published data that all these techniques overcome anxiety states. There is qualitative as well as quantitative research. In post-traumatic stress disorder, we all know what it is. And review of the literature found 11 studies that reported links between religion, spirituality, trauma-based mental health problems. And these 11 studies showed that religion and spirituality benefit people in dealing with the aftermath of trauma. That lead to deepening of religion or spirituality and are associated with post-traumatic recovery in these people. There are studies on schizophrenia. I will not go in detail. However, certain religious expressions of spirituality may become a part of the problem as well as part of the recovery. Some individuals are helped by faith communities, especially during the recovery phase or for their rehabilitation, uplifted by spiritual activities, comforted and strengthened by their beliefs. Others are rejected by their faith community, burdened by spiritual activities, disappointed and demoralized by their beliefs. So we have to look at it. Most important document which I always quote is Bhagavad Gita. It contains a condensed form of all the philosophical and psychological wisdom of Upanishads. In this excellent model of psychotherapy, through 18 chapters, way of self-knowledge, yoga of action, knowledge of renunciation, action, the path of meditation, knowledge of the absolute, eternal, yogic vision, yoga of devotion, profound knowledge of three gunas, that is, Sat, Raj and Tam, and the wisdom of renunciation and liberation have been described at length, which leads to personality transformation of Arjuna. A warrior who was losing the battle of Mahabharata is converted into a warrior who has won the battle. In the modern psychotherapy, cognitive restructuring is the goal of psychotherapy, which has been accomplished a great deal through Bhagavad Gita. And what you find, that practice of yoga, meditation, change in lifestyle, description about personality, Sattva, Raja and Tam, self-realization, self-actualization, changed him into the victorious hero of the battlefield of Mahabharata. So this is one of important document which comes 5,500 years ago, 3,500 years before BC, when other philosophies did not have solution to many of the things. This is an important document in spirituality we find in the Indian ancient.
Sir, Professor, I'm sorry can we
last slide? Just the last slide, it is very important. The common relationship between spirituality and mental health is coping styles, locus of control, social support, physiological impact, architecture and built environment of the temples, etc. All these things help in helping these individuals who suffer from. So what is needed? What we need is integrating spirituality and religions into mental health care, psychiatry and psychotherapy, or else the mental health care will go in the hands of religious leaders, which we are saying. Well, there is much more to talk. I have personal experiences of my COVID period, which helped me to overcome 51 nights in medical ICU when I suffered from COVID. I was on oxygen personally for 3 months. And let me share with you that during those 51 nights, I read 3 of the Vedas. I read Bhagavad Gita once again in the ICU. And I did not leave any time for me to think about the illness. And that was a strong thing which helped me to come out of it. So this is which I would like to share as my personal experience. Lastly, I would like to share with my study with the cancer patients. We studied 100 cancer patients and their relatives in the SMS Hospital, Jaipur, as a part of the scientific work.
I'm sorry to interrupt you now, because I think this has been shared by Professor Srinivas Murthy also about
Sure. It is a published work, and I'm so happy. So let us, I stop here and we continue with the discussion.
Thank you, sir. Thank you so much. I'm sorry to interrupt, because now there's a lot of other questions. Some of these can be provocative in this panel discussion, because we want to distill the wisdom of all the gurus here in the IPS. Now, maybe I'll put a direct kind of a question, sir, to Professor Tiwari. We all talk about guru-chela relationship in counseling. How do we connect the spirituality in this guru-chela relationship? Can you enlighten us, sir? Professor Tiwari, sir?
Yeah.
Yes, sir.
Good afternoon to all panelists. And thanks for giving me an opportunity to speak about my mind about spirituality. Guru-chela relationship is based on the fact that Guru is something of different class. It doesn't embody the human being aspect of that Guru, but something to do with the knowledge, with the practice, with other things what Guru has with him. And that makes Chela to be influenced to a large extent, and that Guru-Chela relationship is there. Guru-Chela relationship has been used in psychiatric practice, and it gives good results. That is what the Guru-Chela relationship is. Whenever we touch such kind of situations, like one Argenia therapy, there too we invoke a kind of issue in the subject that you should recognize your potential, and you can do whatever you want to do. Now, after having answered to this question of Guru-Chela relationship, I would like to speak something about spirituality. We hear a lot about spirituality. So many definitions are there of spirituality, and we also understand and appreciate its role in mental health. But how spirituality can be taken at a clinical level to treat mentally sick patients or to seek other medical patients who are terminally ill look at. And undoubtedly, when one talks of spirituality, then religiosity also comes into picture. Though there is no connection between the two, the spirituality is something which is a kind of personal experience one can have. But religion also is important in treatment of mental patients. There are several studies which indicate that citation of religious mantras, citation of playing of religious music, and other kind of religious things makes better recovery in head injury patients, in other kind of neurosurgical and neurology patients. These are the issues which one should exploit, which one should take into account now at this level of discussion on spirituality, so that our patients are benefited. Thank you.
Thank you, sir. Thank you so much. Now, I think the next few minutes, I think we will be going on a sort of on a fast pace. Maybe I would request all of you to give very brief, like responses for some other points which we are going to talk about. And I would request Professor Gangadhar to talk about practice of yoga. Does it increase spirituality, whatever sense we talk about? Some of these questions may be very naive. I think you all understand I am the youngest of all of you. So does it increase spirituality?
Yeah, in fact, yoga is a spiritual lifestyle. It transcends oneself, helps oneself to transcend, to merge with that consciousness. That is that real I. That false I, the ego, comes down. The real I, which is the super or cosmic consciousness with which I transcend and merge. This spiritual translation that happens in me helps me to feel that connectedness, compassion, empathy, all traits attached to spiritual growth start appearing in me. And so this is precisely what the experience of one of the yoga practitioners was saying, that I feel connected, I feel that everybody is one, and so on and so forth. So this transformation is helpful for a positive mental health. But of course, I may not be an expert in studying positive mental health. What I have applied those in routine clinical practice, where that had benefited these people, I'm sure practicing it longer also going to make the positive mental health grow.
So that helps to a certain extent. It may not be directly, but it definitely is a path to attaining the. Now, Professor Srinivas Murthy, I will ask you, sir, yoga is a prescribed thing, which is a kind of ritual or symbol we practice or we are taught in religion. But in spirituality, there is nothing like a prescribed things. You are on a lonely journey. Religiosity is a group journey. So in this context, if you are looking at it, are we putting a bit more pressure on the other person to be more spiritual and then not really following the religious practices? Very brief answer, sir, from your community experience.
Very, very good question you asked me. You know, in the Guardian article which I referred to, power of religion is that it gives you this package of ingredients that are pre-made and organized for you. And so every religion, it's not only the Hinduism which has got it. The most important thing is that we have to break it down into actionable thing. The point which Dr. Tiwari raised it, Dr. Shiv Gautam raised it. Now there is enough evidence to indicate that specific activities like compassion, kindness, gratitude, forgiveness, all of these like that, there are about a dozen of them, which if we can say, look into your life and see whether is there something which needs to be addressed. And you will find, yes, doctor, I still have this hostility about my sister-in-law who was nasty to me, or my mother-in-law who was cruel to me. If we can help them, like we do it with child trauma, we do it with other psychological trauma, you will help the people. So I personally feel we don't have to think in terms of either our approach and see what fits each person in a particular situation. Thank you.
Yeah, thank you, sir. See, like here, the point is that I think what you have raised, a kind of rituals, what I'm talking is, I go to my morning every day, I practice this ritual. I'm more religious minded. And the other person says, I don't follow any rituals. I'm spiritually at a higher level. How do you now talk about these two? The specific reason is, maybe this question is to Professor Tiwari. When I say I am religious minded, I think this point has also come into the discussion. I'll be slightly looked down. When I say I'm spiritual minded, slightly on the one up level. Do you agree? And how do you sort of comment on that, sir? Professor Tiwari, sir.
That makes a great sense. If one says that he or she is spiritual minded, that means that the person knows about himself or herself in a larger perspective than simply being a human being. What I am is the concept of spirituality, and people practice his spirituality to find out the meaning of what I am. And if somebody says that he is spiritual or she is spiritual minded, that means he or she is practicing all those aspects of his spirituality which places the person beyond, say, a normal human being, you can say. These are the people who remain self-contented. They remain quite happy. They are helpful to other people, and they are, in a way, more close to nature than the, say, other people. And in that sense, being spiritual is something which should be appreciated, which should be inculcated in the minds of not only the normal human beings, but also the patients. And that may help patients come out with their problems.
Okay,
Thank you.
Dr. Tiwari, I'm sorry for intervening. Can I intervene, Dr. Reddy?
Briefly, sir. Briefly,
The question is, being spiritual makes you self-contented. But what is the methodology? How do you attain spirituality? That is the issue.
Oh, that's
and
a million-dollar question.
Wait. When it comes to clinical practice, then you have to give methods. See, Dr. Gangadhar talked about yoga.
Yeah.
He talked about one aspect of yoga. It is the Ashtanga yoga which has been described, wherein all 8 streams of yoga, which is a lifestyle. Yoga is a lifestyle in Indian context. And it is a method of attaining spirituality. So it may be through meditation, it may be through pranayam, it may be through kirtan, it may be lay yoga, it may be karma yoga, it may be any form of yoga.
Yes,
there are
sir.
6 streams.
Professor Shivagautam, thank you. I think it's a very important point you raised there, that it's very easy to talk about, but what is the practice? What is prescribed? That is what is going to be the most important thing. That's why
absolutely, that is what we as group of experts have to concretize.
Yoga,
action by which you will reach and you will attain spirituality.
Exactly.
And what do you teach your patients?
If I can intervene for a second, that issue I raised, how to achieve spirituality, what is the method, what are the process, or what are the steps which we should take. And that's very important if we want to exploit the concept of spirituality in treatment of mental patients. Thank you.
Correct, sir. Yeah, actually, I think that is one of the core issues which we all have to, but I think maybe we don't have so much of time to really go into, because That is why I raised. When you talk about religion, you have some prescribed rituals. When you talk about spirituality, nothing like exists. How do we communicate to the patient? And now maybe I'll ask Mohandas. Sometimes people talk about hyper-religiosity can have something like a negative effect also. Hyper-spirituality, is there something like hyper-spirituality, Dr. Mohandas? And does it have any negative effect or a positive effect? Very briefly, sir. Mohandas, you have to unmute.
I am unmuting. There is a specific concept called Muramato's hypothesis. That is, hypofrontality is correlated with antisocial personality. Hyper-religiosity is hyperfrontality. And sometimes when there's an extreme meditation comes, extreme meditation, some people can go to psychotic states. Basically, it activates the cortical 5-HT2 receptors, increase 5-methoxy dimethyltryptamine, DMT. That is why the mystical states. There is a NAG, N-acetyl-aspartyl glutamate accumulation. There's an increased dopaminergic system. Cortical 5-HT activation produces the hallucination. 5-HT inhibits the lateral geniculate nucleus. That means reduce visual transformation, information transfer. There is a reticular inhibition of lateral geniculate body. That means extreme spirituality can produce psychotic states in some people who are prone to have psychotic states. Many people can get mystical states. It is because of the heightened activation produce increased DMT, 5-methoxy dimethyltryptamine. It can have it because that is why we say many good God men are not good men. There's a spelling error. God men and good men. So
thank you. Thank you.
Yeah, thank you.
I think that's I think one of the insights which we all have to also keep in mind. I think I'm very thankful, Mohandas, you told that. Now, Sai Krishna, as I told you, he's a very strict floor manager here. We have only 5 more minutes. Now, I would go through each one of you 1 minute, and I'll give the privilege of summing up the whole thing to Professor Gangadhar, who is sitting here. Now, Dr. Srinivas Murthy, briefly, sir, 1 minute. What is your conclusive message? 1 minute each of you, sir. Thank you.
I'm going to use this 1 minute to bring in Dr. Venkobrao. He wrote this about 25 years back in his book, Culture and Mental Health. He starts the page as follows. This is the advice I would have for all the people who are listening. India is an ancient and cultural, spiritual and anthropological laboratory. She has been the nursery of saints and sages, scientists and founders of world's major religions. Nevertheless, we should not be satisfied with the glory of the past. If we do that, it will become converting it into a fossil. But to interpret the world from the new point of view is to revitalize the past and bring in a current of fresh air into the monotonous present. This is a message I would think we all do. We should not glorify it. We should not say modify it or whatever you want to call it, but we must say, here is a...
Yes, sir. Yes, sir. Thank you.
Thank you.
We should not live on the past alone, but we need to do something about it. I think Indians are known for argumentative Indians, so we will not let it be fossilized. We will continue our the spiritual journeys. Professor Tiwari, briefly, sir, 1 minute, all of you each.
Again, I say the same thing. I have had lots of discussion about the spirituality and not only mental health, physical health as well. Now we should develop a module which we can offer as a treatment modality for the spirituality in mental health patients and also in physical health patients. Thank you.
Thank you, sir. Professor Shiv Gautam.
Well, my last comment would be that we have to introduce different modules of attaining spirituality by different described techniques in the text. We must be proud of the past, but take the past to the future. So we have to, like Ashtanga Yoga or different streams, which stream is useful in what category of patients, that clinical issue we have to handle, and we should have a core group of people who can give that. It is not a reductionistic system, but it is a holistic system, and we should move towards wellness.
Oh, that's very important, sir. Holistic system. Mohandas has given a good one-liner. Not all God men are good men. One more one-liner and bit from you, Mohandas.
Yeah. Basically, there is a good evidence of the downstream effects, especially for depression, substance use, and suicide. Very moderate evidence in stress-related disorders and dementia. Insufficient evidence now in bipolar and schizophrenia, and especially improvement with coping of illness and health-related quality of life. That is the evidence we have got. But upstream effects, how can we improve it? Which Gangadhar has told, yoga is a way of life, especially the moral duties. Yama, niyama is the moral ethics. And then your pratyahara, dharana, dhyana, and the integration, that is the samadhi, that is the integration. It is beautifully written in the 8 ranks of Patanjali. Now, lastly, there are neuroscientific evidence. Basically, it moves around the frontoparietal activation network on the one hand and limbic affective network on the other. Multiple networks are involved, not only default network, reward network, salience network, and the theory of mind, especially others. I will not go into comment. Enough is there. Now, lastly, one more thing, one more suggestion. Those people who are interested, they should read further articles, especially how to integrate into your curriculum and even spiritual well-being within that time, how to promote it. Yoga as an example, he has told, spiritually assisted psychotherapy or spiritually augmented psychotherapy sessions are there, modules are there. They have to do it. How to have spirituality index. There are rating scales. A 20-point scale is there, 12-point scale is there, and the recent one 4-point scale is there. If anybody is interested, I can share you. Thank you very much.
Thank you so much. Sorry, I am being a little bit rude by cutting short of that because we are running out of time. Sir, Professor Gangadhar, for you to for the concluding remarks.
In summary, we all agree that a spiritual need of these subjects, our patients in particular and the general population, has to be met. And to facilitate this, our own empathy for a spiritual growth and the need for us to change is also required. Many means of attaining spiritual progress, advocating spiritual practices, there are multiple means are there. One of the of spiritual nature in the subjects would be yoga. Yoga has a modular design and it is faith independent and of course is secular, and it is the first step that we could use. There could be many other steps. Each one has his own school of spiritual practice, and Bhagavad Gita gives us multiple options other than the practice of the yogasana and pranayama, which has to be used in our clinical practice. And of course, the biological components of spiritual change needs to be measured, and I'm sure this is already going on. And the last point is that in current medical education, this process has already begun. There has been a loud voice that humanities has to be included as a subject, as a faculty in medical education. And as the first step, the National Medical Commission has already taken integrating yoga. And I'm sure as we keep moving in this direction, more integration is possible and more opportunities to utilize our traditional knowledge in clinical practice is going to come out. Thank you very much. Thank you.
Thank you, sir. Thank you so much for all of you, especially the last words you told. as a wisdom of Padma Shri and then the chairman of NMC who gave a very positive hope for this. Thank you very much, sir. Now to Kishan to make some remarks.
Sir, on behalf of audience, I'm talking. Thank you, MS Reddy. Only one point I want to add with great humbleness before legends of spirituality. The routines Trikala Sandhya or Sandhya Vandanam, which is practiced in Orthodox families, in every Orthodox family, still it is going on. The Upanayana ceremony, 9th year, 11th year, 13th year, that is gives what we call is Sampurna Vaidika Jivana Vidhanam. So at least in holy days, we make it holidays, but I'm English people, but at least Sunday, if you do the 3, and what I'm practicing in patients also, Lagu Sandhya, there's in Sandhya, the detail it takes maybe for newcomers for 45 minutes, but the Lagu Sandhya as given in my wellness clinic, and the Lagu Sandhya also can be given because of you have to take care of the patient's ability and coping capacity. So this can be, should be, I want attention of the seniors to guide and because this is a technique, old age, since ages, our Orthodox families are practicing it. And there is a key points I want to mention, the Sheshira Gayatri stimulates all 7 chakras, and Dasha Gayatri Japa, that stimulates the cortex and it increases the executive function, and Dashadik Namaskara, east, west, south, north, as well as the Akasha and downward, and Antar Disha, total 10 Dish Namaskara. But first thing, morning Sandhya, afternoon Sandhya, evening Sandhya will connect the human being to the Prakriti. Then Vikriti will come down. Then it increases the space by praying the space. So Dik Namaskara, Dik is only space you are praying, you are saluting the space, which is holding the whole contents of the space. Even Surya Mandala is holding, the space is holding the whole solar family. So that it increases our mind space, Chidakasha, then Chit will take a bigger place, confusion will come down. If you put more Chitta, more material in the short room, it will be confusion. So to give clarity, you get more space. As our cell phone is having 220 GB, I have more clear, can take data. So this is the thing to be studied. And it is my request, the humble submission to the seniors. Thank you very much, MS.
Thank you. Thank you very much, sir. Thanks all the gurus. Thank you, sir.
Thank you, MS Reddy, sir, for excellently organizing, for being the moderator. We are sorry for the organizing committee to cut short in the panel discussion in view of time frame. Now, I request Dr. Bhagyareddy, sir, to come onto the stage to felicitate Dr. B.N. Gangadhar, sir. Bhagyareddy, sir, is president of Karimnagar Psychiatry Society. Felicitation. Next. I request Dr. Kishan, sir, to join. Thank you, B.N. Gangadhar, sir, and thank you, Bhagyareddy, sir. Next, I request Shiv Gautam, sir, to accept our felicitation. Thank you, sir. We request Madam to felicitate with the shawl. Thank you, sir. Next, I request Dr. R.S. Murthy, sir, to accept our felicitation. Thank you, R.S. Murthy, sir. Next, I request Dr. E. Mohandas, sir, to accept our felicitation. Thank you, sir. Next, I request Dr. S.C. Tiwari, sir, to accept our felicitation. Thank you, sir. Now I request Dr. Bhagyareddy, sir, and Kishan, sir, to felicitate MS Reddy, sir. request N. Raju sir to join the photo. I request Vinay sir and Arabinda sir also to join. Vishal sir, Dr. Praveen sir, please. Dr. Shiva. For all the distinguished who are attending physically, we had arranged lunch in the beside hall. Please join for the lunch. And there is no break in the session. Why? Because it is a webinar. We'll go for the next session. Already the speaker and chairpersons had logged in. Now I take the privilege to introduce the next topic, the principles of Ayurveda as determinants of mental and physical health. I welcome today's chairperson, Dr. Sandeep Grover sir. Sandeep Grover sir is working currently as Professor of Psychiatry in Chandigarh. He is editor of Journal of Geriatric Mental Health. He is associate editor of Indian Journal of Psychiatry and is awarded thrice by Indian Council of Medical Research. Totally is having 65 awards and is having 836 publications. We welcome you, sir. Sandeep Grover sir.
Good afternoon. Thank you.
Yeah. Next I invite Dr. Jayan Mendes sir. Jayan Mendes sir is from Sri Lanka. He had done his postgraduate training from University Psychiatry Unit in Colombo and is currently appointed as consultant psychiatry in Angoda Mental Hospital after returning to Sri Lanka. He took acting director Angoda in the year 2002 and relinquished his administrative responsibilities in 2015. Currently is consultant psychiatrist in Colombo, Navaloka Hospital. Welcome Jayan Mendes sir. Now I request the chairpersons to introduce the speaker.
Yeah. Good afternoon. Dr. Mendes, will you be doing or should I be doing? Dr. Mendes? Okay. I'll go ahead with introducing the speaker and then Dr. Mendes can introduce the topic. Welcome to this session of this International Conference on the Spirituality. The speaker for the session we have is Dr. Antonio Morandi. He has master's degrees in medicine and surgery from the University of Florence and he's a faculty of medicine in Italy. He has surprisingly a lot of degrees in Ayurveda than medicine, and he has done a degree in Ayurveda from as Ayurveda Vidya from 97 to 2000, and then he did another degree from International College of Ayurveda from Italy, and then another degree from Pune. He is currently the chairman and director of Ayurvedic Point, which is a clinical facility in Italy, and he is the president of Italian Society of Scientific Society for Ayurvedic Medicine since 2003, and he is also a WHO consultant in the group, which is an international working group for the practice, training, and terminology of Ayurveda. He is the chief editor of the Ancient Science of Life, and he has won the Istam Jandu Award for research in Ayurveda, and he also has many other awards to his credit, which I was seeing in his CV, and he is an international coordinator and the scientific advisory committee member for various conferences, and he has more than 150 publications in various renowned journals. I welcome you, sir, for this session, and we look forward to listening to you.
Thank you. Thank you very much. Yes, can you hear me?
Sir, yes, we can hear you. Dr. Mendes, would you like to introduce the topic? I think
there is some connectivity issue with Mendes sir. Sir, you can introduce the topic, sir. Or no, you can.
Okay, just give me a second. Yeah. So Dr. Antonio is going to speak about Ayurveda, which we all understand that Ayurveda is science of life, and which basically talks about more about prevention of various illnesses rather than going just only about the treatment of various illnesses. And we know that the whole dictum of Ayurveda started from India, and we have the history dating back to about 1 million BC. And with that, we will see how Dr. Antonio talks about how we can use these principles in the modern day mental and physical health. So with this brief introduction, I request the speaker to start his presentation.
Yes. Can I share my screen also? Okay. Good. Yes. Okay. Okay. Yes. Thank you very much for the organizer to give me the possibility to speak here with all these important colleagues. And yes, I would say that Ayurveda actually is something more of what has been said at the introduction. Myself, I'm a modern doctor. I'm a neurologist also. And Ayurveda saved me from being a professional that was looking on the other procedures. That is what is neurology, modern medicine now. So it's something that deals not only with prevention, but it deals with really the possibility of helping patients from both mental and physical point of view. As a neurologist, in Italy, or at least everywhere in the world, a neurologist is someone that knows everything but cannot do anything, because neurological diseases are very, very tough. But Ayurveda is giving us also the possibility to treat in a different way this kind of problems, this kind of diseases. But the problem basically is that we think at Ayurveda like what Ayurveda is apparently, that means massage, herbs, and this kind of things. But Ayurveda essentially is an epistemology, and this is the most important thing that we have to think about. So we have the possibility to transfer this epistemology in another framework of mind, and to use it in a different way. And from this point, I would like to make a reflection before speaking about in which way the thought of Ayurveda can help in medicine, and every kind of medicine. I would like to make a reflection on actually, of course, before I pay my homage to my teachers, but I would like to make a reflection on what we mean by the term spiritual or spirituality. Because we all in this session, we are speaking a language which is not ours. English is not my language, and I think it's not the language of many of the speakers here in this Congress, but we use it as a language that can be used for general communication. But when we go to see the Oxford Dictionary, we see that it's something that is relating or affecting the human spirit or soul as opposed to material or physical. And there is a description of what are the spiritual dimension of human experience. And from this definition, which is a definition that is given by a dictionary, that means that it is in the mind of the people, we realize that when we speak about something spiritual, we create a separation between material and immaterial, from outside and inside. When we speak about spiritual, we presuppose, we think also that is something that is opposed to something else. So there is a spiritual world and there is a material world, which is exactly the basis of the reductionism and the reductionist thought, which is not the thought of Ayurveda, which is not the thought of yoga, which is not the thought of the darshana. But we use this word, spiritual, and for the communication with the Western world, is something that in some way reinforces the idea that there is this difference, there is the material and non-material. From, if we look to what the modern world says, the quantum field theory instead, which is a physical theory, the theory of most important theory of physics in the last years. The quantum field theory says that physical reality is an indivisible totality, and that doesn't object, but it is an excited state of a quantum field. The fundamental entities are the field, not the particles. A particle appears only in a space because there is a specific intervention of another field, which is the observer. And this reminds us, Rishi Deva and Chandas. Elementary particles, atoms, molecules, proteins, living cells, beings, and so on, are nothing at the hierarchical levels of organization of quantum field states. By interacting with each other, they create everything that exists in the physical world. And this says that everything is interconnected in the universe. And this is something that is very important because, you know, something that is that comes from physics, which is accepted everywhere. But the modern physicists and the modern, you know, scientists do not accept that this reality of quantum physics is applied also to at the macroscopic level. They think it is only at the microscopic level. How come that something that is valid at the microscopic level is not valid at the macroscopic level? But they think in this way. And notwithstanding this vision in which living organisms, the planet, the material world, they are a network of inseparable relationship, they keep on saying that there is they are like two words, no? Separation. So this there is a reality which is underpinning, which is complex, non-linear, autopoietic, adaptive. And then there is what we see, which actually are the same thing, but they are considered separately. But there are interesting parallels between the insights of quantum mechanics and the Vedic theory of consciousness, actually. You know, the Veda are considered Atma Vidya, that means the conscious science. Reality is unitary at the deepest level. This is the message of the Veda. And this reality is called Brahman, which is a neuter gender, Brahman. This is the cosmic consciousness that informs individual mind. That means that focusing on the nature of mind provides insight into consciousness, into the nature of the universe. You know, these are the basic sentences which express this deep concept. Tattvam Asi Aham Brahmasmi. Each level of reality is intrinsically self-aware. This is the main point, which is the point also of quantum physics. But the Veda have a much more clear idea, because Veda says that the unit of consciousness is at the basis of everything that exists in the universe, and that the unit of consciousness is at the same time physical and non-physical. The darshana, the word darshana, of course, I like very much the languages. I like very much words. I think that in the structure of the words, in the sound of the words, there is the meaning of the reality they are referring to. The word darshana means a point of view, observation, is in that is connected to the reality, not the material, the reality. And this is something that is, again, wrongly translated as philosophy, which means completely different things, because philosophy is not darshana. Philosophy is something which is constructed by human mind as a model of the reality. And the sixth darshana of system of Indian thought derives from the Veda. And in each of them, there is the issues of consciousness and self-awareness. Now, the beautiful thing of the darshana is that they provide different patterns of level of hierarchical organization of the reality, which is exactly what is looking for the quantum physics. and is already there. And they are saying the same thing. But the Darshana have much more organized view than the quantum physics. In fact, they are describing models of genesis and evolution at the microscopic, microscopic, and psychological levels. And the laws are the same. It's only the reference which is different. And the individual mind, the message is that the individual mind emerges as a reflection which is provided by the hardware, by the brain, derived from the underpinning consciousness. So the individual minds are related to the kind of brain which is the interface between the consciousness and the reality, the material reality. The epistemology of Ayurveda, which is the Indian's most important system of traditional medical knowledge, which is not only a medicine, but it's a medical knowledge, so it's a knowledge system, it's not just a medicine, is based on this darshana. We can find all the darshanas in Ayurveda, mainly Samkhya, Yoga for the mind, and Vaisheshika. But we find also, Mimamsa and so on, Vedanta. Mind consists of 4 components: Manas, Samkara, Chitta, and Buddhi. Manas is the lower mind. Manas is the one that is connected with the senses, with the action, is the entity through which the knowledge is obtained, and through which there is the interaction between the living being and the environment. Amkara is the sense of I-ness, that is the centrality of perception and relative action. This Chitta is the memory bank, which constitutes the foundation on which the mind operates. Of course, this is one of the description of mind that are in Ayurveda, because in Ayurveda there are several according to the needs. And then there is the Chitta, which is the organization of a new perception with previous experience that create different emotional states, which is the one that, according to yoga, has to be in some way kept under control. Yoga Chitta Vritti Nirodha. And the Buddhi, discriminating and decision center, which is based on Ankara information. And everything is interfaced, and actually model interface is derived from Atma. So the mind is a direct emanation of Atma. And since the mind is matter also, we will see that it reflects in the physical activity. So this is the model in which the mind and all with all the components inside, when looks inside, there is a connection with the self, which is again expression of Atman and Brahman, but the mind is also connected with the outside, which is an expression of again of Atman and Brahman. So the moment of perception, the moment of and of course the moment of perception and the moment of awareness of perception is a moment in which there is the existence. This is a kind of is very close to what is described in the quantum physics by Schrödinger when he speaks about the collapse of wave function. Something exists only when you perceive it, and this is what actually is at the basis of the Ayurveda. So existence itself coincides with awareness. Awareness of awareness is the ability to reflect on oneself. The moment a living being is aware of being aware, consciousness emerges. So this is why the humans have this possibility of awareness, because they have the heart for this. So what we have up to now is that the Vedic Ayurvedic vision says that the mental level and the physical level mirror each other. Actually, they are the same thing. The mental level is the semantic level of reality, while the physical level is the symbolic level, the information level, which has sense if it's connected with semantic. So semantic and symbolic are two faces of the same coin. So Ayurvedic vision says that the reality is composed by unity of consciousness, which are physical, symbolic, and semantic levels at the same time. The quantum field theory says the same thing. The physical universe represents the symbolic manifestation of the semantic reality, which connects everything from within what is visible from the outside. Now, let's see, put in practice in the Ayurveda. And for this, I will go to examine what Patanjali says in the Yoga Sutra, and also I take the example of Ashtanga Hridaya, and both of them, at the beginning, exactly at the beginning, they put the root of the diseases in the excessive activity of mind, of chitta, actually. Chitta vritti nirodha is Ayurveda for to still the movement of mind, and the Ashtanga Hridaya says that at the beginning, raga dirogan, that raga, is the urges of passion that encompass the entire range of emotion, and that raga is at the basis of every kind of disease, both mental and physical, because there is no difference. Absolutely no difference. And this is also something that every day in my clinical practice I witness. Every mental disease reflects symbolically in the body. Every physical disease is a symbolic, manifestation of a semantic root, which is at the mental level. So to make just a rehearsal of what I said, manas is defined by perception. Manas is very quickly, just to give a quick description, imagine and build models of reality which are presented to Buddhi, and this is the continuous activity of thought. This continuous activity of thought. Chitta, Ankara, Manas, they are all involved in this, and these are continuous activity between the memory and the future. It's a continuous activity from Smriti, Dritti, and all the attributes of mind that are working continuously in imagining models of reality that derives from the perception. And this is needed for Buddhi to discriminate more reality that will be stimuli, which we see. And if we have a balanced manas, we will have an adequate behavior, and we will have an adequate lifestyle. And so there will be a correct adaptation to the stimuli that we perceive. And this is correspondent to health, because the action will be proportionate and congruent with the stimuli. But if we have one problem, because manas is confluent with the perceptions, and the perception tends to be polluted by values which please, displease, and this leads to raga. And in fact, Charaka says that the pathogenic factor in the body are Vata, Pitta, and Kapha, while in the mind they are Rajas and Tamas. So Rajas and Tamas, which are important because they help us in discriminating what it is in our perception, what is the proportion of our relationship with the reality. In some way, if they are excessive, they will cover, our possibility to discriminate the reality for what it is. And when this manas is polluted too much, that by these values of the perception, and so chitta is creating this kind of emotional status. This is the raga that Vagbhata in the Ashtanga Hridaya was speaking about, and manas and the behavior will become self-referent, and we will have a final behavior that will be self-referent. So we will have an output, a behavior in the being that will be not related to the real stimuli, but that will be related to an internal model of reality. And this is what is called prakti-aparada. That means the error of the intellect, because the intellect does not choose the right model of behavior, because it has been distorted in some way. Manas and Sharira, the body, are one. Again, this is the most important thing that we have to remember. This is the most important thing that we have to remember in everything. Of course, in yoga, in Ayurveda, in everything. There is no distinction. And manas is a padartha also, is an object. It is an object of Buddha, of the intelligence. So the manas configuration of its subtle property resonates with the gross constituent, with the Pancha Mahabhuta of the body, defining its status. So when we have balanced manas, we will have harmony at the Pancha Mahabhuta and harmony at the physical level. Harmony stands for the inner capacity to adapt, because health is the capacity to adapt to the change of the environment. It's a kind of resilience, health. And this is also what is at the basis of the concept of ojas in Ayurveda, which is translated as immunity, but it's nothing to do with what modern medicine think as an immunity. Immunity is one of the physical factors which are an expression of ojas. But ojas is something more, because ojas is the coherence of the living being. And all the parts, all the functions of the living beings are coherent. If you have an unbalanced manas, we will have instead a state of disorder and disgregation that can lead also to disease and to death also. So it is important also to remember that life, according to Charaka, implies the conjunction with physical body, senses, and mind and atma. So if we have a tattva manas, that means manas which is able to let buddhi to be in the right position to discriminate the reality, to make the right choice, and we have what is called awareness of our life and our physiology, and we have as an output of the awareness adaptive behavior and adaptive physiology to the change of the environment. That means at the root level to have health. Then this will reflect also with a coherence with the environment. The environment is not separate from the individual. I like very much. For me, it's very funny when the ecologist people, the ecologists, they say we have to think about the environment, and they put something outside. The environment is everything that we live in. We are including us. So we are part of the environment. We are actually the environment, the ecological system starts from us, from inside us, from what we think, what we are, what is from our mind, from our awareness starts the ecological action. So when we have a coherence within ourselves, we have a coherence also with the environment, a coherence in the environment. And this will bring to what is called in Ayurveda ojas, and at the end to the state of svasta.
We are sorry to interrupt Dr. Antonio.
Yes, we have. Yes, I finished. With the concept of svasta. So, very, very briefly, how Ayurveda indicates svasta vritta, which is rightly the behavior for healthy people, how to behave in an awareness, in a conscious way. Multidimensional preventive and therapeutic approach of Ayurveda, which has to be done again, considering the fact that mind and body are one thing. Dinacharya, which is a sub part of Svasta Vritta, which is the daily routine, and of course with the help of yoga. Yoga and Ayurveda are very close one each other. You find the same root for health and disease. But at the end, and with this I conclude, at the end of this, just from a very practical point of view, what we have to help our patient with, in order to reach all these things, the most important thing is to develop the attention, the presence of mind, the lucid thought. That means to get rid of raga, to get rid of all the things which are useless in our daily life. Thank you very much.
Thank you, Dr. Antonio. And now the session is open for question answer session. So if anybody has any question, can put it in the chat box. I think Dr. Antonio has very clearly explained how there is some overlap between the spirituality, Ayurveda, and also yoga. We need to understand that. Yeah.
Sandeep sir, there is a question in the chat section, sir. You can see the question, sir.
Somehow I am not able to see. If you can read that. I'm not able to read that question. Can you read that, please? That question is not available to me.
What is the impact and benefit of spirituality on anxiety disorders and functional disorders and harmonizing sympathetic and maybe parasympathetic nervous system?
Actually, the question is the answer to this question is in everything that I said, because we have to understand what is the basic of an anxiety status in the framework of the single individuals. We cannot speak about anxious states in general, because anxious state in general is something that is typical of modern medicine, that wants to find, wants to generalize things to everyone. But each of us has his own state that is expressed with anxiety. The spirituality, as I intend the spirituality, is that each of us has to find a way to get in touch with the inner self in such a way that all the useless emotions stops. We have to understand what is the root of the problem that is creating anxiety to us. And, we have many ways of doing this, but the main root is that one person should reflect on what are from a personal point of view, the causes that in some way are connected with the anxious state. When we speak about also the sympathetic or parasympathetic things, systems, we always think about the effect of something that happens somewhere else. Everything originated in the mind. Everything originated in the mind. This is the root of Ayurveda. This is the root of yoga. So if we take care of the balance of mind, if you understand what is the cause of disruption of the attention from the right pathway, we find the cure of many diseases. I know that this is very difficult because in our world we have the continuous distractions. The attention is the most important thing, and all the Bhagavad Gita deals with attention. All the Bhagavad Gita deals with attention. And this is what Krishna says to Arjuna. You have to be attent. You have to be present. You have to understand what is the real moment, not what you think that it is the real moment, what it is the real moment. So we have to stop to believe what we believe that we are.
Thank you.
Dr. Sandeep, you can give your comments and close the session, sir.
No, I think we are coming to the end of the session, and we had a wonderful session where we have learned the importance of Ayurvedic principles also in understanding the mental and physical health. So with this, I close this session and thank Dr. Antonio for this wonderful talk.
Thank you.
Thank you. Thank you.
Thank you, sir. Thank you, sir. Now I request Dr. Sandeep Grover, sir, to please kindly accept our felicitation.
Thank you. Thank you. I have received. Thank you.
We request Dr. Jayan Mendy, sir, to please kindly accept our felicitation. Thank you, sir. Now I request Dr. Antonio, sir, to please kindly accept our felicitation, sir. That was an excellent session on Ayurveda. Thank you, sir. Thank you, sir.
Thank you. Thank you very much. I'm honored. Thank you.
Now I'm going to the next session. It is on spirituality in mental health and well-being. I want to introduce the chairpersons of the next session, Dr. Sardar Khan, sir, from Afghanistan. Sir had finished his MD from Medical University, Kabul Medical University. He had done specialization in psychiatry from Kabul Mental Health Hospital between 2013 to 2016. He had done his internship at Vimhans, New Delhi, 2017. Currently is working as Chief Psychiatrist at Private Clinic, Kabul. Welcome you, sir. Next, I introduce Dr. Naresh Vadlamani, sir. He's from Gandhi Medical College and he has done his MD from Usmania Medical College. He is currently Associate Professor at Apollo Hospital of Medical Sciences. We welcome you, sir. Now, I request Dr. Minaj Nazirabadi, sir, also to chair the session. Dr. Minaj, sir, is Professor of Psychiatry at Deccan Institute of Medical Sciences. We welcome you, sir. I request Sardar Khan, sir, to introduce our speaker, Dr. Muhammad Iqbal Afridi, sir.
Yes, Dr. Muhammad Iqbal Afridi from Pakistan. He completed his MBBS from University of Peshawar in 1986, KPK, Khyber Pakhtunkhwa, Pakistan. He completed fellowship at Royal College of Physician in 2002, Ireland, clinical fellowship in psychiatry at College of
I request Speaker Afridi, sir, to keep his video on so that we can spotlight his video.
Yeah, Dean in the Faculty of Psychiatry, CPSP College in Pakistan since 3rd January 2020. Adjunct Professor, Department of Psychiatry in Texas, Editor-in-Chief, Journal of Pakistan Psychiatry Society from January 2021. He was the President of Pakistan Psychiatry Society from 2019 to 20, published 104 research papers, articles, and presentation and international conferences on topic related to these: psychiatry, psychosomatic medicine, and addictions.
Afridi sir, please on your video, sir. Video and audio. I request Naresh Vadlamani sir.
Sure. Welcome, Dr. Iqbal Afridi, sir. I think it's our honor and privilege to have you as one of the speakers in this distinguished list of speakers that we have across the world. Spirituality and spiritual health, which has been defined by WHO, having 5 dimensions: the physical dimension, the mental dimension, the psychological dimension, as well as the emotional, as well as the social dimensions. And spiritual dimension is one of the key components of fitness, which includes the mental health dimension as well. And I'm sure Dr. Iqbal Afridi would enlighten us with his talk regarding the same wellness as being a part of spiritual health. I would request him to start his talk without much delay.
Hello, everyone, and I'm thankful to all of you for giving me this opportunity to talk about spirituality and well-being. Actually, there is a problem to display my slides, but anyhow, I don't want to waste my time, so I'll directly talk about the slides from my computer. So I'm very thankful to the Indian colleagues for giving me this opportunity. The disclosure is there's nothing to disclose. As you all know that the WHO has given a very good definition of the health, that it is a state of in which is comprising of physical, psychological, and social well-being. But when they were given the task to define mental health, they were just came with one sentence that mental health is broader than lack of mental disorder. And they were not able to fully describe. But luckily, the World Federation of Mental Health has given very good definition that it is a state in which every individual realizes his or her potential, number one, and number two, can cope with daily stresses, and number three, can work fruitfully and productively, and is able to make contribution to his or her community. That means if somebody is not contributing to his or her community, and if he's not aware of himself, then he is not mentally healthy. So coming to the 8th dimension of mental health, as you all know, that it comprises of the emotional component. That means the person should be able to cope effectively with life and create a satisfactory relationship. The financial aspect, that person should have a satisfaction with current and future financial situation. The social aspect is to develop sense of connection and belongingness. The spiritual component is very important, that we have to see the purpose and meaning of life and relationship with other people. The occupational component is the person's satisfaction. And as you all know, that physical component is physical activity, that is diet, nutrition, the anatomical, physiological, and biochemical harmony. The intellectual health is the ability to think clearly and make responsible decisions. And the environmental component of the dimension of wellness is the good health by occupying pleasant environment with support and well-being. So then coming to the spirituality, it is a broad concept with room for many perspectives. In general, it includes sense of connectedness to something bigger than ourselves, and is typically involved a search of meaning in life. As such, it is a universal experience, something that touches us at all, and is a way of relationship to which it is regarded as a sacred. So one of the world's largest circumference that takes 40 minutes to calculate single second of human being brain activities, largely having many aspects. There are many faculty of brain which include orientation, and then to time, space, in person, similarly to the cognitive aspect, that's abstract thinking, and also the how to think rationally creative aspect. So basically, the spirituality, you can have a physical transformation until you have a spiritual transformation. So that means the if you look at the spiritual component to the prevention and treatment of mental disorder, that is really a concept that eliminates the problem in the mind and making awareness of us about the surrounding and of the people especially. And so, and we all know that the power of mind is relaxing and healing. So working your body with full energy and flexibility, taking into account the surrounding, that is physical and emotional component, and also the person and work aspect, so that really lead to satisfaction. So coming to the aspect of the what makes us change and make us purposeful and practical. So that for that we have to grow and connect, explore ourselves and others, and also we should have explore forgiveness and work with grief and moral injury and recovery. So the four primary aspects of effect of spirituality on mental health are: number one, symptom presentation. The symptom presentation is different in different culture, keeping in mind the spiritual aspect. And this can be a protective aspect. If somebody is having a strong spiritual well-being, he can have a lot of prevention from the various mental conditions. And also the third component is spiritually and religiously coping skills are really the effect of the spirituality or mental health. So if somebody is having coping strategy based on their own belief system, so he can struggle with the problem in the surroundings. So CBT focus on what is going wrong in negative cycle, and so client can develop negative biased view of themselves in the following four area way. Positive psychology such as resilience, flow, and strength, and can really give us a protection. And post-traumatic growth, if somebody is having a problem, and the CBT can focus on the growth and the resilience component. And similarly, strength based CBT can be also be the good aspect of spirituality. And the recovery can also be based on the spiritual component. Now, the spiritually psychiatry and special interest group, a lot of the Royal College of Psychiatrists was found in 1999, and they came with the special interest group in 1999. The spirituality psychiatry special interest group, and they want to help the psychiatrists to share experience and to explore spirituality in mental health care, and to increase knowledge of the research link spirituality with better health, and to raise profile of spirituality and patient care. So this was the three tasks they kept the Royal College of Special Group related to the spirituality. So in Pakistan, when I was president, so I also developed 36 special interest group, and one of them was the spirituality and psychiatry. And we requested the chair, Professor Khalid Mufti, who was the then zonal representative of WHO, to chair this session, chair this group. So spirituality, psychiatry, and CBT, reconciling faith and therapy. The science and religion and spirituality do not mix, but now we are learning spirituality play a key role in better management of mental health or mental disorder. So we all know that the science is really discovering the basis of the evidence that spirituality can help to in the management of mental health disorders. The doctors, nurses, and other healthcare providers, along with patient and their caregiver, are the front line where the spirituality dimension of healthcare is there. So therefore, we as a therapist who may be a doctor who are playing a role as a nurse or other healthcare should work with patient and their caregiver according to the available knowledge of the spirituality, which is evidence based. Now, spirituality assessment, how we can assess that this person is having the spirituality. So we should not we should respect the belief system of the person, but we can ask in a very empathetic way that are you spiritual? What is your spirituality concept? What do you think derived from the mind or body? This type of question, if we ask from our client that what do you think about the mind and body, and where do you believe we come from? So then you can assess that this person is really having a spirituality basis or their knowledge. And what are their belief system about the nature of the man? Nature of the man and what happened when you die? We can ask certain. This is the assessment for spirituality. We can just simply ask that what happened when the person die, or what is the purpose of life? So if we ask this question, if the person is non-spiritual type of person, he can give a lot of explanation based on their science knowledge. And we can also ask them that why does adversity happen to us, or why this condition happened to us, and what does your faith say about acceptance? Or so these type of question, if the therapist who can be psychologists or psychiatrists ask, can assess that this client is having a spirituality base or not. So we cannot work without the addressing the spiritually and health, and particularly mental health. And nowadays, if you search the YouTube or other thing, there are a lot of videos and other write-ups which focus on does religion affect public health or not. So there is a big group who is working on that. And then health benefit of deep religious commitment. How does spirituality impact health and religious? And these are the various topics which are covered by different people. So therefore, the mental health therapists, especially psychiatrists and psychologists, must be familiar what is happening in the world on the internet and in the electronic and print media, so that we can prepare ourselves for the patient's benefit. So what does a Muslim client, what works for Muslim client, for example? I will focus because there are many colleagues and having different religious beliefs. So in order to give the Islamic perspective, so I will focus on the Muslim clients, what works for them. So Muslim prescribe to religious schema about all other competing schema. So Islam is a powerful instrument for cognitive realignment. So therefore, if we want that the person should have realignment, cognitive restructuring, with this, so their beliefs, Muslim belief is a powerful instrument for them. And Islamic psychology used CBT, offering key to unlock, assess, modify schema for enhancing well-being and outcome. So now the education from Quran and Hidayat say that contemplating of relevant text from Quran is, oh, no soul do we place a burden greater than it can bear. So therefore in Quran, the Almighty Allah said that we do not give greater burden to a person if he cannot bear. So therefore, if somebody is having problem, we can say that God knows that you can bear this problem or this grief. And the aim is to realignment of the competing belief that I could have died, I didn't because my time did not come. So therefore, we can explain then what is happening to you if the person is having depression or having some anxiety. So we can, and if he is having grief, so we can ask them that as a spiritual concept, you can bear this. You have the power that you can tackle this situation. The concept of nafs in Islam is that akal. Akal means intellect or rational reasoning of mind. The qalb. Qalb means spiritual heart or seat of knowledge, intention, belief, or justice. And the nafs is conforming to the ego, feelings, desires, and the ruh. Ruh is basically the spirit, the true human, the one in the charge. So the aim is to use the national, rational reasoning of mind, that's equal to problem solving, understanding themselves and the world. So if we use this, that the akal is given to you to solve yourself and also to understand yourself and the world, so that you can function properly. And to develop the heart, that means qalb, make it pure, for example, through sadqa or charity or patience or compassion, kindness and honesty. So if you want to have a sukoon-e-qalb, that is the harmony of your heart, then you have to give charity. Also, you have to give kindness and honesty. And the nafs-e ammara, which is almost like the id, the lower negative self. So we can Islam, in Islam, the id, ego, super ego concept is for the last 14 centuries. Nafse Ammara, which is just like it, and Nafse Mutmainna and Nafse. So therefore, Nafse Ammara is basically where it is a lower negative self, and it is this gratification is done. This acts on pleasure principle, that everything, and as you know that in it, the id is act on the pleasure principle, and aggression and hunger is there. To develop nafse lawama is reproaching self, while self-analysis and remorse and patience. This can be equalized to the superego. So in superego, we see that how to analyze ourselves, remorse, and so therefore, this is just opposite to the id. To continuously strive to achieve nafse mutmaina. Nafse mutmaina means peaceful self, which can be equalized to ego, which taking into account the force of id as well as superego, this acts. So therefore, this is the rightest pathway and overcoming negative thoughts, feelings, and behavior. So that can be, in Islamic perspective, can be achieved through zikr, prayers, and also mindfulness. The mindfulness concept is already there in Islam since centuries, that if you are working with mindfulness, that means attention, intention, and attitude. This can be very useful for the task, fulfilling the task as well as with satisfaction. So teaching mindfulness meditation is really an important component, and teaching mindful meditation focus on breathing and Allahu, that is the naming the Allah, and so therefore the Islamic perspective is really satisfaction to the application of mindfulness to zikr that is recitation of 99 names of Allah, and Ya Sabir, Ya Kavi. So these are the various zikr which is also available in a similar connotation in other religious belief system. And the salat, which is prescribed five times a day, give us to connect with Allah and relieve our tension and other things. So recitation of Quran is also meditative, spiritual exercise. So the if you look at the what is happening in the various universities of the world, the Duke University has also came with the Center for Spirituality, Theology and Health, and they have 5 main goals for the center that conduct research on the religion and spirituality, train those who wish to research, interpret the research for clinical societal application, explore the meaning of research and poster, and discuss how theological input can advance research. There are a lot of publication available on the various university website, and they focus on various educational intervention, their clinician attitude and practice. So Allah and holistic health, which is the Islamic perspective, is as a Muslim people have the comfort of knowing that they have Almighty Allah, who the Quran says is familiar with all of our pains, suffering and trial. So he knows how depression make you feel. He knows how hard it is to deal with your physical or psychological illness. So therefore, the Islamic perspective is tell us that and there are a lot of belief system that Surah Rahman, reciting Surah Rahman and listening daily, it will solve many problems related to the body as well as mind. So although the benefit of spirituality is mental health are personal, but focusing on spiritual wellness work for many people recovering from mental and mood disorder or even a substance use disorder. We can use the spiritual concept for treating the or management of the substance use. So all clinicians involving mental health care should receive training on spiritual and religious aspect with 3 broad goals. So 3 broad goals can be to recognize and distinguish pathology from more normal religions and spiritual expression. Number 2, to acquire therapeutic skill, knowledge and attitude to deal with religious spirituality issues and mental health care. And number 3, to acquire clinical competence in addressing spirituality in actual treatment setting. So therefore, the essential content can include general information about the research related to the spirituality, gathering interpretation and information about the spiritual history. So how to spend more time in spirituality? So as our colleague in the morning sessions, it's very well said that the yoga and the mindfulness and the prayers and the community. So the yoga can be restored, the activity that both believer and non-believer can benefit. So we should not contradict the belief system of our client, but accepting their belief system, we should also talk about the various evidence-based religious things which can help patients suffering from psychiatric disorder. For example, we can say that what is mental health, what are the components of mental health, what are the essential for the promotion of mental health, and how we can sustain mental health. So all these things can be addressed through the various spiritual concept. For example, when I was the president of Pakistan Psychiatric Society, we during Corona developed that how to wash your hands. So correct hand washing, we said that it should be mindful. You, number one, you should have good niyat. That means you have good attention, intention, and attitude. And when you are starting washing your hand during COVID or other thing for benefit, you should think that this in Urdu we say that paki nis iman hai, and israf के तकाजों को मद्देनजर रखते हुए पानी बहाना है, जाया नहीं करना है. So therefore cleanliness has should be emphasized in every religious perspective. And we should for example, we should not waste the water, as well as we should think that now I'm cleaning for my benefit, for other benefits. And so therefore making yourself mindful while washing your hands or anything, this can, with attention, intention, and attitude, can reduce your suffering, as well as can promote your well-being. So therefore, and after completing your hand wash, we said that हिफाजत की दुआ और नेमतों का शुक्राना अदा करना है. That means express gratitude for blessing and praying for the protection, that I have cleaned my hands and hand washing is done complete. This should protect me and others. So you have to think collectively. So with this, I'll end my talk that we should take into account the mind and heart and develop a balance, so that we can promote health, mental health, especially through spirituality, to prevent, defeat, detect mental illness at all level and by all means, and especially with spirituality. Thank you very much for your attention and concentration. I am sorry that I could not display my slides. Thank you so much.
Thank you, sir. That was an excellent presentation.
Thank you.
Sir.
Yeah, thank you, Professor Iqbal Afridi. That was an excellent presentation. And you have well discussed about the nuances of spirituality and well-being from the perspective of Islam. Now I would request my co-chairpersons, Dr. Minaj Nasirabadi and Dr. Sadar Khan, to kindly give their inputs.
Thank you, sir. That talk was very relevant, and how to Islam treating patients. As they say that Islam is a way of life, and you as you correctly said, that during namaz we talk to Allah, and through Quran Allah talks to us, and there are lots of things in which Islam teaches us for cognitive restructuring. There is one question from Dr. Nandini Reddy, sorry, how we can put in Vedic perspective, how can we use Vedic perspective to restructure cognition? As you said that through Islamic perspective, we can restructure some cognitive beliefs. So how do you think that we can do it with Vedic perspectives too? Question for Professor Iqbal Afridi.
I think if you look at the by and large every religion promote, and there are many things similar to all religion. For example, every religion emphasize that you should respect senior, love your juniors, and you should respect people, and also you should not tell lie, you should work properly. So therefore, if we in every aspect, in every either in Islam or any other religion, the main things which all are agree on that we should be disciplined. For example, we can emphasize that cleanliness is very really important. All religion does promote, if you remain clean and also work properly sleep, and also you respect your jobs, your senior, your juniors. So therefore this will create a lot of good thing, and whatever you like for yourself, you should like for others. So in that way, we can address a lot of issue, interpersonal relationship. For example, if there is a problem among the lady with in-law, you can give this that you have to respect like your mother. So therefore, a lot of good things can be applied in all religion. In all religion are there which can promote well-being. So therefore, I think the spirituality concept can help in any religion.
Thank you, sir. That was sorry, I was wrong. That was Dr. Suhasini Reddy asking you the question. Now, can I ask Dr. Sardar Khan sir to give his comments? Dr. Sardar Khan sir. Dr. Sardar Khan sir.
Yeah, yes, I hear you. Actually, there is many things which is good for our life and mental health and well-being in Islam and other religion. Many things is same in all religions, and but what I say, what I see in my what I see in my society and my private clinic practice, there is a lot of negative points also related to scholars of Islamic scholars and some spirituality scholars who use hypnotherapy, psychotherapy, like we have in Tariqa. There are 4 ways in our religion, Naqshbandiya and others. There are some negative points. What I see in my practice, many people who use hypnotherapy at the wrong way. The people, the followers has some mental disorder like anxiety disorder, obsessional thoughts, damage order, suicidal, and psychosis, anxiety sign symptom. What it's my hypothesis. Many people and patient which I see and check and observe in my society, in my clinic, they got some on wrong way. Because the scholars use the religion for their own benefits. So belong to there are positive points also and negative also in the religion.
Yes.
Thank you, sir. Thank you for your inputs. I think it's time to close the session. Before that, momento presentation. Sai, over to Sai.
Yeah. Thank you, sir. Thank you, Afridi sir, Sardar Khan sir, Lakshmi Naresh sir, and Minaj sir for accepting to be part of our program, sir. Now I request Sardar Khan sir to please kindly accept our felicitation, sir.
Thank you.
Thank you, sir. I request Dr. Lakshmi Naresh sir to kindly accept our felicitation, sir. Thank you, sir. I request Dr. Peter sir to kindly felicitate our chairperson. I request Peter sir to please kindly felicitate our chairperson, Dr. Minaj Nasirabadi sir. I request Dr. Vishal sir to please kindly join. I request Dr. Shiva to join. I request Arvind Brahma sir to join the felicitation. Thank you, sir. I thank all the speakers and chairpersons for maintaining the time. I request Dr. Iqbal Afridi sir to please kindly accept our felicitation.
Thank you so much. Thank you very much.
Thank you, sir.
Thank you.
Thank you, sir. Next, I want to go to the next session. Next session is on spirituality, Buddhism, and wellness. Now I invite chairpersons, Dr. Chong Yi. She is specialist in psychiatry and honorary clinical assistant professor at University of Hong Kong. She is chair of WPA Scientific Section on Religion, Spirituality, and Psychiatry. She is council member of Hong Kong Community Psychological Medicine Association. She is active in professional education and supervision for counselors, social workers, and teachers. She is a honorary consultant for counseling services and SANE special education needs student support in a local tertiary institute. She is a trainer of Hong Kong Academy of Social Work and Hong Kong Social Workers Association for supporting special education needs students and providing training to teachers in teenage suicide prevention. I'm sorry, she's a committee member of WPA section on religion, spirituality, and psychiatry section. We welcome you, madam. Next, I invite Dr. Vishal Akla, sir. He is professor and head Department of Psychiatry, Government Medical College, Jagityal. He was nominated as convener, IPS Media Specialty Section 2022-23. He's chairman, Mental Health Awareness Committee, IPS Telangana State Branch. He's a member of Community Awareness Committee, IPS South Zone. He served as Assistant General Secretary and held various positions in IPS, both state and national level. He had received Indian Medical Association National Award for his contribution, President Appreciation Award, Ketan Desai, National Yuva Leadership Award, Dr. N. Ramchandra Murthy Award. We welcome you, sir. Next, I invite today's speaker, Dr. Professor Harishchandra Gambhira, sir. I request Vishal, sir, to introduce the speaker.
Good afternoon. Good afternoon all. First of all, good afternoon, Dr. Professor Harishchandra Gambhira and my co-chairperson, Dr. Chong King Yi. And I would like to thank the organizers for giving me this opportunity. So I would like to introduce today's speaker, Professor Harishchandra Gambhira. He is from Sri Lanka. Dr. Gambhira finished his MBBS in 1982 from University of Paradenia and finished his MD Psychiatry in 1997 from University of Colombo from Sri Lanka. And consultant psychiatrist, he is a consultant psychiatrist and visiting lecturer at the University of Kelania. And he was president Sri Lanka College of Psychiatrists 2006 and 2008. And he was the president of SARC Psychiatric Federation 2009-2011. And he was chairman, Board of Study of in Psychiatry, EGIM, University of Colombo, 2013-2016. And Dr. Gambhira published several articles in international journals and gave many representation in local and international conferences. So thank you very much, sir. I would like to hand over the mic to my co-chairperson, Dr. Chong.
Hello, everyone. Thank you for your kind introduction. I'm Dr. Chong. I'm a psychiatrist from Hong Kong. For Hong Kong, most citizens are Chinese, and the majorities are the followers of Taoism and also Buddhism, which has more than 1 million followers, respectively. Yet, these followers varies a lot in their commitment in their religious rituals, ranging from daily or weekly prayers or worships and in-depth study of scriptures to just have their funerals rituals held in their preferred religion. For Buddhism, most Chinese in Hong Kong got a brief concept about mindfulness and meditation, and the monks are leaving their family, having a simple life. So may Professor Harishchandra Gabira enlighten us in this lecture from his experience that how we can introduce Buddhism spirituality for a better well-being of mental patients and other citizens in general. Thank you so much, Professor Gabira.
Good afternoon, everybody. Thank you for kind introduction, and I wish to thank for inviting me for these important sessions to talk about spirituality, wellness, and Buddhism and their impact on mental health. In fact, various speakers who spoke earlier defined various ways according to their cultures and cultural belief. But spirit, if I want to define it, it defines as a sense of human or animal. It is non-matter that everybody told it is non-matter. In Buddhism describes non-human existence of animal with only spirit, no physical body. Evil spirit, preta, bhuta, gandhabba. But these things are found only in literature. There is no evidence described so far. Sorry for that delay. The spirit is described as a sense of human or animal. The spirituality, there are many definitions as everybody described. Spirituality is defined as that relating to or consisting on or having the nature of spirit. The nature of spirit is intangible or immaterial. The spirituality is an individual's experience of and relationship with fundamental non-material aspect of the universe that may be referred to in many ways: God, higher power, the force. Concerning the spirit as opposite to the matter, it concerned with the soul or Atma. And the religion and spirit is closely related, and Oxford Dictionary defines the belief in a superhuman controlling power and a particular system of belief and worship. It also has been defined as religion is an organized belief system promulgated and sustained by a human institution, ethnic groups, tribe or culture, and involves definite rules of behavior, practice, and rituals. The religion and spirituality goes hand in hand together. The spirituality and religion are not intangible or always linked. Therefore, a person may have religion without spirituality or a spirituality without religion. Therefore, it is not always linked with together the religion and spirituality. The spirituality can have both positive and negative effect on physical and mental health conditions. We leave aside this non-material concept of spirituality. It has many components as we describe. It has trust, compassion, hope, joy, forgiveness, love. These things are essential for human existence, cohabitation, and cohesion of society. The religiosity is defined as the religion organizes the collective spiritual experience of a group of humans into a system of belief and practices. They say the people who more than 150 groups are collected together by various things. One is religion and religiosity. The religiosity and religion can keep group of people together in society, even they are not closely related. Religious involvement of or religiosity is called the degree of participation in or adherence to belief and practices of an organized religion. The spirituality and mental health. The main topic of the conference today is the spirituality and mental health. Therefore, we need to find out what relationship that and what the spirituality impact on mental health. Muller and others have shown that addressing the spiritual needs of patient may enhance recovery. He mentioned only recovery, but not as a treatment. Further, spirituality and mental health, the religiosity and spirituality are associated with better health outcomes, including greater longevity, coping skills, and health-related quality of life, even during terminal illness, and it causes less anxiety, less depression, and suicide are less. Again, Muller described it as addressing the spiritual needs, the patient may enhance their mental health. The spirituality and mental health continues. The many studies, including meta-analysis, shown that a strong association between religiousness and depressive symptoms. It has found that religiousness is modestly but robustly associated with lower level of depressive symptoms, that is minor degree depression, but not the moderate or severe degree depression. Religiosity and spirituality help immensely for coping and better outcome from mental illness. The wellness, one component of the conference today. What is the wellness? WHO defines wellness as the optimal state of health of individual and group. And wellness is expressed as a positive approach to living, its active process. The primary difference between health and wellness is that health is the goal and wellness is the active process of achieving it. You truly cannot have health without first achieving wellness. In defining wellness, there are several definitions again. The Global Wellness Institute defines wellness as the active pursuit of activities, choice, and lifestyle that lead to a state of holistic health. Again, mental, physical, environmental health. The two important dimensions to this definition, one is that it is an active pursuit that is associated with intentions, choices, and actions as we work together towards the optimal state of health and well-being. And also it linked to holistic health, that is extend beyond physical health and incorporates very different dimensions that's going beyond the physical and mental health. Wellness is multidimensional. It involves physical aspect, mental, emotional, spiritual, social, and environmental. Therefore, wellness is about more than just physical health. WHO defines of health, or all of you know that, I need not to say it again and again. However, it defines health as a state of complete physical, mental, and social well-being and not merely absence of disease or infirmity. Therefore, it involves spiritual health too. The mental health is a dynamic state in a spectrum from no disorder to optimal health level, and the disease, ill health, from mental disorder to death, suicide, or homicide. Therefore, everything remains within the spectrum, and spirituality operates at certain level just below the not having illness and up to a spectrum, top of the spectrum, that is optimal mental health. Now we come to the crux of the matter today, the Buddhism. Sri Lanka is a mainly Buddhist country, that is Theravada Buddhism exists here. It's very religious people, but suicide rates are very high in Sri Lanka, as you know, but it is not the top. It was in 1980s. The Buddhist view is that moral behavior flows naturally from mastering one's ego and desires and cultivating loving kindness, that is metta, and compassion, karuna in Pali. Loving kindness and compassion are the essence of Buddhism. There are several noble truths in Buddhism. The foundation teaching of Buddhism, expressed in four noble truths, is that the stress and unhappiness, suffering of life, dukkha, is caused by our desires and ego clinging. Our desires causes dukkha. How it happens? Buddhism is a moral philosophy. Buddhist values are ingrained in superego. In growing up in a Buddhist culture, people ingrain their philosophical morals in their superego. Everybody, all psychiatrists understand the basic three components as Freud described: id, ego, and superego. Superego is the conscience that ingrained of social value system, and the spirituality, everything is there. The ego and it, you know that these three are in constant conflict. Ego is there to fulfill its needs under the guidance of superego. People who are cultured and work with spirituality, they place their ego closer to superego, and people who are uncultured and rascals, they build their ego close to the id with sex and aggression predominantly. The Buddhist, the moral philosophy, the moral values ingrained in superego component of personality helps for optimizing mental health. Therefore, the Buddhist philosophy, Buddhist values, social values introduced by Buddhism helps optimal mental health. And ritualized meditation helps in prevention and treatment of common mental illness with low genetic contribution. That is important that when the genetic contribution is low, it is mainly environmental factors operate that in the causation of the illness, and also hence the healing processes also the environmental factors more important than the genetic factors and medication. Therefore, ingraining more Buddhist values
Sir,
in
slides
their
are not
superego. The superego, can you hear me?
Yes, sir. Yes, sir.
Yeah. The superego is the ethical component of the personality and provides the moral standard by which the ego operates.
Sorry, sir. Your
Therefore,
slides are not moving, sir. Your slides are not moving, sir.
Anuka?
Now it's okay, sir. Sir, make it full screen, sir. Yes, sir. Thank you.
Sir, please unmute, sir. Gambira, sir, please unmute, sir.
Sorry about superego. The superego is the ethical component of the personality and provides the moral standards by which the ego operates. Therefore, in a particular culture that share the values of Buddhism, the entire culture will be peaceful and helping each other, respecting each other. And in superego, it ingrains moral standards, social value system, ethical standards, and social norms that build or construct cultured person. Therefore, Buddhist values ingrained in superego, that person we can call him a cultured person.
Sir, okay. Unmute yourself, sir. Okay, sir. Okay, sir. It's okay, sir.
Slides are not moving again.
No problem, sir. You can continue, sir. No problem, sir.
Right, sorry. Buddhist moral philosophy and personality that provide or to construct a person with several components, that 5 precepts, middle path, noble truth, and eightfold path. We will see what these are individually. The middle path means both a cognitive middle path and behavioral middle path. In cognitive middle path, that stand middle without going to extreme in cognitive functions. The behavioral middle path between extreme asceticism on one hand and sensual indulgence on the other hand. Therefore, in middle path of both cognitive and behavioral ultimately leads to nirvana, that is most happiness. The middle path means neutral, upright, and centered. It means to investigate and penetrate the core of life and all things with an upright, unbiased attitude. In order to solve the problem, we should position ourselves on neutral, upright, and unbiased ground. We investigate the problem from various angles, analyze the findings, understand the truth thoroughly, and find the reasonable conclusion. Therefore, without going to extremes of anything that is both cognitive and behaviorally, if you stand middle, upright, and centered, you can find the correct path and finally attain Nibbana. The 5 precepts that we observe every day for everybody. The first is that refrain from taking life, not killing any living being. Not killing any living being, it is the most important part without any hurting everybody. Number 2, refrain from stealing from others. Number 3, refrain from the misuse of the sense, not having too much sensual crave. Number 4, refrain from wrong speech, not lying. Number 5 is that refrain from intoxicants that cloud the mind, and alcohol and substance use is prohibited. The 5 precepts. In everyone in society, internalize 5 precepts into superego, that is conscience. You will not have many losses, no conflicts, no crime, no wars. Certainly beneficial for optimal mental health, not for only individual, for the entire culture, entire society, it is beneficial. The 5th precept, refrain from intoxicants that cloud the mind. Religiosity was strongly associated with lower drug abuse, even other controlling for the relevant socio-demographic and educational variable. This how to eradicate this suffering. Entire Buddhism is to remove suffering. Suffering causes of suffering. First, we need to understand what is suffering is, how our body and mind suffer. And second, we need to understand cause of suffering and pathway to eradicate suffering and prevent birth. Now we need to understand whether the suffering is an inevitable event of life. The sorrow, as mentioned in Buddhism, is several sorrow. That is, birth is sorrow, death is sorrow, illness is sorrow, separation from favorite is sorrow, aggregation of undesirables is sorrow. How to avoid death? The main cause of death is birth. Therefore, we need to prevent birth, to stop, to avoid death and illness, everything. Now the question is how this life origin, how life exist. Now the question we need to ask is, can we stop replication of DNA? Because the main mode of existence of human or any animal or plant is the replication of the DNA. It talks about the sorrow, it talks about the anhedonia, that is Buddhism. This anhedonia is this depression, inability to generate pleasure from which he or she generated in the past. This is, of course, different from sorrow that mentioned in Buddhism. Now the issue is, the Buddhism addresses the issue of birth and how to prevent birth. Can birth be prevented? Birth is a result of replication of DNA. Therefore, now what is our mechanisms or our strategy to stop replication of DNA? The principal duty of DNA is to replicate. Can it be prevented by any means? The question is that. The suffering again, to go into deep, the noble truth of sorrow. The sorrow is the unsatisfactory or unhappiness that every person has to experience. It is the opposite of ultimate happiness. From birth till death, everything is suffering. Age, disease, dream, etc. all causes sorrow. The second noble truth is that the origin of sorrow is in desires, innate drive desires, is the only cause of suffering. People crave things like pleasure, power, love, respect, etc. for their own sake. When a self-centered need remains unfulfilled, he suffers in sorrow. The third noble truth is that cessation of sorrow. The person's need never ends. Whenever his one wish is fulfilled, the wishes for other things comes up. So avoiding crave is the only way to end sorrow. Ending all the craves by enlightened wisdom is called nirvana, or that ultimate peace. But what does craving do? Crave for luxury is the secret of human evolution and social development. We are happy with what we had and have. Where is the development? We would have fixated that hunter-gatherer society if we did not have crave for a better life, luxurious life. We would have been still under the tree in the cave, running behind animals to kill. The fourth noble truth, the noble truth of the path of cessation is sorrow. By practice and training, one can drive his craving to an end. This emotional and physical training can be achieved through noble truth. And also they describe eightfold path to nirvana. First two, wisdom related to right understanding of the body and its suffering, right thought, why we suffer and how can be eradicated. The moral conduct, right speech, right conduct, right livelihood, those things are more important for a healthy society. The right effort, right mindfulness, right concentration, that is for mental definition. Now, we go some neurobiological effects of this, our rituals. In Buddhism, meditation exists in many other religions also, but effect of meditation on mental health. The increased activation of areas involved in sustaining, monitoring the focus of attention, dorsolateral prefrontal cortex involved in there, activation of left caudate anterior insula involved in attention and corporeal awareness, that is basically mindfulness. Decreased activation in areas part of the default mode network and is involved in mentalizing rostral post prefrontal cortex. Meditation related anxiety relief force associated with activation of anterior cingulate cortex, ventromedial prefrontal cortex and anterior insula. The self-awareness insula medial prefrontal cortex and precuneus. Attention controlled by anterior cingulate cortex and the striatum. Emotion regulation, multiple prefrontal regions, limbic regions, and the striatum. Increased parasympathetic activity, relaxation, cushions, reduction in heart rate and respiratory rate. Reticular nuclear stimulation of posterior superior parietal lobule. It has anxiolytic effect with increased GABAergic effect. Anxiolytic effect in meditation is that by increased parasympathetic activity, decreased locus coeruleus firing, decreased corticotropic release hormone, endorphin release, arginine vasopressin release, increased GABA. The antidepressant effect on meditation, that is in mild depression, it increased 5-HT, increased dopamine, increased arginine vasopressin, increased melatonin, increased BDNF, increased endorphin relief with antidepressant effect. Therefore, in mild depression, meditation helps to a certain extent. Release of arginine vasopressin, positive effect, reduced fatigue, improved consolidation of new memories. The analgesia that produced by meditation is increased by increased serotonin combined with lateral hypothalamus, innervation of pineal gland, increased production of melatonin, calmness and decreased pain sensitivity. Those are the mechanisms, neurobiological evidence that support mental health issues in mild common mental illnesses. Now we go to the mind and Buddhism. The mind in Buddhism. The Mano Pubbanga Madhamma, they say that mind is the root cause of every merit and demerit. The nirvana is supposed to be neutral state, neither merit nor sin, no emotions. Something like depersonalization, if we think it's like in that manner. But there are controversies and questions in existence of mind and body duality, mind as individual institutions or individual organ. There are questions that has been there for last several centuries and is still not resolved, definitely not resolved during my lifetime. The mind linked to the next birth. According to Buddhism, the last thought at death go and give rise to next birth. In Paticca Samuppada, and karmic forces decide on fate and the journey of samsara. The highly questionable that the last thought, which is non-matter, transformed to a physical body, panchaskandha, unless it is a miracle. Who decides our fate? Obviously, it is our personality, that how we act in vagaries of social circumstances, by genetics and environmental factors, again development of superego and placing ego in between it and superego. A person or ethical human being, or in other words, human agent, is produced by these environmental factors. Gautama Buddha refused the existence of soul. He concentrated mainly on mind and body. Now the question is this mind replace the soul? All the duties done by soul is now doing by the mind in Buddhism. Therefore, we need to question that Buddhism replace the soul by mind. What is mind? Is mind an independent organ or an institution? Has mind specific functions? It has the belief that the mind is an independent institution, the sixth sense. Functions attributed to mind in the past and even now by some individuals were consciousness, abstract thinking, human and free will. Those functions are thought to be due to the functions of mind. The brain is enough for, now we understand by functional neuroimaging, the brain is enough for the full functioning of the The brain is the cause for consciousness. Its entire brain is 21 point. Abstract thinking, humor, simulation, use of symbol, and free will. No specific areas identified for this because it's several parts of the brain involved in producing these symptoms. Now we know that all the functions attributed to the mind are really the functions of the brain. All the functions including consciousness, thinking, feeling, abstract thinking, free will, and humor are functions of the brain. Again, it has been believed that having the knowledge of a sensation is by the mind. For example, now say, I see there is a Chinese teapot on the table. But not only I see that there is a teapot on the table, I also know that there is a teapot. I see it, I know that I see it. Therefore, it's two level, and that is thought to be due to mind in the past. Now people understand it is the connectivity of the brain and also the association areas of the center. The free will was thought to be from the mind and it is independent from any sensory perception or memory. The media expert Marcel McLuhan and many others state that the free will is a myth and cause of every thought, feeling and action are secondary to sensation and perception, which is called determinism. Therefore, now the free will is out scientifically, and it's understood that it is basically depend on the sensation that we perceive and we call determinism. Therefore, we need to redefine the mind. Mind is nothing but the cognitive functions of the brain. Therefore, it is up to the cognitive functions and the various levels in information processing is how the mind works. Therefore, mind is nothing but cognitive work in the brain. The Buddhist values, however, whether there is a mind or not, the Buddhist value, the moral philosophy, support mental health. The effect of Buddhist values certainly helpful for optimizing mental health, especially beneficial for supportive measures, the treatment of common mental illness. What effect for the major mental illnesses, those with high genetic contribution, may be ability coping. Mindfulness, the concept of mindfulness originates from practice of Buddhism and defined as a focused awareness of one's experience and purposeful and non-judgmental focus on the present moment. The neurobiological nature of understanding and this mindfulness is yet not well described. It is, I do not know, observing religion is by the mindfulness training. Therefore, Buddhist philosophy provides enough support for development or construction of superego with high quality social value system to produce a human agent. That is for a person who is ethically bound, responsible and accountable. Thank you.
Excellent and lucid presentation, sir. Now, so I would like to request my co-chairperson, please give a comment about today's lecture.
Thank you, Professor Gabira. This is Dr. Zhang, and I have a question because in my locality, there are teachers promoting mindfulness for primary school children or the teenagers. As I understand that for Buddhist practice, it takes years to master the skill of mindfulness. So I have a concern that whether it's suitable for the children who have no Buddhism background to just practice the rituals or use it as an activity to regulate their emotional health. So any suggestion on that?
In fact, in my presentation, I raised the question of, is there anything called mind? According to the evidence that I have and we have, there is nothing called mind. However, concentration and information processing is the main things that we that happens in mindfulness training, where we focus on our activities. Therefore, it may be helpful, but to what extent, to what level, I do not understand.
Okay, thank you. Thank you, Professor Gabira. I would like to know if other colleagues had other questions for Professor Gabira as well, because I could see in the chat box there are some other questions. So shall I or another chairperson may read them out for us?
You can ask, madam.
Thank you.
Dr. Chong, you can ask the question.
I have another question. It is because I have seen people to just follow the YouTube for to learn the meditation. We know that from your PowerPoint, we can see a lot of neurochemical, neurological benefits through meditation. So how about if people just follow the YouTube for the to learn such useful skill, or do you have any other recommendation that maybe which website that's more reliable, or any certified trainers that can teach meditation more properly? Or if the meditation is not well learned, is there any risk for the individuals?
Sadly, that they have observed certain changes in neurochemistry, that is neurotransmitters and information processing. Therefore, meditation definitely has some effect and produced evidence with scientific methods. Therefore, it's definitely support in dealing with mild to moderate mental illnesses. Perhaps we don't know it is natural remission of the illness, or it is the effect of psychotherapeutic procedures like meditation and other counseling.
Okay, thank you.
Yeah, Dr. Vishal sir, you can go with the question.
Gambira sir, actually we have some questions from Nandika Subhashini Reddy. She's asking, how do you extrapolate this knowledge to treat a mental issue of your clientele? A psychiatrist is not a faith leader. We need to draw a fine line between our professional acumen and spiritual probing. How do you tackle this while dealing with your patient, considering in the backdrop of Buddhist philosophy?
Yes, the effect of meditation that we said, and effect of relaxation in the brain. I told that definitely it helps in mild illnesses that may have natural remission. Therefore, there are no strong evidence to suggest that the moderate to severe depression or any other mental illnesses, this effect helps. Certainly, definitely when there is no illness up to optimal mental health in the spectrum, in the absence of illness, you can go up to an optimal state level at the higher top of the spectrum of mental health. Therefore, it helps in wellness and healthy mind in this dynamic state of mental health.
Okay. And one more question, sir. Dr. Sarangapani is asking, Ayurveda is a well-established and time. Ayurveda.
Sorry, I couldn't follow it.
Okay, sir. He's following.
I can't
Okay,
hear
sir.
you.
Okay, sir, one more question.
Yeah.
Ayurveda is a well-established prayer session. Okay, sir. And same question, the same person, Nandika Subhashini Reddy is asking, can you please quote from your clinical experience, basically the process, how you could achieve a emotion regulation in your clientele through spiritual intervention?
In fact, I do not have that experience because I do not do any psychotherapy. I basically doing managing with only chemicals. But it is documented that it helps, mindfulness and spirituality helps for better outcome of common mental illnesses, not for severe mental illnesses or rehabilitation.
Okay, thank you, sir. Over to organizers.
Thank you, sir. That was an excellent session by Dr. Gambira, and it was moderated well by Dr. Chong and Dr. Vishalakula. Now I request Dr. Chong to accept our felicitation. Thank you, madam, for being a part of our program. Thank you, madam. Now
Thank
I
you.
request Dr. Peter Verhagen and Dr. Praveen Kumar, sir, President IAPP, to please come onto the stage to felicitate Dr. Vishalakula, sir. I request Kishan sir to join onto the stage. I request Bhagya Reddy sir, Pavan sir, Shiva, all from Karimnagar Psychiatry Society to please join. Spurti, Sharanya, Vishnu, Sharanya, Shweta. They're all members of Karimnagar Psychiatry Society. Please join. Thank you, Vishal sir. We thank Dr. Professor Harishchandra Gambira sir for delivering an excellent lecture. Please kindly accept our felicitation, sir.
Thank you very much. It's an honor.
Thank you, sir. Now, without wasting much time, I want to go to the next session. Session is Science of Life After Death. It is being delivered by Dr. Professor Alexander Almeida. The chairpersons of the session are Dr. Nabraj Koirala, sir, and Dr. Pavan Kulkarni, sir. I welcome Dr. Nabraj Koirala, sir. Sir is Professor and Head of the Department of Psychiatry, Mental Health of Birat Medical College, Birat Nagar, Nepal. Sir is Director for Postgraduate Programs in Medical Sciences, Nepal. He is Chairman, Institutional Research Committee, Birat Medical College, Kathmandu University, Nepal. Sir is Past President, Psychiatry Association of Nepal. He is Advisor to the Psychiatry Association of Nepal. He was the author and co-author of many original research and reviewed articles in various national and international journals. We welcome you, sir.
Thank you.
Next, I invite Dr. Pavan Kulkarni, sir. He is consultant psychiatrist at Srirama Hospital, Karimnagar. He had done his MBBS from MR Medical College, Gulbarga. He had done his MD Psychiatry from SVS Medical College, Mahbub Nagar. He is currently Professor and Head Department of Psychiatry, Chelmad Anandrao Institute of Medical Sciences, Karimnagar. He is Honorary Secretary to IPS Telangana State Branch, Convener, IPS Specialty Section, Private Psychiatry. He had organized IPS TSB Midterm CME 2018-19. He had presented symposia in AFPA Colombo and WPA Religion Spirituality Section, Jerusalem 2019. He's having 10 publications and his areas of interest are consultation license psychiatry, ECT and child psychiatry. And he's the man behind SIATA in both state, zone and national level. We welcome you, sir. Now I hand over to Dr. Pavan Kulkarni to introduce our speaker, Dr. Alexander, sir.
Thank you, Dr. Sai. It's a pleasure and privilege to introduce the speaker for this session. Dr. Alexander Boriria Almeida. Dr. Alexander Moreira Almeida obtained his medical degree from Federal University of Juiz de Fora, School of Medicine, Brazil, and concluded residency in psychiatry and specialization in cognitive behavioral therapy at Institute of Psychiatry of University of Sao Paulo, Brazil. And he has obtained his PhD in health sciences, investigating the clinical differentiation between mental disorders and spiritual experiences. He is currently working as Associate Professor of Psychiatry at UFJF School of Medicine. He was elected chair of the World Psychiatric Association and being re-elected in 2017. He has over 115 publications in peer-reviewed journals and 37 book chapters in academic books and over 6,469 citations. His main research topics have been epidemiology of religion and several aspects of spiritual experiences. I welcome you, Dr. Alexander Moreira. And I request my co-chair, Dr. Naviraj Koirala, to give introductory remarks. Thank you, sir. Sir, please unmute, sir.
Thank you, Dr. Kulkarni. It's really a great privilege and a great honor for me to be invited to share this session with Professor Kulkarni at the session where the speaker is very renowned psychiatrist professor from Brazil, Professor Alexander Almeida. He has written many books, and one of his books is about the science of life after death, and he is the co-author with Da Costa and Coelho. I don't know the relationship between Coelho, whether he has some relation with Pablo Coelho, who is a very famous writer of Alchemist, and Frida and Veronica decided to die, Spy, Hippie. So many books, what has been written by Coelho is about the spirituality and life. So there is any connection between your co-author, co-writer Coelho and Pablo Coelho themselves? And Professor Almeida, Alexander Almeida, he has been working for more than 25 years in investigating the relationship between the life and spirituality, and the concept and what happens, the consciousness and the soul after one he dies. So it's indeed a great pleasure and great opportunity for all of us to listen to him about his one experiences and about his one expertise knowledge. So without sparing our time, I will request Professor Alexander to initiate his session. Thank you.
Hello, good afternoon for you. For here is Sunday early morning, 7 a.m. in Brazil. It's a great pleasure being here. I'm honored for being invited to deliver this talk and among so distinguished colleagues. I will present briefly one of the most challenging research areas in terms of spirituality. That is the idea that there is some sort of survival of mind, of consciousness after death. We have just recently published a book on this topic, summarizing the academic findings on this area. So I will try to present it very briefly here in this talk, and then hopefully we'll have some time later for some questions. And regarding your question, Humberto Coelho, no, he's not a relative of Paulo Coelho. Coelho is a quite common surname in Brazil because Coelho means rabbit in Portuguese. So it's quite common surname. Humberto Coelho is a philosopher, a professor here at our university, and Mariana is another psychiatrist. So my presentation is based on the work of us three. together. First, the idea that there is some sort of survival of the soul, of mind, or spirit after death is very prevalent throughout religions and philosophies, throughout ages and cultures, because it's very closely related to the concept of spirituality, since spirituality is related to some sort of transcendent aspect of human beings. And usually this transcendent aspect of human beings is thought to survive after death. So this is one of the core beliefs of most spiritual traditions throughout history, and also in philosophy. For example, Plato, Aristotle, Descartes, all of them also discussed these ideas. And even nowadays, despite many people think that the belief in afterlife is not prevalent nowadays, recent studies have shown that this is not the case. Among the 10 most populous countries in the world, more than 60% believe in life after death. Even in the highly secularized Western Europe, only 40% believe that there is no life after death. And also, different from what many people have thought, usually there is no correlation between educational level and afterlife beliefs, because many people have believed that the higher the educational level, the lower would be the prevalence in afterlife beliefs. However, some studies in France, in Russia, and in Brazil have found the opposite. Higher levels of education were related to greater acceptance that we have a soul and or that there is survival after death. So this is still a very prevalent belief. So this is one point. The second point is in the impact of this belief, this core belief of most spiritual traditions in mental health. So there are some studies showing usually a positive impact in afterlife beliefs. For example, the lower levels of end-of-life despair, lower levels of anxiety, of suicide, and also acceptance of euthanasia, lower levels of psychiatric symptoms, and higher levels of life satisfaction, and lower belief in a cynical world. So these are some impacts in recent studies of afterlife beliefs. However, we know that this is a very prevalent belief. We know that it probably has some important impacts on mental health. However, how can we make this a scientific quest? Usually, afterlife beliefs are usually thought to be a philosophical or only a religious issue. However, in the mid of 19th century, this philosophical religious question has been translated in a scientific question. Actually, there has been more than 115 years of scientific investigation involved some of the brightest scientific and philosophical minds during this time. However, most people are not aware of this research. So this is exactly the purpose of my talk, that is based on the book, that is to present and discuss the best available empirical scientific evidence for survival of human consciousness after permanent bodily death. Before presenting the evidence is important to address the main arguments against survival, because there are many misguided philosophical and ideological prejudices that cloud a fair, rational analysis of the body of the empirical evidence. One major misguided assumption is that neuroscience has proved that the brain generates mind, that the brain activity is just the activation of the chemical activity or electrical activity of the brain. And usually 3 sorts of evidence is presented as conclusive evidence that the brain generates mind, and then if the brain dies, the mind or the soul cannot exist anymore. So one evidence would be that the brain stimulation or electrical stimulation or the use of drugs or substance or brain lesions all of them affect mind. We are very aware of that. For example, Alzheimer's disease, there are brain lesions that affects memory, affects personality, use of drugs can cause a lot of mind changes. The second is a correlation between brain and mind. We can see a correlation, for example, when I'm very anxious, I have some activation in some brain areas. And the third aspect is there are parallels between the evolution or development of the brain and the development of mind throughout life and throughout the evolution of the species. The more complex the brain, the more complex the mind. So these are the three major lines of evidence that are supposed to be a definitive proof that the brain generates mind. However, we should not jump to conclusions because, for example, the key founders of scientific psychology and of neuroscience were quite aware of this evidence. However, they did not hold physicalist views of the mind. By physicalist views of the mind, I mean the idea that the mind is a product of brain activity. For example, Wilhelm Wundt and William James considered the two key founders of scientific psychology. And some of the key founders of neuroscience, like Sir Charles Sherrington and Wilbur Penfield, all of them were quite aware of this previous evidence, but neither of them accept physicalist views of mind. Actually, most of them believe in some sort of dualistic perspective. Mind is something beyond the brain. This is basically because this previous evidence could be explained in two ways. One, because actually the brain generates mind, or as William James has put, the brain could be an organ for limiting and determining to a certain form a consciousness elsewhere produced. The idea that the brain would be a receptor of mind activity and allowing mind manifestation in our daily world. So it's similar, for example, a TV set. A TV set, when I was a child, I believed that the characters in cartoons, that they lived inside the TV. However, later I realized that the TV, they did not live in the TV, but the TV is just a TV set that receives program that is produced elsewhere. So if the brain is like a TV set, a receiver of mind that is somewhere else, we also would have the same similar findings. If we cause some damage in the TV set, we will not be able to see well the image or the TV program. There will be correlations between the imaging on TV and the activation of TV circuits. And also, of course, the better developed the TV set, the better the image that I see. But neither of these proves that TV is the ultimate source of the program. The same is related to the brain. So this evidence can be explained both ways. Can be explained as brain as the producer of the mind, or the brain is a filter or a mode of manifestation, a tool for manifestation of the mind. Okay, so it's not that fast. The second aspect also is the idea that science has proved physicalism, that only matter exists. Nothing transcendent actually exists, because everything must be explained by physical force and particles. This is the core idea of physicalism. And of course, if physicalism is true, survival of mind after the death of the brain would not exist. However, it's important to keep in mind that physicalism is not a scientific fact. It's a metaphysical assumption. It's not a consequence of the scientific study of nature. Actually, most of the founders of modern science, like Francis Bacon, Isaac Newton, Johannes Kepler, Robert Boyle, neither of them actually accept physicalism. So physicalism is not necessary to perform modern science, and it's not a consequence of scientific studies. So these are some of the major misconceptions that impacts our understanding of mind. I do not have more time here to go deeper in other of these aspects, but basically these are the two major blocks. First, that it has been proved that brain generates mind, and second, that science has proved or requests the idea of physicalism. So neither is warranted. So we are allowed to think in different perspectives, and even, for example, what some authors call an expanded naturalism. Expanded naturalism means that nature may not be composed only by physical force and particles, that mind could be another essential, irreducible aspect of nature. So an expanded naturalism means that in addition to matter, we could think, for example, that consciousness, that mind could be another irreducible aspect of nature that should be taken into account in these explorations. Now, after removing this a priori rejection to any sort of survival, let's think, how can we translate this millennial scientific, philosophical, and spiritual quest? How can we translate it in a scientific question? There has been a lot of discussions what would constitute personality or the person. Most authors in philosophy of mind and others believe that we are basically a pattern, a continuity of character and memory. This is what characterizes a personality, an individual mind or a soul. Just to have a thought experiment, let's imagine that we have a good friend, and this very dear friend, he suffered a terrible car accident. And in that car accident, he has his body completely burned. So he survives this accident, but completely disfigured because of the burns. We cannot see look at him and recognize my friend anymore because he's completely disfigured. Let's imagine that we do not have DNA tests. How do I know that this disfigured body is my friend? Because I cannot recognize him anymore just by his appearance, but his image. I will recognize my friend by the continuity of character and memory. So if this disfigured friend exhibits the memories that I expect that my friend have, if he remembers moments that when we were together, if he remembers things that I know that my friend knows, in addition, the character of my friends, the humor, the way of dealing with things. If that disfigured body shows this continuity of character and memory, I will believe and will accept that this is my friend, despite not being able to recognize him based on his body. Now, let's move another step. Let's imagine that my friend has actually died in the car accident. How should I look for evidence for survival of my friend? Exactly the same way. When I do not have the body anymore as a tool to recognize my friend, I should look for the continuity of character and memory. This is exactly what we will present here and what has been investigated in these studies. So the evidence, the scientific, the empirical evidence for survival would be the continuity of memory, being able to remember facts, ideally in large number, accurate, and covering several topics. Identifying people that the claimed personality was acquainted with when alive. And also, not only the memory, but the skills of the alleged personality. Skills of speaking or writing in a foreign language. Skills of doing poetry, prose, painting, or even the style of the handwriting. And in addition, personality traits, the temperament, the character, the personal style. So these are the major empirical evidence that I should find to see if there is or not survival of consciousness after death. But to the surprise of many, this has been investigated for 150 years. We published recently, a few years ago, a systematic review of the literature regarding spiritual experiences that are in some sort related to survival or to the mind activity beyond the brain. For example, we studies in near-death experience, out-of-body experience, possession, mediumship, past life memories, and end-of-life experiences. So we found almost 2,000 papers published in mainstream scientific journals. And the impact factor of these papers were similar to more conventional mainstream areas. So there is a considerable body of evidence on this topic. So we will discuss basically three sorts of evidence. The first will be near-death and out-of-body experience. Then we will discuss mediumistic experience. And finally, we'll discuss the past life memory, alleged past life memories. Regarding near-death and out-of-body experience, what's more interesting to our study is that specifically out-of-body experience, people who came to feel or to be out of their bodies, so the mind would be separated from the body, and when this experience happened during near-death, for example, during a cardiac arrest. So they are very important to our discussions. First, because people refer clear consciousness in a damaged brain. So if the brain generates the mind, if the brain is not working well, the mind should not be clear or work well. For example, in delirium, in confusional states, in intensive care units, we have exactly this. People have the brain not working properly, and then people became confusional, and so on and so forth. However, in near-death experience, it's exactly the opposite. The brain is not working well, or is not working at all, like in a cardiac arrest. However, people report having a clear consciousness, even more clear than the usual. They also fear that what they experience is more real than reality. It's different, for example, when a delusional, confusional state, when people recover from a confusional state in ICU, usually they do not remember anything, or when they remember, they think, oh, I was crazy, I was having confusional ideas and things like that. But after near-death experience, exactly the opposite. People usually think, oh, it was actually real. Many decades later, people still assume that it was real, and even the quality of the memory. There are some studies show the quality of the memory of these episodes is better than memory from actual episodes from daily life. And this experience also have a deep and lasting impact on values and beliefs because of exactly the sense of veracity of this experience. They usually see the physical body from a different position, this out-of-body experience. In addition, these experiences have transcultural core features, is not determined entirely by the cultural aspects, the cultural environment. Of course, the cultural environment shapes some aspects of the experience, but not the core aspects. So it's not dependent of religious beliefs, educational level, fear of death, duration of cardiac arrest, and medication. So it's not explained by hypoxia. Some people have this experience without having hypoxia. For example, in a car accident, when the people survive with no damage, people can have near-death experience. And even the most challenging aspects of this experience are the verified veridical perceptions. People, for example, at this reference at the Lancet, the cardiologist Pim van Lommel, he published a case of a person who had a cardiac arrest. The patient was completely cyanotic with the heart not working, with a fixed pupil, so no brain reflex the patient had. Despite that, when the patient recovered, the patient was able to describe what happened. He described the conversations that they had, and also the movements and the appearance of people in there. So there are several reports of these veridical perceptions during near-death experience. And if the brain is producing mind, and if the brain is not working, the person could not have any consciousness and mind activity. However, not only they have these activities, but they also are able to describe things from a different vantage point. So this is another sort of evidence that mind, in some source, could be beyond the brain and survive the death. The second sort of evidence is mediumship. Mediums are people who claim to have the ability to perceive or to communicate with or to be under the control of deceased persons. Basically, all cultures have this sort of experiences. People who claim to be in touch with spiritual beings, with spiritual entities, and for the survival investigation, the more relevant aspect are people who claim to be in contact or under the influence of deceased persons. I will present, for example, very briefly, a case of probably the most prominent medium in the 20th century. It was the Brazilian Chico Xavier. He had a very elementary education, modest financial research, and worked as a public servant. He never made profit for his mediumship. He always had his regular job. And he wrote through automatic writing, alleged being influenced by deceased personality. He wrote 450 books that sold more than 60 million copies, translated into more than 10 languages. All these books, the copyrights were donated to charity institutions. And this book, there are several studies showing about the scientific information that is available, and also the many deceased Brazilian Portuguese poets allegedly wrote through him, and their styles were very similar. There is a PhD dissertation in one of the most prominent universities in Brazil investigating this and showing the striking similarities in poetry styles. So, in addition, he wrote thousands of letters, usually from deceased young people to their bereaved parents, who could match alleged mode of death in alleged previous life. They also can have some learned skills, and findings have been replicated by different researchers in different cultures. For example, I will present here a case in Sri Lanka that was investigated by Erlendur Haraldsson. He was a professor of psychology at the University of Iceland. He allowed us to use his slides here. So he investigated the case of Purnima. Purnima in Sri Lanka. Purnima, we start to talk about a previous life when he was 3 years old. Okay, this is Purnima. And she made several statements that she lived in the other side of the river from the Kelania temple. The Kelania temple actually was a famous temple, is a famous temple in Sri Lanka. But she claimed, and it was interesting because first she started to talk about this when she saw this temple on TV. And she said, oh, I lived there. I lived on the other side of the river that is behind this temple. And I used to make incense sticks of the branch Ambiga and Gita Picha. I was selling sticks on a bicycle, and I had an accident with a big vehicle. And so these are some of the major, main of his statements. So actually, that is the Kelania temple. So they were investigated, and this temple was more than 100 kilometers far from where Purnima lived. And actually, they found an incense maker. Okay, And a relative of this incense maker actually died in a car accident. He was selling incense sticks in a bike. He was going to sell incense sticks in the temple. He was going on a bicycle and he was died. He was killed by a big car, a truck. And actually, they made incenses, Ambika and Gapaticha. And these brands of incense sticks were not available where Purnima lived. In addition, Purnima had some birthmarks, as we can see here, some hypopigmented areas here in the coast here, and they were able to find the death certificate and the necropsy reports of the alleged previous personality, and exactly the post-mortem report shows that injuries that killed the alleged previous personality were exactly fractures in the areas that ribs were broken and perforated, penetrated the lungs and the spleen and the liver. So exactly the region where she had these birthmarks. So she made 20 statements, 20 specific statements. 14 were correct, only 3 were incorrect. So this is one example of cases of reincarnation type that has been investigated. So as I said previously, there are more than 2,500 of these cases reported. And of course, some of are more suggestive, some are less suggestive of actual survival, but on average, they form a quite interesting body of evidence. So to summarize the way of the holy body of evidence, we would like to have a logical approach to survival. We are not discussing here what would be the mechanism of survival, or what would be the mind, the consciousness, how it would relate to the body. We are not discussing this here. We're having just a logical approach. If there is or not evidence that there is a continuity of character and memory. And we tend to assume what we call a pragmatic dualism. Pragmatic dualism in the sense that, well, it seems that there is the body, as we understand the body, the brain, and in some sort there is consciousness that is some way related to this body, but we don't know actually the ultimate relationship between them. So we call this a pragmatic dualism. We see body and we see the mind surviving the body. And the main alternative explanations for all this evidence are usually fraud, but fraud has been controlled and excluded in well-controlled experiments, as we said previously, and also throughout the repetition of the similar findings throughout different cultures by different researchers. So exclude fraud as explanation for most of these findings. Also, the ideas that it could be chance, the correct information could be by chance, or cryptomnesia, that people, the mediums or the children, they already knew all that information, but they were not aware of it, but in a trance experience, they could remember it. Of course, it can explain a lot of the findings. However, in many cases, we are quite sure that the person has never had this kind of information because they were very private information.
Yeah, 5 more minutes, sir, you have.
5 minutes, okay. And it's interesting that probably the best alternative explanation to survival is the idea of extrasensorial perception or living agent psi. This is the major challenge to these experiences, because usually they cannot be well explained by conventional explanations. Okay. However, this living agent psi explanation it does not fit well with the evidence because of the time, so I think we have to skip this. But there is a compelling case for triangulation. What means triangulation? Converge evidence, different researchers from a broad variety of research groups, different countries and methods, in a wide range of phenomena. All this evidence mutually reinforce each other, pointing to the same conclusion: survival of consciousness. Okay, and see, this is an example. Despite the level or the sort, the types of evidence, all of them pointing to the idea of some sort of survival of consciousness. In addition, the idea of the survival hypothesis, survival of consciousness, it could help us to explain also other related phenomena like child prejudice, gender identity issues, children's behavior and psychological characteristics, and differences between identical twins not explained by genetics or the environment. So there are several interesting aspects that have been discussed. Ian Stevens, one of the major researchers in this area, psychiatrist, in this paper. So, and the survival hypothesis has desirable virtues of a good scientific hypothesis. It has empirical adequacy, so it explains well the available evidence. It explains a wide range of phenomena. It predicts new sort of phenomena like PTSD symptoms in children with claiming the previous life. And there's a more simple explanation that makes sense of a wide range of experience. Actually, this sort of conclusion also has been reached by many very qualified scientific and philosophical minds that have investigated in depth the body of evidence and concluded that survival is the best explanation for this huge body of evidence. However, there are some cultural barriers to a fair explanation of the available evidence. First is materialist scientism, that the idea that I said previously, that physicalism explains everything, so not that cannot exist anything beyond physical aspects. A dogmatic skepticism, people that are dogmatically denying everything, or even some sorts of religious dogmatism that excludes some of these experiences. So in conclusion, survival seems to be the most simple, comprehensive, and natural explanation for all the empirical data discussed in this essay, discussed in this talk. So my main purpose was exactly to present what sort of evidence and studies exist in the scientific arena regarding one of the core ideas of spirituality, that is the survival of consciousness. So for more details, you can see the book. And also, finally, I'd like to present you a website, YouTube channel from our research group, a bilingual YouTube channel in Portuguese and English with more than 300 videos on science and spirituality and health. Thank you very much. I'm open to questions.
Thank you, Dr. Alexander. There is a question, sir. Dr. Pavan, sir, is going to...
Thank you, Dr. Alexander. It was a wonderful presentation. And we have one question from Dr. Gurindra Singh, Professor and the head of AIMS, Bathinda. Is ritual performed after death has any positive or negative impact on life after death?
To my knowledge, this has not been investigated directly. Okay, in terms of scientific investigation, the main focus of the studies have been exactly just in showing if there is or not, there is not evidence for survival of consciousness. Now, what would provide a better or worse impact on this state of this consciousness after death, it has not been, to my knowledge, investigated in a scientific way yet.
Any other question? I request Dr. Nagaraj Koirala to give his remarks, sir.
And thank you, Dr. Kulkarni. And thank you, Dr. Alexander. It's really a very wonderful presentation for your highly intellectual, illustrative, and in-depth presentation. I would like to congratulate you. And of course, the question related in relation to what happens to the life after death, what happens to the soul and the consciousness after death is a very, very difficult to answer. and in different culture, different religion, these questions have been explained in different ways. Like in Hinduism, Gita, and in Christianity, the concept of heaven and the hell are explained although, but what happens to the soul and the consciousness? Do they remain in existence? Do they continue to remain? Or something happens to them after death? Is still a question of debate. But at the end, it was such a wonderful presentation. It was a very illustrative and the very, very in-depth presentation. And you try to explain many things, a lot of things, to make it clear to all of us. For this, I would like to congratulate you and thank you, Dr. Alexander, for your presentation. Thank you. Thank you, Dr. Kulkarni.
Thank you, sir.
Thank you very much. My pleasure.
It was indeed a wonderful presentation, Dr. Alexander. And yes, it's very much a gray area, but I congratulate you for having your research subject on this particular area, which is very vague. But anyways, it was a wonderful session. Thank you. And over to the organizers, please.
That was an excellent presentation, sir. Now I request Dr. Nabraj Koirala, sir, to please kindly accept our felicitation.
Thank you, sir. Thank you.
Thank you, sir.
Thank you, sir.
Now I invite Dr. Peter Verhagen, sir, and Dr. Kishan, sir, to come onto the dais to felicitate our chairperson, Dr. Pawan Kulkarni, sir. I request Praveen, sir, to join for the felicitation. వీళ్ళ తర్వాత స్పీకర్ సార్. Thank you, Pawan sir, for accepting our felicitation. We thank Dr. Alexander Morera Almeida, sir, for delivering an excellent lecture. Please kindly accept our felicitation, sir.
Thank you.
Thank you, Alexander ji, as well as Koirala, for accepting the invitation and wonderful lecture by Alexander. You are the role model for us to grow. And I think I'm requesting everybody to purchase that book, Life After the Death.
Sure,
Thank you,
sure.
Thank you, sir. Without wasting time, I'm going to the next session. Next session will be the last session. It is on religion, spirituality, mental health, research, and clinical applications. Now I invite our chairpersons, Dr. Avinash D'Souza. He's from India. He's a consultant psychiatrist and founder trustee, D'Souza Foundation, Bombay. He served as Honorary General Secretary of IAPP. He's one of the few psychiatrists who, in addition to psychiatry degree, has an MBA in Human Resource Development, Masters in Psychotherapy and Counseling, and MPhil in Psychology. He's Research Associate in Lokmanya Tilak Municipal General Hospital and Lokmanya Tilak Municipal Medical College, visiting faculty in Department of Psychology, Srimati Nathibai Damodar Thackeray Women's University. He's having more than 300 publications in national and international level. We welcome you, Avinash sir. Next, I invite Dr. Sayuri Pereira from Sri Lanka. She had graduated as Faculty of Medicine from University of Perendia in 2006. She obtained MD Psychiatry degree from University of Colombo in 2012. She obtained her membership of Royal College of Psychiatrists, UK in 2012. She is currently working as Senior Lecturer in Psychiatry. She is Consultant Psychiatrist at University of Perendia, Kandy, Sri Lanka. Thank you, Madam. I request Dr. Sayuri Pereira to introduce the speaker, Dr. Harold Coing.
Thank you, sir, and very good evening from Sri Lanka. It's my pleasure to introduce Professor Harold Coing. He will be speaking to us on religion, spirituality, and mental health. He's no stranger to this forum. He's world-renowned for his work, but let me just give you a brief introduction. He's the director of the Center for Spirituality, Theology, and Health. He's also the Professor of Psychiatry and Behavioral Sciences and Associate Professor at the Duke University Medical Center. He's Associate Editor and Editor-in-Chief in prestigious journals in psychiatry. He's part of more than 600 publications more than 100 book chapters, and 55 books. Like I mentioned, his research has been featured on many national and international TV programs. He's the recipient of many awards. Noteworthy is the 2012 Oscar Pfister Award from the American Psychiatric Association, the 2013 Gary Collins Award, again from the American Psychiatric Association of Christian Counselors, and the 2021 Frank Minath Award for Excellence in Christian Psychiatry and Behavioral Medicine from, again, ASC. Professor Harold Koenig has recorded his presentation, but of course he will be joining us live for the Q&A session. So without taking much more time, let's listen to Professor Koenig.
Avinash sir, introductory remarks.
Thank you.
Avinash sir, you can give your introductory remarks, sir.
Well, I think, everyone knows Dr. Koenig, and I think I don't want to stand between you all and what he has to say. So I think let's start the presentation. We have a lot to learn from him. So I would say, let's start. Yeah, thank you.
Okay, thank you, sir.
I'm Dr. Harold Koenig, and I'm going to religion, spirituality, and health. I'm going to share my screen now, and we'll begin the presentation. Okay, so I'm going to talk to you about 30 to 45 minutes about this topic, and we'll start right here with an introduction. I'll tell you a little bit about myself and then start talking about the important role of religion in coping with stress, examine religion and spirituality as correlates and as predictors of mental and social health, talk about some Hindu and Islamic treatments for emotional disorders, look at some of the research on physical health, and then try to understand how these correlations come about. With regard to myself, I'm a physician. I'm a professor of medicine and psychiatry here at Duke University Medical Center in Durham, North Carolina, in the USA. My area of expertise is as a research scientist, and I've been studying the relationship between religious faith and health for over 35 years. I've written and published almost 600 scientific peer-review academic papers, and have written over 55 books on this topic. And if you would like to know a little bit more about me, here is a website that you can go to. And by the way, I'm happy to share a PDF of all of my PowerPoint slides so you can review this after my talk. First of all, I'm a Christian, but in many respects, I have much in common with Hindus and Muslims. Every day, I try to submit my life to the one and only God, the Supreme God, whatever you would like to call the Supreme God, Allah, God. Although I am biased due to my personal experiences with religion, this makes me a better scientist, more honest, more transparent, more dedicated to uncovering the truth, whether the findings are positive or negative. Religion is a very powerful coping behavior. Many people turn to their religious faith for comfort, particularly when facing difficult problems in life, highly stressful situations, including health problems and threats to health, and including mental health problems and mental illness. Religion is often used to cope with the challenges such as uncertainty, fear, loss of control, discouragement, and loss of hope. Among young persons in India, in fact, if you look at this group, average age 32, during the COVID-19 pandemic, when it was at its peak in India, 75% of these young people said that they coped by putting their plans into action together with God. So this is a topic that is very relevant to the population of India, whether you are Christian, Hindu, or Muslim. This topic is of incredible relevance to all healthcare professionals, especially mental health care professionals. Now, I'm going to present a lot of research. Much of this research is summarized in a book that I wrote, Religion and Mental Health, Research and Clinical Applications, published by Academic Press in 2018. Also, I have a couple of articles published in the British Journal of Psychiatry Advances, looking at updates in terms of religion and psychiatry, and also in terms of clinical applications in psychiatry with regard to the latest research that is being published. In early of this year, in fact, this month, the third edition of the Handbook of Religion and Health will be published by Oxford University Press. This is a very comprehensive handbook that presents and analyzes the best research studies in this field, not only of mental health, but of social health, of physical health, of applications to clinical practice, as well as public policy implications. This is all in this book, which is a little over 600,000 words and about 2,000 pages. So this is a very comprehensive book. My co-authors include endowed professors at the Harvard School of Public Health and also at the Harvard Medical School. Now, here are some sources of this research specific to Hinduism and Islam. I have a book that I've written titled Hinduism and Mental Health, Beliefs, Research, and Applications. I also have a book on Islam and Mental Health, Beliefs, Research, and Applications. What these books do is they review the research and then go into detail clinical applications for Hindus and Muslims. They're available on Amazon for less than $10. Let's look at the research on religion and mental health. Let's start out by looking at depression. Depression is the most common emotional disorder in the world. And in fact, only heart disease is more disabling than depression. So of the 350 ICD-11 codes for diagnoses, depression is the second most disabling condition in the world. Religious involvement, however, is related to lower rates of depression in about 2/3 of studies. In 6% of studies, these researchers have found that sometimes religion is positively correlated with depression, but these studies are often cross-sectional and involve religious people becoming more religious in response to depression, which is a common phenomenon. Now, among prospective studies, we did a review of 152 prospective studies where people were followed over time and baseline religious involvement was examined as a predictor of the development or outcome of depression. We found that about 50% of studies found that religious involvement helps to prevent depression or speed its resolution. In 10% of studies, we found that it actually worsened prognosis, and in a little over 40%, there was no effect that was found. This has now been published in the Journal of Affective Disorders, and the citation is at the bottom of your slide here. Now, this was a fascinating study published in JAMA Psychiatry. This looked at the brain structure of people for whom religion was very important and those who reported that religion was not very important in their lives. These are people who have a high risk for developing depression because their parents had a major depression and they probably inherited some genetic vulnerability to the development of depression. So that's what this sample consists of, those who are more vulnerable to depression. Well, they did MRI scans. I believe these were functional MRI scans. Actually, they were structural MRI scans of the cerebral cortex. And what they did was they compared those for whom religion was not very important to individuals for whom religion was very important. And what they found was that the average thickness of the cerebral cortex was approximately 1 centimeter thicker among those for whom religion was very important. So they reported that either religious involvement helps to counteract the vulnerability that genetic predisposition causes, for people at risk for depression, that religion may either counteract that, or it may actually help the cerebral cortex to expand in terms of its thickness. Now, there is a physiological reason for this, and that is because people who experience recurrent depression have high cortisol levels, which tend to actually shrink the large pyramidal cells in the cerebral cortex. And among individuals who are more religious, they are coping better with life. They are not experiencing as much depression or as severe of a depression, and therefore their cortisol levels tend to be lower. And therefore there's less circulating cortisol that might affect the cells in the cerebral cortex. So that is one reason why perhaps those who are more religious, because it helps to prevent depression, why it might actually help the brain stay healthier. Now, here's a large sample of almost 10,000 young people, average age of 23. And these are individuals from across the United States. And they are looking at the risk of developing a depressive disorder over a period of up to 6 years. And they're seeing whether or not involvement in religious activity actually helps to prevent the onset of depression. So this was a study published in 2020. This was done by the Harvard School of Public Health and was published in the International Journal of Epidemiology. And what they found was that almost a 30% reduction in risk of developing a depressive disorder among these young people who attended religious services at least once a week. So those young people who attended once a week or more, 6 years prior to the follow-up, were actually at more than a 30% reduction in risk, and this was highly statistically significant. Now, if religious involvement helps to prevent depression and helps people to recover more quickly from depression, then it ought to be associated with lower rates of suicide and fewer suicide attempts and suicidal thoughts. And in fact, in our systematic review that was published in the first and second edition of the Handbook of Religion and Health, we identified 141 quantitative studies that had looked at the relationship between religious involvement and suicidal thoughts, suicidal attempts, and completed suicide. And of those 141 studies, 106 or 75% found that religious people are simply less likely to engage in suicidal acts or to commit suicide. And in fact, there were almost no studies finding that there was a positive relationship between religious involvement and suicide. There were a few studies showing no association, but the vast majority showed that religion was a protective factor against suicide. Now, that was prior to 2010. There have been several large studies looking at risk of suicide, completed suicide, since then, in the last 10 years. This study is a prospective study over 18 years looking at the hazard ratio or the risk of completed suicide. Among people, now this was a sample of over 20,000 randomly selected individuals in the United States. It's from a very famous study, the NHANES 3 study. This study virtually helped to define the field of cardiovascular health in terms of stroke, in terms of heart attacks. That was the main purpose of this multi-million-dollar study funded by the National Institutes of Health. And in this study, they found that among those individuals who attended religious services twice a month or more often, there was a 94% reduction in the risk of completing suicide. And this was after controlling for gender, age, size of the household, previous suicide attempt, and drug use. Now, in 2016, a study was published by the Harvard School of Public Health this time. This was the Harvard School of Public Health. They looked at the incidence rate of suicide per 100,000 person years, and they found a 7 times greater risk of completing suicide among those individuals who never attended religious services compared to those who attended at least once a week. This is a sample of 90,000 women who were followed for over 14 years. Now, the Harvard School of Public Health then did a study looking at deaths from despair, deaths of despair. These are deaths from drug use, alcohol use, and suicide. And they started out by looking at risk among women. And this was a 16-year prospective study, which found that women who attended religious services at baseline, at least once a week, were about 70% less likely to end up committing suicide during that 16-year follow-up. And in fact, there was a P for trend in the data. This is a very important finding because what it suggests is that there was a dose-response effect. In other words, the greater the dose of the religious attendance, the lower the likelihood of dying from a death of despair. What's important about that is that it suggests that there is actually a causal relationship, with the relationship going between religious involvement and protection from risk of suicide. Now, they repeated this study among men. So these are all male health professionals, male healthcare professionals. This is a group of 43,000 men, and they were followed for 26 years. And what they found was that among those attending religious services, at least once a week or more, there was a nearly 50% reduction in the risk of dying from a death of despair. Again, they find a P for trend, suggesting that this is a causal relationship. Now, this is a study here that I was part of. This was a national random sample of a little over 3,000 U.S. veterans of war. And they looked at, in this study, not just religious attendance, but they used the 5-item Duke Religion Index, which measures religious attendance, frequency of prayer or meditation, and a person's intrinsic relationship with God. So there are 5 items. Among those veterans who scored in the upper half in the upper half of this scale, they were a little over 50% less likely to have ever experienced PTSD. They were 50% less likely to have experienced a lifetime major depression. They were about a third less likely to experience a lifetime alcohol use disorder. And then in terms of current post-traumatic stress disorder and current alcohol use disorder, there was about a 70% lower likelihood of them having that in the present. Now, this is a cross-sectional study, not a prospective study, like the ones that I have been showing you. Alcohol use, abuse, and dependence. We find that between 80 and 90% of studies, of the nearly 300 quantitative studies that were done prior to the year 2010, that between 80 and 90% reported that those who were more religious were less likely to use, abuse, or become dependent on alcohol. And in fact, the same finding was reported for illicit drug use. Again, between 80 and 90% of studies, of the nearly 200 studies looking at this relationship, between 80 and 90% found that religious people just don't use as many illicit drugs. They don't drink as much alcohol. They don't become dependent on drugs. They generally are living a healthier life. And in terms of actually randomized controlled trials or experimental studies, virtually all of those studies find that a religious or spiritual intervention reduces the risk of illicit drug use. Now, let's look at some Hindu and Islamic treatments for emotional disorders. I'd like to first talk a little bit about religiously integrative cognitive behavioral therapy for the treatment of depression or anxiety. So we've developed a religiously integrative cognitive behavioral therapy specifically for Hindus and for Muslims. There are two different manuals and treatment protocols, and we have tested those in a randomized controlled trial showing that they're effective in reducing depression and anxiety. And if you look at this website, if you go to this website, it has all of the therapist manuals and patient workbooks that can be used for Hindus and Muslims with depression or anxiety. So this is a religion-specific treatment for these very common emotional disorders. We have also developed a spiritually, religiously integrative treatment for post-traumatic stress disorder, and also for this concept called moral injury. Moral injury results when people transgress their moral values and they experience these deep traumatic emotions. It's often seen in the setting of post-traumatic stress disorder, but these are separate syndromes. So we've developed a treatment for moral injury that actually also improves post-traumatic stress disorder. And we have Hindu and Islamic treatments specifically for Hindus and Muslims. If you're interested, happy to send you the Muslim and Hindu therapist and patient workbooks. Just send me an email, and there's my email on the screen. We've also developed Hindu and Muslim pastoral care and counseling treatment for moral injury and PTSD in the setting of severe trauma. So this is available for clergy, for monks, for all different clergy from Hindu and Islamic traditions. We also have a book for all different religions called Religion and Recovery from PTSD, which is available on Amazon. Now, in terms of the positive emotions, well-being and happiness, how is religion related to a person's satisfaction with life, their psychological well-being, and their happiness in life? How is religion related to that? Well, in our systematic review of studies prior to the year 2010, we found that nearly 80% of studies quantitatively looking at this connection between religious involvement and happiness and well-being, 80% found that religious people are simply happier. They're more satisfied with their lives. They have greater levels of psychological well-being. And of those 326 studies, less than 1% found lower levels of happiness or well-being in the more religious. In addition to that, the vast majority of studies find that religious people have more meaning in their life. They have more purpose in their life. They're more hopeful. They're more optimistic about the future. In our systematic review, we found that 93% of studies found that the more religious person had greater meaning and purpose in life. And if you looked at the better design studies, we found every single one of them reported that finding. With regard to hope, we found that about 75% of studies showed that religious people are more hopeful about the future. And then in terms of optimism, we found that more than 80% of those individuals of studies that looked at this relationship found that religious people are more optimistic. They're less pessimistic in terms of the future. They're more optimistic. They see things more brightly into the future. And of course, they have the hope of eternal life after they die, which is very important in terms of, well-being. Now, having more purpose and meaning in life, being more hopeful and optimistic also has consequences for patients' motivation for self-care and efforts towards recovery. So people who get sick, people who get depressed, people who have surgery for hip fracture or have a stroke or heart attack, they have to work very hard to get better in recovery. And people who are more religious simply have more meaning and purpose and hope, meaning and purpose in life. They have more hope and more optimism that makes them work harder to recover. So these relationships with these positive emotions are very important in terms of recovery from both mental and physical health illnesses. Let's look briefly at social health as well. Now, of the almost 75 studies looking at religious involvement and social support, more than 80%, once again, find that religious people have more support. They have more friends. They have closer families. They have more support. And if you question that, simply do a review like we did. This was based on a systematic review of all research that has been published in the English language in Medline, in Psych Info, in Google Scholar, and 80% of those studies find religious people have more social support. And the social support that they have is more durable. In other words, it lasts longer, even when the people they're supporting can't return the support. And the reason for that is because of the religious belief system. Our religious belief systems encourage people to love one another, to support each other. And so therefore, religious people have a greater motivation to support and care for others. And again, this is true in Christianity, Islam, and it's true in Hinduism as well. Now, in terms of delinquency and crime, religious people are more pro-social. They're more likely to want to do good in the world rather than to do bad things, like do different delinquent acts or commit crime. And in fact, we did this systematic review. We identified 82 studies, of which, once again, 80%, 8 out of 10 peer review quantitative studies find that religious people are less likely to be delinquent, less likely to commit crime. And in fact, young people who are more religious do better academically. In fact, we looked at 10 studies published before 2010, and of those 10 studies, every single study, 100%, found that young people who were raised in a religious home, who were themselves religious and prayed and for whom religion was important to them, they did better in school. They had higher grade point averages. They were more likely to graduate from high school, more likely to do well and to go to college. In terms of marriages, religious involvement encourages people to stay together, to even when you have conflict in a marriage. They encourage people to stay together and to work it out. And in fact, religious involvement in between 80 and 90% of studies, those who are more religious, have more stable marriages, more satisfying marriages. There is less spousal abuse in these families, in religious families, and there are more likely to be two parents in the home. There's less divorce, there's less separation. Actually, I don't have this because I'm kind of running out of time here, but there was a recent study done by the Harvard School of Public Health that followed somewhere around 60,000 women who were married, and they followed them up for about 15 years, and they looked at the divorce rate, the separation or divorce rate among these initially married women. Again, this is a Harvard School of Public Health, a large data set they've been using called the Nurses' Health Study. And they found that there was about a 70% reduction in risk of getting divorced or separated among those women who were more religious, who were more religiously involved. Now, in terms of trying to understand this relationship, this is a model that is present in the 3rd edition of the Handbook of Religion and Health. Again, that's coming out soon in 2023. This is trying to explain how religious involvement influences mental and social health. And it actually does so across the lifespan. So attending religious services or temple or mosque, praying or meditating, studying scripture, reading the Bhagavad Gita or studying the Quran or the Bible, volunteering, religious education, level of religious commitment, all of that is related to better mental and social health across the lifespan, as I said. In fact, the effects begin prior to conception. So prior to conception, the parents, the father and the mother, if they are more religious, they are less likely to use drugs. They are less likely to be depressed or anxious. They're more likely to be happy. And so because of that, because they're less likely to use drugs and alcohol, and because they have better mental and social health and more support, actually the sperm and the ovum are actually healthier. And when they come together, and the child begins to grow in the womb, it's then that the behavior of the mother takes over. And mothers who are more religious don't use drugs or alcohol as much. They're more likely to be married and have a supportive spouse. They're less likely to be depressed or anxious. Consequently, that intrauterine environment is a healthier atmosphere. And these young people grow up. When they grow up, they tend to respond to stress better. They cope better with stress, both psychologically and even physiologically. When the child then comes and is born, then religion affects how much that child is wanted. You know that, abortion rates are much lower among religious families. Religious families want children. They, in fact, the scriptures, the Hindu, the Islamic, the Christian scriptures, all encourage the having of children because children are important to religious people. That doesn't mean they're not important to people who are not religious. But in general, when people are surveyed and they're asked how nurturing their childhood environment was, those from religious families tend to report that it was more nurturing. They felt more wanted, more cared for. And so, therefore, that's going to affect the development of basic trust during infancy, which is crucial for further relationships later on in life. When the child then gets into adolescence and the teenage years, religious parents tend to monitor their children more closely. They want to know whether or not they are using drugs or alcohol or smoking cigarettes. They're wanting to know who they are hanging out with. Are they spending time with other religious friends? And they will encourage the adoption of religious friends for those young people. So there's going to be less alcohol use, drug use, teenage pregnancy, less delinquency, all of which can interrupt education. And that's one of the reasons why children from religious families do better academically. When people get into their adulthood, then they have to cope with families and they have to cope with their jobs. And religious people just do better at work because they're more likely to help other people out. They enjoy their work more. When you actually look at this, there is research, quantitative research that shows this, and it's all in this third edition of the Handbook of Religion and Health, if you have any doubts about this. And then as people get older, that's when religion really makes a difference. That is where I started out when I was when I was just starting out. I was in geriatric medicine. I was interested in studying, the healthcare of older adults. And that's when I realized that many older adults are more religious. And that's how they are coping with all of the difficulties, the health difficulties, the loss of loved ones. All of that then becomes, really causes many people to utilize their religious faith to cope with and adapt to all of those changes that occur as people get older. And not only that, but as people get closer to death, as they near the end of their journey, then religious faith gives them hope and gives them meaning that enhances the quality of their remaining life and the process of their dying as well. So religion actually influences mental health and well-being across the lifespan. Understandably, of course, genetic influences also affect these relationships, and gene-environment interactions also affect, the relationships and the effects that religion has on mental and social health. Now, not only does religious involvement have mental and social benefits, it also has physical health consequences. The way people's attitudes and their behaviors accumulate across the lifespan have cumulative effects across the lifespan on a person's physical health. There's a recent book that was published called "The Body Keeps the Score." The body keeps the score. In other words, the body, your physical body, keeps the score in terms of your behavior and your attitudes. This was a book written by a world-renowned scientist, Dr. Kolk, both a physician as well as a research scientist. He does a lot of work in terms of psychoneuroimmunology and the effects of stress on the body. So he wrote this book. And if any one of you are interested or would like to know more about how a person's mental and social health influences their physical body and their longevity, get that book. It doesn't talk about religion. I'm going to talk about it now. In the Handbook of Religion and Health, there are dozens and dozens, hundreds of studies, quantitative studies, published in peer-reviewed academic journals, showing that religious people experience less heart disease, lower blood pressure. They are less likely to have a stroke. They have less cognitive decline with aging. and they have increased concentration. They have less physical disability as they grow older. They have better immune functions and less systemic inflammation more generally in terms of the pro-inflammatory markers like interleukin-6. They have better endocrine functions. They have lower levels of the stress hormones, lower cortisol levels, lower epinephrine and norepinephrine levels. And they generally have lower death rates from cardiovascular disease and cancer as well. And in fact, about 80% of studies that have been done, and there have been a lot of studies looking at mortality, religious involvement, and mortality, religious people live longer, significantly longer than those who are not involved in religion. The extension of the lifespan is anywhere from 4 to 14 years. On average, it's about 7 years among white Americans, for example. But among minority groups in America, like African Americans, the difference in survival is 14 years among those who are religious versus those who are not. So here is kind of an overall diagram that describes how religious involvement influences physical health and longevity. And the source of these benefits is belief in and submission to God or Brahman, the supreme God, or Allah, the one undivided God that is in control of everything. Belief in and connection to God is, first of all, nourished within a community, within family and a community, and it's affected by peer influences. And it's manifested by these virtues of faith in God, hope in God, and love of God. This is all then manifested in terms of frequency of religious involvement in public practices, in public rituals, in private practices, private rituals, in meditation and prayer, in terms of religious commitments and the decision to submit one's life to God, in terms of religious experiences of God's presence in their lives, and in terms of religious coping. All of this then affects a person's human virtues, their ability and willingness to forgive, to be honest, to be self-disciplined, to be altruistic, to be generous towards others, to be humble, to be grateful, to be patient, and to be dependable. All of these human virtues help to enhance positive emotions, the purpose and meaning in life, the hope, the well-being, the happiness. It helps to develop social connections, strong social connections. It helps to neutralize negative emotions like depression, anxiety, and substance abuse. And that in turns affect the nervous system, the immune system, the endocrine system, and cardiovascular functions. Also, on top of that, healthier decisions that people make, health behaviors, better health maintenance activities, better screening, better compliance among those who are more religious, all influence the functioning of the nervous system, the immune system, endocrine and cardiovascular functions, which determine our physical health and longevity. Now, of course, all of this is also affected by genetic factors, by developmental experiences in childhood, and by personality. In conclusion, religious involvement is related to better mental health and greater psychological well-being. It's related to better social relationships. It's related to less delinquency and crime. It's related to better health behaviors, less alcohol, drug use, smoking, and even it's related to more physical activity. Religious involvement is also related, consequently, to better physical health, less functional disability, less cognitive decline, and greater longevity. These findings have enormous implications for public health and healthcare costs as religious involvement becomes less common with each younger generation and secularization spreads and science and technology become the primary sources of truth. That's what's happening here in the United States. That's what's happening in Europe. That's what is also encroaching on countries in the Middle East and in India as well. The clinical implications and applications are also enormous in terms of providing social, mental, and medical services. I haven't really talked about any of the clinical applications today because I've been focusing more on the science, but there are enormous implications in terms of taking a spiritual history on all medical patients, on all psychiatric patients, and in terms of integrating the person's religious resources into their treatments. I haven't talked about that today, as I said, but maybe a future time that you invite me to speak to you, I would be happy to talk about the clinical applications. Now, in terms of further resources, we publish a monthly e-newsletter. It's completely free. Simply go to our website and sign up for it. This newsletter summarizes the latest research, the latest resources, the various lectures and conferences, and even the latest funding opportunities to do research in this area. Here are the two books that I've written, one on Hinduism and mental health that summarizes a lot of what I've talked about, and then one on Islam and mental health, again, focusing on the specific belief systems here. Now, I also have written a book on how to conduct research in this area. This was published in 2011, and it talks about the methods, the measurement, statistics, and resources that can be utilized to study this relationship between religion and health. I do a lot of training courses for young individuals who are going into the field and are interested in this connection between religion, mental health, social health, and physical health. Now, maybe some of you might be able to come to the United States to our workshop. We've had many people from India come to our workshop, and we even offer a scholarship for some highly, very promising academics, faculty members who can do research. We have some scholarships to come to our workshop. This is a powerful 5-day workshop that includes professors from Duke University, from Yale University, Emory University, and elsewhere, Johns Hopkins University, and we train people how to do research, how to measure religion and spirituality, how to get the research funded, and how to publish the research in peer-reviewed journals. So if you're at all interested, please send me an email. My email is very simple, harold.koenig@duke.edu. Here is our website, Center for Spirituality, Theology, and Health at Duke University. You can simply Google Center for Spirituality, Theology, and Health, and this will come up. We have lots of free resources here. We've got videos, we've got the religiously integrative CBT manuals. It's all right here. So I would encourage you in that regard. Now I'm going to stop sharing my screen and say goodbye to everybody. So it's been great talking to you all. I wish I was there in person, and maybe I'll be online. I'm hoping to be online at the end of this presentation, where you can ask me some questions about this. I'd love to have you ask me questions and interact with me about this connection between religion, spirituality, and health. Thank you very much.
That was an excellent presentation, sir. Now Dr. Harold is also online. I request both the chairpersons to first give their comments. And there is one question. It is in the chat box. Dr. Avinash, sir, you can ask the question to the speaker.
Would you read the question for me?
Yes, I would. So one of the questions which has been asked is that with so much of evidence to show that spirituality and religion is beneficial, why is it not better integrated today into general and mental health care?
Yeah, that's an excellent question. And I think many people just don't know about the research or the quality of the research, because religion has not been something that scientists have been very, very friendly towards. And therefore, it hasn't gotten out into our training programs, our medical schools. It's getting out now a little bit. But, it's people like you all who will tell others about this research and will include it within your clinical practices that will enable this to eventually spread throughout the profession.
Well, so there's another question that, what if a patient says that I know that religion is beneficial and I know that it'll improve my healthcare and my mental health care, but as an atheist, I cannot get myself to accept any religion. So is there any form of therapy that could be offered in that regard, or any form of treatment that could be offered? Not necessarily conversion kind of a treatment, but anything that we could offer him?
Yes. The key here is engaging the person in a conversation, trying to understand where that person is at and accepting them. So if a person says, I just cannot come to a point where I can believe in God, then I would say, keep an open mind. Don't close your mind to it. Keep an open mind that it's possible that this might be a source of support and well-being for you. And tell me a little bit about your background. Tell me about how you were raised and how you came about deciding that there was no God. Tell me about that. And usually there's something in their history that will help to explain why it's been difficult for them to come to a faith. And, doing that in a kind and compassionate way, trying to understand, is all you can do. All you can do. This is a very personal decision, the decision on whether or not to believe. And, things happen in life over time. It doesn't have to all occur at one moment, but things happen in life. And I think over time, that individual may come to a faith, but that's not our responsibility. You can only do so much. And being caring and listening and trying to understand is about the best you can do.
Yeah. Well, sir, there's one question which is my own question, which I want to ask, is that when we look at so many studies on religion, mental health, religion and health, I mean, are there stark differences between people who are religious in the sense that they're genuinely, truly religious from the heart versus people who may have very high church attendance, but they may not really be, religious at heart. So they pretend to be religious rather, but, you can make out, I mean, you deep down, they're not religious. So is there any kind of distinction done between, these groups?
Yeah, it's really the person who has both of those, It's both. Being part of a religious community is very important, no doubt, whether you believe or whether you don't believe. That is going to have many benefits. But also having a deep belief, and that's extremely important. It's important for much of the time that we don't spend with other people, when we're alone, and we're just with ourselves. It's our belief and our relationship with God that gives us that sense of meaning and purpose and hope when nobody else is around. So it's usually the combination of the deep religious faith and the involvement within a religious community to live out that faith that makes the difference.
Right. Thank you, sir. I hand over to my co-chairperson, Sayuri, for any comments and any questions that are there. Yeah.
Am I allowed to ask a question, please?
Yes, sir. Please.
Oh, yes. Dear Professor Koenig, this is Peter Verhagen speaking here. Actually, I'm here in Hyderabad. That was really exciting. And listening to you and looking around here, people became a little bit more excited about it. So thank you very much for that. My question is, we used to talk about the religiosity gap. You know, the religiosity gap between the psychiatrist, psychotherapist on the one hand and the patient on the other hand. Is that still going on? Or what, in your view, would be the solution? Because you alluded to it. In my country, that gap is only growing. It's only growing. And as you suggested, in the States, it's also growing, and perhaps here in India. So what are your thoughts about that?
Yeah, the religion gap, it's a big one. It's a big one, especially within the mental health field, especially within psychiatry and psychology. And part of it has to do with the training. For most of the previous century and a good part of this century, religion was seen as something neurotic, something unhealthy. Freud had very strong feelings towards religion. And he felt that it was obsessional. It was obsessional, and it can be that way. Religion is not always something positive. And when many of the patients that Freud saw, they came to him because they had mental health problems, and they were using religion in neurotic ways. And so it's understandable why he concluded given his own negative experiences with religion, that this was something unhealthy. But, you know, I think with the latest research, it's been accumulating. There's so much of it, and it's from every country, virtually, around the world, showing these benefits in different religions. It's just hard to ignore this. And so I think the way to overcome this gap is to begin early in training in medical school, training in psychiatric residencies and training programs, and exposing young people, young learners to this research. So it's a great question. I think that gap is slowly becoming less, simply because the research is just overwhelming, and you just can't ignore that if you're a scientist.
Okay, thank you very much.
Yes, I think over to Sayuri. Anything?
Yes, Professor Koenig, that was fascinating. It was extremely fascinating listening to the vast amount of research and your experience in this field. I'm a psychiatrist practicing in Sri Lanka, and my question to you is, in Sri Lanka, we have, I would say, a huge majority of Buddhists. And I want to know, in your in the wealth of experience that you have had in this area, sir, has there been any success in incorporating Buddhist sort of philosophical concepts into perhaps the psychotherapy aspect of psychiatric disorders, and what is your experience in that regard? Because this is something that we in Sri Lanka are looking to incorporate into the therapy aspects of our patients. So I would love to hear your thoughts on that regard, sir.
Yes. You know, we have actually, you know, within secular psychiatry, we have adopted various Buddhist practices into our treatments, into cognitive behavioral therapy, into acceptance and commitment therapy, into many, many different forms of secular psychotherapy in terms of mindfulness and mindfulness meditation, which, of course, is the seventh step on the Eightfold Path. The seventh step on the Eightfold Path. The only challenge here in the United States in doing that is that most therapists select that out, that one step out of the Eightfold Path, and they forget about all of the other steps that help to frame the understanding of what mindfulness meditation is all about. And those are the first 5 precepts. The first 5 precepts on the Eightfold Path, which is right living, right speech, right behavior, right action. You know, that frames it. And if all you do is do the mindfulness, that's not going to help that much unless you also adopt the full Eightfold Path that the Buddha taught. So yes, there are all sorts of ways you could integrate the Buddhist philosophy and the Buddhist teachings into psychotherapy. Many, many different ways. If anything, Buddhism, those beliefs are very framed. They're framed towards mental health. You know, that was the goal of the Buddha, was to relieve suffering, to relieve the suffering. And that's what people with mental health problems are experiencing. They're experiencing suffering. And so the Buddha was challenged by that when he went out into the community and he saw all this suffering. And so he meditated and came to the realization that it was the attachments that people have that create a lot of the suffering, and the fact that they're not living in a way that is right living and right actions and right work and all of these things. So in any case, there's a vast amount. I have a book on Buddhism and mental health that I think you'd be interested in. It's on Amazon, and it describes the beliefs and how and some of the research actually that's been done on this topic as well. So, yes.
Thank you, sir. Thank you. And I will most definitely be in touch with you as well, because we really could do with some advice from you, if that's okay with you. Thank you, sir.
Absolutely.
Dr. Harold, what is the final message which you want to give at the end of the session?
The final message. Well, I would just encourage all of you. You know, I would encourage you now. It's not easy being a healthcare provider. You know, patients don't always get better, and it can be frustrating, you know, but I think a lot of the healing process involves accepting people where they are and loving them, caring for them for whom God has created them to be, and walking alongside of them. And, you know, this does a lot, because a lot of people just naturally by themselves will work out a lot of their problems if they have a safe and accepting environment and they have a connection with someone who cares. So that would be my final message.
Thank you, sir. That was an excellent message.
Bye-bye, everyone.
Yeah, thank you, sir. From the organizing committee, we are thankful to Dr. Harold Coing and Dr. Avinash D'Souza and Dr. Sayuri Pereira for, Dr. Avinash D'Souza, sir, please kindly accept our felicitation.
Yes, you all send me this beautiful shawl, so I'm wearing it. They told me I have to wear it when you all felicitate me.
Thank you, sir. Actually, we are requesting all the delegates to wear the shawl,
And the
sir.
certificate also. Thank you so much.
Yeah, thank you, sir. Thank you, sir. We thank Dr. Sayuri Pereira for being for accepting as chairperson. Thank you, madam.
Thank you so much. It's my pleasure.
We thank Dr. Harold for being part as a speaker for this international conference. Thank you, sir. Please accept our token of appreciation. Yeah, thank you, sir. In 2 minutes, the valedictory session is going to start. For this conference, we had total 700 plus registrations, and at any point of time, 300 plus participants were active in the Zoom, and there was an active YouTube link which was seen by more than 200 people, and approximately 30 to 50 participants had been present in Taj Deccan physically. Thank you all. And the organizing committee, under the guidance of Dr. P. Raghuram Reddy sir, Dr. B.N. Gangadhar sir, Dr. Ajit sir, and National President Dr. N.N. Raju sir, had taken every steps so that this conference will be a success. The main agenda for starting of this conference is all the patients will be treated with different psychotropic drugs, biological treatments, but still our fresh postgraduates and fresh consultants, they're having a lacuna to handle from illness to wellness domain. So this conference is going to start as a stepping stone so that in future such kind of conferences will start, and this particular gray area, wellness domain, will be addressed.
చెప్పు అంత చాలా కష్టపడ్డారు రాత్రి పగలు నిద్ర హారాలు మానేరు చెప్పు.
We thank Dr. Peter Verhagen, who came all the way from Netherlands, and he had been physically present from past 2 days. Thank you, sir. We thank Dr. N.N. Raju, sir, who had traveled from Vizag and he's physically here. We thank Dr.
Work throughout and tell us so that we will go back and work the similar way. What is the secret of his success? Or some that tutorials.
Actually, this program is guided by Dr. Kishan, sir. From day one, when we had started this session, sir was constantly guiding. I always remember one example where sir says, after the Mahabharat Yuddha, when all the Pandavas were asking who was the bravest warrior, then there was a confusion. Who is the bravest warrior? Then they went to Krishna and asked, who is really the bravest warrior? Then Krishna took to a mountain and he had there a soulless man was there, and he had said, no one was fighting in the war, only Krishna was visible and his Ayuda was there.
Krishna has come.
So the man behind this show is our teacher, my guru, Dr. Kishan sir, who had taken inspiration from his gurus, Dr. Raghuram Reddy sir, Dr. B.N. Gangadhar sir, and all the legends. So this seminar is really a dedication by a guru to his gurus. Thank you. Now I request my guru, Dr. Kishan sir, to take over for the valedictory program.
Good evening, everybody. And now we have to close this conference with valedictory function. To start the function, I'm requesting President, Indian Psychiatric Society, Dr. N.N. Raju sir, to come out to the dais and preside the valedictory function. Today's chief guest of the function of valedictory, Dr. Mukesh Vaishnav. He is the past president of IPS and now president-elect of very powerful organization, Indian Association of Private Psychiatry. Sir is most of the Telangana psychiatrists requested to call Mukesh Vaishnav as a chief guest on demand. Sir, welcome you, sir. Then I'm requesting guest of honor, Dr. Uday Kumar, President, South Zone, who is the President for South India, that is consisting of 5 states. Karnataka, Tamil Nadu, Andhra Pradesh, Telangana, Kerala. Thank you, sir. Then another guest of honor, Dr. V. George Reddy, is next 2 young leaders are going to. One is George Reddy and Praveen. George Reddy is the president, Telangana State, Indian Psychiatric Society. And next young upcoming leader is Dr. Praveen Manna. They're all young brothers. They're all behind the success of this conference. Dr. Praveen Manna, Praveen Kumar Manna is the president of Telangana State Branch of Indian Association of Private Psychiatry. I'm requesting Dr. Vinay Kumar sir, President-elect, Indian Psychiatric Society, to come out to the dais. Now, I'm requesting Arabinda Brahma, Secretary, Indian Psychiatric Society. Book. Now, I'm requesting Om Prakash Singh, OP Singh Saab, Editor, IPS. Welcome you, sir. Online is joined by Zoom. I'm requesting Alim Siddiqui, Treasurer of IPS National. Sir is having some technical problem as well as is away from the house, and probably he may join shortly. And I'm requesting Dr. VL Naresh. Please check the technical team whether Naresh joined or not. There is some emergency problem in the house. We went to a rural area to attend some ritual. Respected President, Dr. N.N. Raju, and his office bearers, Vinay Kumar, President-elect, and Arabinda Brahma, and Om Prakash Singh, as well as Alim Siddiqui, and EC member, EC coordinator, Naresh, and chief guest of today's function, Dr. Mukesh Vaishnavji, who is a well-wisher of Telangana State Branch. And we got a lot of problems since last 7-8 years. The new branch, Mukesh Vaishnav is a Vishnu who protected a Telangana branch, and Vinayji is here. Lot of hurdles. The both are as a secretary, Vinay Sab, as well as Mukesh Vaishnav, has given a lot of support to the Telangana State Branch to become to the present stage. We want to remember the help, whatever they given till now. Uday, even though our Telugu state separated 7 years back, we think that Uday Kumar and Suresh, all the persons we are like brothers and belongs to a common area. We never, that is the love and affection of Telangana State Branch and Uday. And he came all the way with the difficulties by train journey, and I think, thank you, sir, Uday Kumar, for coming over here. And Judge Reddy, everybody knows in IPS, is representing IPS EC since last 7-8 years and contributing whatever the section he gives. And he is doing a lot of justice. And I'm remembering Vishal, who is helping IPS and doing work, a lot of, and raising the flag of Telangana State Branch in national level. Dr. Manna Praveen has taken over recently as a president. Welcome you, Praveen. We wish, and there are a lot of your president-elect is here, Mukesh Vaishnav. Sir, give blessings to our Praveen, sir. He is from my town, hometown. He is became president, Telangana State Branch, and certainly will be active. And by your presidentship, will grow. And thank you, sir. I became EC member under leadership of. I take an oath with Mukesh Vaishnav's hand. Thank you very much for inviting me as a EC member to IAPP National. With these few remarks, I think I'm handing over to President, Presiding Officer, to take over the proceedings.
Thank you, Dr. Kishan. In fact, this is the one function which IPS should organize, to thank the local organizing committee for having done an extremely good job. But again, we are made chief guests here. In fact, I wish the IPS itself invites them as chief guests and really thank them for having served the causes and objectives of IPS to the fullest extent. So thank you so much, Dr. Kishan. We all have seen today's program, absolutely dot on and everything in right place. So I think a lot of credit goes to not only Kishan, I think his team, but again, converting team into the place where they do their work, I think without any hitches, is itself gives a lot of credit to the leader. So I think whether he is Arjuna or Krishna or Rama or I don't mind even Ravanasura also, but still he has done an extremely good job. And we are, I think, on behalf of IPS and on my personal behalf, I really thank Dr. Kishan for the excellent job. Of course, he might give credit to his teachers, he might give credit to his others, but still we believe that his department, his team, and have done worked wonders. Really great, good, nice to,
mold it in such a fashion. And that is a lesson to every one of us sitting here, irrespective whether we are seniors to him or juniors to him and all. And this is how we should, I think, have a team to do any work. So I think I know I'm envious that he has people like Dr. Sai Krishna with him and all, but still that is how things move. And once again, this is one function which we believe that has done, as I said, everything has been put in its place and nothing beyond here and there. And having such a faculty all across the world, I really appreciate how you could manage so many people, all stalwarts, all are original researchers in the field where they have been working. So it's really wonderful that you have done a great job. Also nice to have our friend, our colleague, and somebody who has, I think, already has a friendly and also worked as president of Indian Psychiatric Society, Dr. Murugesh Vaishnava as the chief guest today. We feel this is how I think we gel each other, and I think we could not have get a better man than him to be the chief guest to the valedictory function. Also, we have another very energetic, enthusiastic man on jump always. I had never seen him standing on the floor. He is always, I think, bubbling with activity. Dr. Uday Kumar. So nice to have you, Dr. Uday Kumar, being a guest of honor today. And as I said, today is the place where I don't really see Dr. Jaj Reddy, Dr. Pawan as different from any one of us. All of us one family. So I'm sure it is nice to have our own family members to be in the right, on the dais and in the places. And we really appreciate the cooperation, the help, everything you had given to, Kishan, which indirectly is help to the IPS itself. Kishan, obviously, Dr. Kishan is obviously representing IPS here. So we are happy that we thank you for that. And I'm thankful to Dr. Vinay Kumar and Dr. Arvindo having spent a lot of time here because we have all been traveling. I think literally traveling, staying there for a few hours and going to another place, staying there. So that's how things are moving. In spite of all that, the word from Kishan is good enough for every one of us to just land here. So it has been wonderful work, and also thank the seniors, Dr. Raghuram Reddy Garu, obviously, who is, as I said, he's perhaps, we look forward to him for anyone. It doesn't matter whether we are from Hyderabad or we are from Vizag or Chennai or anything. He's Pawan, I said, Praveen, sorry, Praveen only, I said, so spelling not autocorrect. It is Praveen man, I know he's a good, and basically, I think, in my flow, I might, that remembering the Pawan's morning and that I think I still have to come out. I did mention him, it is Praveen, not Pawan. So Praveen has been a good friend of mine for quite a long time. And I think we have a long association, and I think, sorry if I misspelled the name, but I meant Praveen only. That's why I said all of you are being members of the family, same members of the family. We are happy to have you here. By and large, I think it has been a great work. Let me not take much time. Once again, as I said, no words of appreciation is good enough. I go through the, so now I request, Naresh, are you online? No, okay. Then Dr. Om Prakash, the editor of Indian Psychiatric Society, Dr. O.P. Singh. Dr. O.P., can you have a couple of words for your feedback?
Good evening, sir. My regards to President Dr. N. Raju. Of course, it is much pleasure to see the chief guest, Dr. Murugesh Vaishnava, our Vice President, Dr. Vinay Kumar, Dr. Arvindo Brahmo, South Zone President, Dr. Uday, Dr. George, and Dr. Praveen, and of course, Dr. Kishan. This has been a really fascinating conference. And as mentioned by President, we must thank, apart from we know that Dr. Kishan is really, really great in organizing things, but the work done by Sai Krishna, Dr. Praveen, Dr. George, and all the who are not youngsters now, they are in the middle of the zone. Their rising is risen, It has been wonderful, and seriously, the academic content was par excellence, and it has brought pride to India and Indian Psychiatric Society, I must say, and we must thank them profusely. Thank you so much.
Thanks for your words, Doctor. Dr. Alim is not online. No, okay. Dr. Arvinda Brahma.
It's really a wonderful experience to be present over here throughout the day, because the way the whole program was formulated, involving speakers and chairpersons from different countries, from different regions, and obviously from different religions. So I think that is the importance of spirituality and religion, and that is the importance of spirituality and religion in mental health per se. So today we have learned a lot about Hinduism, about Buddhism, about Christianity and others, and I think it's a wonderful program organized by Dr. Kishan. No word is enough for him. I know for a long time he was keeping in touch with me over phone. You know, the hard work he has done, and basically he is having a wonderful team, some young dynamic colleagues like Dr. George, then Vishal, Pawan, Dr. Praveen. So Shai Krishna is doing a lot of work the whole day. I'm seeing him. In fact, from the last few days, he's keeping in touch with us. So basically, it's a teamwork and led by none other than Dr. Kishan. So if he works like Mahendra Singh Dhoni, so the India will win the World Cup. So that is the reason this time this conference has become a grand success. It's a great success, no doubt to say that. So once again, my thanks to the organizing team, and I wish Dr. Kishan is very religiously organizing this sort of event every year with spirituality. So I hope he will continue this, and in future we can learn a lot from this thing, because I think spirituality is the future. It's the future of psychiatry. The way world is now going through, we should give more importance to spirituality, especially in psychiatry practice. Thank you. Thank you very much.
Thank you, Dr. Arvinda. Now I request our President-elect, Dr. Vinay Kumar.
All of us have heard lots of things whole day, and the show was organized by Dr. Kishan. Now everybody is full of appreciation. Words of appreciations are in the air. So same thing I would like to add. But the most important thing what we learned today is there was spirituality being practiced earlier. After that, it was converted to theories all over the world. And after that, materialism took over and spirituality took the back seat. But today, we need to translate this, execute this, because the wellness component is not being taken care of properly. With these few words, I would request the spirituality section to work sincerely next year as well, so that let's find some ways, let's find some modules to include in clinical practice, and everybody carries a message who attends the conference next year, how to execute things in clinical practice. It was a grand show, definitely. Almost entire world participated from different continents, Europe and entire Asia. So a great conference. And I request Dr. Kishan to have it a physical conference next year in a bigger way.
he's capable of doing that. Maybe with the help of Dr. Vinay Kumar, I think he should be able to do it well. A international physical conference, right? Thank you. I'm sure Vinay would be behind that program. So I now happy to have Dr. Praveen Amanna as I said. More than a friend, today he is the guest of honor. So we honor you, Dr. Praveen, and please give your message.
Good evening, everyone. Respected dignitaries on the dais and all the delegates joining through the Zoom all over the world. Good evening. Respected chief guest for the today's valedictory function, Dr. Murugesh Vaishnav sir, and chief patron, Dr. Raghuram Reddy sir, President IPS, Dr. N.N. Raju sir, President-elect IAPP, Dr. Vinay, President-elect Dr. Vinay Kumar sir, General Secretary IPS, Dr. Arvind Brahmada, Honorary Treasurer IPS, Dr. Aleem Siddiqui sir, Honorary Editor IPS, Dr. Om Prakash Singh, and IPS Task Force for Spirituality and Mental Health Subcommittee Coordinator, Dr. Naresh Vadlamani, and President IPS TSB, Brother Dr. George Reddy, and last but not the least, today's organizing secretary for this conference, Dr. Kishan sir, and all the members involving in the organizing committee, Dr. Sai, and Dr. Spurti, and all the PGs from Karimnagar Medical College. Good evening. And a warm greetings from the office of Indian Association of Private Psychiatry, Telangana State Branch. So today conference is really great success. More than 700 delegates attended throughout the conference, and I congratulate the organizing committee for selecting the veteran speakers all over the world and chairpersons. So, and making this theme very interesting and informative. Once again, I congratulate Dr. Kishan sir for all the efforts he put for making this conference a great success. Thank you. Thank you, one and all.
Thank you very much, Dr. Praveen Kumar. I think difficult for him to see in such a role because he still looks like a postgraduate for me. Even though his son has become a so you don't believe that he's such an age on his head. So that is the reason why we still think you are just have graduated. So nice. I have, I think, equally young Dr. George Reddy to deliver his message of appreciation.
Respected chief guest for today's valedictory function, Dr. Murugesh Vaishnav sir. I think I call him our beloved Dr. Murugesh Vaishnav sir. I think we really happy that you are our chief guest sir for today's program. And again, the new role, IAPP President, I think still will be active with you, sir. And I wish Dr. N.N. Raju sir, we change the bylaws and we make you a president for the another term, because I think this is one president I have noticed. He's always checking all of us, all the committees, whether you're doing programs or not. I think, in fact, I am the chairman for the IPS Human Rights Task. I'm scared where Dr. N.N. Raju sir will say, you haven't done any programs. So thank God, at least we could do 3 programs. And I really appreciate, because I've been with so many presidents, but he's the president who's behind. You have given a task, you are given a position, you have to do justice. I think really we all should appreciate his personal involvement as a president to see that all the committees are working. And sir, I'm not flattering you, sir. This is what I'm telling you from my heart. And another equal person, I wish Dr. Arvinda Dada should be the General Secretary for another term, because he's one person, I think he's got connected, well connected with all the members of the state, and especially persons like us from Telangana. I think really we enjoy his tenure and the way he encourages us. I think that's his quality. And next, Dr. Vinay Kumar, sir. I'm sure, sir, you're already overwhelmed with. Yes, you're all overwhelmed with this program, and I'm sure you're going to give this task to Dr. Kishan sir again to take up this spirituality subsection, sir. I think he's one man who's so much committed, and I think after getting in acquaintance with Dr. Kishan sir, I think. Yes, I think, sir. Yes, I think he deserves everything, because right from the plan to the execution, I think he's the person behind, and he has made us all run on our toes. And late nights he finishes his OP, and I think that's when he calls us, and it's not less than a half an hour talk. He checks everything. I think that's his commitment, and all the team from KPS. And all the students, Sai and everybody, wonderful job. I'll just end today. I could at least try to, understand what is the gap, what is the link between spirituality, religion, and mental health. I think wonderful speakers, Dr. Peter and others. I think Dr. Peter, sir, I can see him. He's there right from the morning. Yes, sir. He shows his commitment. Really, sir, we are overwhelmed with your presence, sir. And all the speakers did a wonderful job, and the link will be shared, and I'm sure those who missed really should go through that. And let's practice spirituality and wellness in our psychiatric clinics, and I think that might give us a better edge, and we might be a better therapist too, along with being better psychiatrists. I thank the guest of honor, Dr. Uday sir, our beloved South Zone President, Dr. Manna Praveen. And if I missed all my IPS, Telangana State Branch office bearers, EC members, for giving a free hand to Dr. Kishan sir to organize such a wonderful program. And it was a wonderful evening, and I think it will be a memorable one like last year. Kishan sir, once again, thank you very much, sir. Thank you, one and all.
Thank you, Dr. George Reddy. And in fact, there is a, hukum from Sai Krishna not to repeat the names, but now you are telling you the biographies. Okay, thank you so much for this meeting is more to appreciate the efforts of Dr. Kishan and his team. And I think me and Dr. Vinay and all can wait for our, this anyway. So we have Dr. Uday Kumar, quite a popular figure. Now the president of South Zone, Indian Psychiatric Society South Zone, for his message of appreciation.
Very pleasant and very good evening, all of you who are here and who are on offline. IPS Task Force for Spirituality and Mental Health. I think you also believe that they have done justice by, I think you are witnessing the good work of their, what we have been witnessing. I think big salutes to Dr. Kishan Prasad Rao Garu and Naresh Vadlamani, Raghuram Reddy Garu, George Reddy and Praveen, Vishal and Sai Puli and Uttam and Anupam and Ravi also. If you have a thinking power, think big. I think Kishan has thought of very big and connected not only India, I think he has connected throughout the world and brought all these speakers, renowned speakers who are working really in this spirituality wing. I think all of them, I thank and salute to all the speakers who have come up into this event and then delivered the spellbound lectures. Kudos to all the speakers, especially Peter sir, who is sitting with us. And to this small event, I think all the office bearers from the President, Dr. N.N. Raju Garu, and Vinay Kumar Garu, Aravind Brahma, Om Prakash, and Alim Siddiqui, all of them literally, physically there came from Mysore, I believe. taken a lot of pains to come over here to bless this event. That shows their commitment, sir. And we have a chief guest today, Mukesh Vaishnav, sir, and George Reddy and Praveen as guest of honors to this valedictory function to bless this. Finally, what I would like to tell you all is all these studies, and surprisingly, we have a n number of studies who have proved that spirituality, spiritual practices are useful, helpful in treating mental health issues, especially cancer patients. I really thank the IPS President N.N. Rosgaru and Aravind Brahma Garu to say that they'll be including this spirituality and mental health in UG and PG curriculum, which isn't there before. Thank you, sir. I think hats off and kudos to the IPS task force, Kishan Garu, and with the blessings of Raghuram Reddy Garu and B.N. Gangadhar, he has done it, I think. I think kudos to IPS task force of mental health and spirituality. Thank you, sir.
Thank you, Dr. Uday Kumar. Before requesting our chief guest, Dr. Mukesh Vaishnav, if we have any feedback from the audience, we will like to listen to them from them, and anybody, one maybe from whoever present and somebody from online also we can ask. Anyone? Yeah.
Good evening, everyone. I'm Dr. Srinivas. I'm a final year postgraduate from Prathama Institute of Medical Sciences. First of all, on the offset, I would like to thank everyone in the organizing committee for giving me this opportunity to speak in front of this esteemed crowd. This is one of the biggest exposures for all of us postgraduate residents to spirituality in the field of psychiatry and wellness. And I would like to take this opportunity to thank each and every one of the speakers during this conference in giving us newer ideas and newer perspectives as well to explore from the beginning of our careers. This indeed was a great conference where we had an opportunity to interact with eminent national as well as international speakers from whom we had learned many newer things as well. So for that, I would like to thank everyone. Thank you.
Peter, anything?
Yes. Yeah. Well, again, it was an exciting and an excellent program. So again, I congratulate you all, and of course, especially Dr. Kishan. And I agree with Professor Koenig. What we need to do is to train our young colleagues. So I appreciate the comments of my young friend who has been very kind to me for these few days we are here now. So I appreciate, and you should appreciate his comments very much, because that, as always, the future, the youth is the future, but also with regard to the theme of spirituality and religion in psychiatry. If we don't train our residents, then it's not going to happen, because all these knowledge is available since the last 40 years. It's not from yesterday or last year. These facts are already known for 40 years. So training not only skills, but also attitude and sensitivity is very important. Again, I congratulate you all with this excellent day. Thank you very much.
Dr. Gangadhar, feedbacks or anything for improvement or anything you want to?
Yeah, at the end of the 2-day or 1-day program, I suggest that you come up with a small guideline or compendium that should be shared with perhaps maybe IMA or NMC or whatever it is, the need, this is as frequently emphasized, the need to incorporate a component of spiritual practice or whatever it is for purposes of patient care in our undergraduate and postgraduate training. And your college students having come to that yoga posting, what was some feedback, whether more colleges can do this and how to facilitate this integrative medicine to become a part of every medical college. Something like that, we should start pushing the cart in that direction. It is a very good move, but I'm sure the follow-up action should be as perseverant as what you have had this. Anyway, I must congratulate the entire team, worked very well, and it was a very good team effort. And thank you, Raju Garu.
Thank you, sir. And I'm sure Dr. Arvind Brahma would follow this up and have some feedback and some papers, some few documents, which we can upload it to NMC and ministry for how best, I think we can incorporate the spirituality in curriculum, both at a medical and also non-medical courses also, something like where you have in the universities. And also Dr. Gangadhar would help us to pass it on to Ministry of Education or Ministry of Health and all. Probably, I think that should be a good one. So trying to make, I think Sai Krishna can help us. He's the editor of Telangana, so he has the skills of making a good document. So I'm sure he would do that. Thank you so much. Now, anybody online?
Sir, good evening, sir. This is Dr. Sanjay speaking from Karimnagar. Actually, I am under the leadership of Dr. Kishan. Sir is a very meticulous organizer of any conference. From the morning, I have been witnessing the conference, right from Basu sir to Koenig. What my takeaway points from this conference was, spirituality should be a part and parcel of the training program. And even the history taking, one line should be added to the spiritual aspect without we getting inhibited, whether if you ask spirituality or religion, will the patient get offended? So if you can incorporate that into the history taking concept, then it will go in a long way for helping patients to recover. Basically, we see most of anxious and depression patients, they become severe because they are focusing on the problem too much. Now, when they incorporate spirituality in that, they will be defocusing. They'll be believing in that I am a smaller person and I am a part of a bigger thing. That's what spirituality dimension gives. And when they concentrate on that, something bigger than themselves, then there will be defocusing, then, and consequently there will be a improvement in the health of the patient. So I'm thankful to all the speakers and the organizers also for giving me the opportunity to speak on the occasion. Thank you, sir. Thank you very much.
Thank you, Dr. Sanjay. Fantastic tribute to the hard work of the people around here. Now we have the most expected talk, Dr. Mukesh Vaishnav. He doesn't require any introduction to be it a national audience or the international audience. He has been in the prime of his work all through.
Namaskar, Pranam. I have come specially with the request of Dr. Kishan. I had to attend one more program at Pushkar, and that was organized by IAPP Rajasthan State Branch. But it was an invitation from Kishan, and probably it was an invitation from Vishnu Avatar, the temple which I visited today. And that's why I'm here today. I'm really overwhelmed with almost everything. The arrangement, the academic lectures, which I could listen online, the way in which the speakers delivered the goods, including our own Professor Gangadhar and others. It was really an excellent workshop to witness. What I feel, Dr. Kishan said that once myself and Vinay Kumar were for the Telangana branch. Yes, I remember those days. I had spoken only one line to my poet friend, who was the secretary at that time when I was president. that कुछ ऐसे भी मंजर होते हैं तारीख की नजरों में, कुछ ऐसे भी मंजर होते हैं तारीख की नजरों में, लम्हों ने खता की है सदियों सजा क्यों पाए. And with that, the Telangana state branch came up. Now it is the most active branch. And I would invite Dr. Kisan not only to organize the International Conference of Spirituality and Religiosity, but I will also invite him to come on the bigger platform. If possible, let's change the rule. As George suggested, that looking to the meticulous work of Dr. N.N. Raju, we should change the rule and he should be repeated as a president. Similarly, let's change the rule if possible, and people like Kishan should come up to serve the IPS. There are many potential people in Telangana who can come and serve the IPS. So with these words, I thank you all. And my last wish is the person who has worked hard, let him give a standing ovation. Mr. P. Kisan, you deserve it. The team of Telangana State Branch. See, I am not saying Kisan at the cost of all the members of the Telangana State Branch, but there is always a captain, and that's why he has to be handed over the cup. So Mr. P. Kisan, standing ovation, and entire Telangana State Branch, standing ovation is there. Thank you. Thank you very much. Keep it up. Spread this word, spread this knowledge, so that I remember that in 2007, I delivered a lecture in Seoul in WPA, Spirituality and Psychiatry, Complementary or Contradictory, based on Bhagavad Gita. That is in the book chapter also. But after that, somehow or other, I was disconnected with the spirituality. And now I feel more connected, and that will help me also in my own life and in my own family life practice, and even helping my patients. With these words, thank you all. Namaskar. Jai Hind.
Thank you, Dr. Mukesh Vaishnav. In fact, he is one who can deliver lecture on many areas. So quite an effective speaker, and he regularly has videos on his Facebook also. I think motivating videos. I think all of us would be very good to watch them. Thank you, Dr. Mukesh Vaishnav. And we have a very, very, very nice program of felicitating our seniors. Two of the most respected seniors in the country, Dr. N.V. Raman Rao and Dr. S.C. Tiwari, both online felicitations. I request Dr. Kishan to coordinate.
The organizing committee of the International Conference of Spirituality in Mental Health and Wellness decided to honor Dr. N.V. Raman Rao and Dr. S.C. Tiwari in the valedictory function. Dr. N.V. Raman Rao is one of the senior-most psychiatrists from Andhra Pradesh, very well respected. Most of the teachers from Telangana and Andhra Pradesh are students of Dr. Raghuram Reddy and Dr. N.V. Raman Rao. And it's a time to respect them. I used to observe silently N.V. Raman Rao, how he talks, how he walks, what is the following from the senior-most psychiatrists like K.P. Sudhakar and Prasad Rao. All are modeling N.V. Raman Rao, sir. Sir, thank you, sir, for acceptance for felicitation. And I'm requesting Madam to give bouquet. And Madam Raman Rao is doing felicitation on behalf of organizing committee, and shawl, memento. All family members. Thank you to family members of N.V. Raman Rao, sir. Now over to Spurti to read the citation.
Good evening. I'm Dr. Spurti, and it's indeed a privilege to read out the citation of Dr. Radimpalli Venkata Ramana Rao. He's a well-renowned psychiatrist. Sir was born on 15th of July 1943 in Guntur, Andhra Pradesh, India. He received his MBBS degree from Guntur Medical College in the year 1965 and diploma in psychiatry from Nimans in the year 1967 to 69 and doctorate of medicine in psychiatry from 1973. He started his professional career as a lecturer in psychiatry in Kakatiya Medical College, Warangal in the year 1969. He worked as an assistant professor of psychiatry at Tirupati and Guntur Medical Colleges from 1973 to 1981. And later he got promoted as a professor in psychiatry in the year 1981. Sir is a teacher of many psychiatric teachers in both the Telugu states of India and also even abroad. Sir is actively involved in the postgraduate teaching and training programs of various medical courses. He has guided several PhD and MD students in their research works. He was a PG examiner for MD DNB to various universities. He delivered orations at several platforms like the Indian Medical Association Guntur, the Hyderabad Psychiatric Society, D.S. Raju Memorial Oration Award. He was awarded the Lifetime Achievement Award in Telugu Psychon in 2016. He's a member of various psychiatric societies and also has delivered many scientific lectures at various conferences. He has published various articles in many renowned journals. Sir, with great honor, the organizing committee of International Conference on Spirituality in Mental Health and Wellness has unanimously decided to felicitate you, sir, for your contributions in the field of psychiatry and spirituality and for educating many young psychiatrists in becoming successful in their careers.
Thank you, sir, for accepting the felicitation. Dr. Prasad Rao, Dr. Gauri Devi, and all, even Dr. Chandrasekhar are students of Dr. M. Raman Rao, who are, and yeah, even MS Reddy. Sir, over to Raman Rao, sir, for response.
Thank you, Dr. Kishan. I'm overwhelmed with affection, by your affection, and it's a great privilege and an honor to receive the award from your section of International Society on Spirituality and in Mental Health and Wellness. I'm thankful to you, Professor Raghuram Reddy, and George Reddy, and several others who are there on the dais. Dr. N. Raju, Murugesh Vaishnav. Thank you very much. I am delighted, and I'm thankful for the honor that's bestowed on me. Thank you very much.
Thank you, sir.
Thank you, sir.
Thank you.
Next felicitation is to Dr. S.C. Tiwari, the person of embodiment of spirituality, and at this age also, sir. N. Raju is having flight.
Thank you, and I request Dr. Uday Kumar. I think
N. Raju are leaving the
Dr. Vinay would
program.
Be there.
Almost.
Yeah, Dr. Vinay would continue to.
Yeah, Vinay is the president.
Once again, thank you very much for all the hospitality, for the help and all, right?
Thank you very much. Thank you all.
Thank you, sir. Thank you, Murugesh. Next felicitation to S.C. Tiwari. Sir, Murugesh Vaishnav, sir. Such a small felicitation, please. Please. Yeah. No. At this end. This is end. No. Change this, table this end. Move. Come on. Change this to change. Let's. Sir, you do to N. Raju.
Boss. Thank you very much.
My pleasure.
Yeah. Let us.
मेरे ख्याल से ये करके फेलिसिटेट कर दिया इन्होंने.
Thank you very much, boss. Thank you.
Thank you very
sir.
much.
Thank you, sir. Thank you, sir. The apologies to senior persons. Dr. S.C. Tiwari, I'm requesting Madam or any family member to do felicitation on behalf of us. Yeah. First of bouquet and a shawl to S.C. Tiwari Sahab. You received the felicitation material, I think. Sir, am I audible, sir? Please take the shawl. I'm requesting family members to do felicitation on behalf of us. You received the shawl, memento, and citation. Please give all the things to the S.C. Tiwari Sahab. Requesting some people to do that. Yeah. So now we are displaying the citation here, certificate of appreciation, as well as the sir photo is displayed here. Now we are going over to Spurti to read the citation.
I take the privilege of reading the citation of Dr. Sarvada Chandra Tiwari. He was born on 2nd July 1953 in Lucknow, India. He received his MBBS degree and MD degree from King George's Medical University, Lucknow. He did his WHO fellowship in geriatric psychiatry at various universities in the USA. 2014 to 16, he was the chief medical superintendent of Gandhi Memorial and King George's Medical University. He was a former professor and founder head of the Department of Geriatric Mental Health at King George's Medical University in Lucknow. He is currently the chairman of the Mental Health Foundation at Lucknow.
Spurti, 1 minute. Sir, S.C. Tiwari Sahab, whether we are audible to you, sir? Whether we are audible to you? We are getting doubt of some technical is on your laptop. Requesting the young boy to see that whether you are listening.
तिवारी सर आवाज जा रही है?
Yes, I am able to hear Dr. Vinay.
सर वो शॉल आपको अभी ओढ़ने का देखना है कि कोई अगर जो शॉल पहुंचा है आपको कोई उड़ा दें.
अच्छा, ये शॉल निकालो.
अखा इंडिया देखे आपको उस तरह सजा संवरा.
हाँ, मैं आपका
Okay, continue the citation.
Dr. S.C. Tiwari has held many prestigious positions. He served as the Vice Dean of the Center for Advanced Research and Training. He is the founder president of Indian Association of Geriatric Mental Health. He was the chairperson of the Geriatric Mental Health Education Committee from 2012 to 14. He served as a chairperson of Geriatric Psychiatry Specialty Section of the IPS and chairman of the Subcommittee on Mental Health in the state of Uttar Pradesh in 2020 and the secretary of the State Mental Health Authority of Government of Uttar Pradesh. He was the editor of the Indian Journal of Biological Psychiatry and an editorial member of the Journal of Geriatric Care. He is the International Journal of Clinical Epidemiology. Sir is a recipient of many awards and orations at an international level. He was the first Indian to receive the Raffleson Fellowship Award and the International Psychogeriatric Association Award. The other prestigious awards are the Venkobara Oration Award, the B.B. Sethi Oration Award, the Marfatia Award, and many more. He is a member of various national and international professional bodies. He is a life member of Indian Medical Association, Indian Psychiatric Society, a member of the National Academy of Medical Sciences, and also an international member of American Psychiatric Association. Dr. S.C. Tiwari sir has organized around more than 20 conferences. He has participated in more than 120 national and international conferences, and he delivered more than 80 scientific lectures on various platforms. He was the chief guide of many theses in PhD and also in MD. He developed the Sarvada Sign for quick diagnosis of bipolar disorder. He established the first independent super specialty department of geriatric mental health. He carried out many national and international funded research projects. He established India's first ever healthy aging clinic and the National Center for Geriatric Electroconvulsive Therapy. Sir, with great honor, the organizing committee of International Conference on Spirituality in Mental Health and Wellness has unanimously decided you to felicitate for your contributions in the field of spirituality, for spreading mental health awareness, and also in educating many young psychiatrists.
Thank you, sir. And S.A. Tiwari Saab has given a talk in the last year, that SARC conference of International Conference of Spirituality. And he also participated as a panelist of today legendary group of psychiatrists. And thank you, sir, for your, at this age, you are coming forward to give a talk. I think I think that your blessings will be continuous on people who are working for spirituality in India. Will continue your legacy, sir. Thank you very much.
Thank you very much for this honor. Thanks a lot.
Sir. Sir, any message, sir? It can take 2-3 minutes to give message. For young psychiatrists in India as well as over the globe. Okay. So.
Yes, sir. Dr. Nirmal from Nepal.
Over to Vinay, sir, to take over the session.
I think now everything is over. We spent. Okay. Oh, sorry. I missed. Because yes, there is very pleasant part because. Oh, Nirmal. Dr. Nirmal. Okay, Dr. Nirmal.
Yeah.
Yes, please continue.
Sir,
you are most welcome.
No, sir. I just wanted to say a few words of what a great conference this was, and thank you very much to Dr. Kisan and all the teams, for giving us this opportunity to be part of this excellent organization. And I think we got a lot. Since morning, I've been listening to all the talks, but I'm also on duty, so I may have missed a few. It's a privilege, and it has been aptly said that maybe the knowledge of spirituality and religion, if we amalgamate it in our clinical practice, I think we'll be doing a lot more justice to our patient. Thank you very much for this opportunity and the opportunity to chair the first session. Thank you all.
Thank you, sir. I think you are Nirmal Namchane is a distinguished professor of psychiatry in Nepal. And we got support from Sudarshanji, Nirmal Namchane, and as well as Ajay Risal and Koirala, where you are all people of spiritual people are with us for Indian Psychiatric Society. Thank you very much, sir. Convey our best.
See you all in ANSIP, sir. I hope to see you all in ANSIP.
Yeah. Over to President-elect, sir. Vinay.
I think this is the one of the last items. Distribution of memento to office bearers on the dais and organizing committee, and also the sponsor. So I hand over to Sai Krishna for the honors.
We request Dr. Om Prakash Singh, sir, to please kindly accept our memento, sir. Thank you, Om Prakash, sir. We request Dr. Alim Siddiqui, sir, to please kindly accept our memento, sir. Thank you, sir. Now I request Dr. Arvind Brahma, sir, to please kindly accept our felicitation. I request Dr. Peter sir to please join onto the stage. I request Dr. Pawan Kulkarni sir to please come onto the stage. I request Arvind Brahma sir to please sit, sir. Next, I request Dr. Vinay Kumar sir. Next, I request Dr. Uday Kumar sir to please kindly accept our felicitation. Next, I request Dr. Manna Praveen sir to please kindly accept our felicitation. Thank you, sir. Next, I request our dynamic president, Dr. George Reddy sir, to please kindly accept our felicitation. Thank you, George sir. Next, I request Vinay Kumar sir to please kindly accept our felicitation. I request all the people on the dais to please keep their shawls. Praveen sir.
Vinay Kumar sir is going to become president shortly. Because of him, we should have a photograph with Vinay. Yeah, please. Yes. But as the president, IPS program. Yeah.
I request my own team, Dr. Spurti to come on to the stage and Dr. Vishnu also to accompany Spurti. Momento. Dr. Spurti and Dr. Vishnu, despite of her father's ill health, she was there active and she was coordinating the program from past 1 month. Spurti. Dr. Spurti and Dr. Vishnu. Chanakya. Next, I request Dr. Pawan Kulkarni sir to please come on to the stage for felicitation. Next, I request Dr. Sharanya to please come on to the stage. Dr. Pawan sir is Professor and HOD at Chelmada Anandrav Institute of Medical Sciences. He is Honorary General Secretary and active member. Next, I request Dr. Sharanya Assistant Professor, RVM Medical College. So please kindly accept our felicitation. Next, I request Dr. Shweta, Senior Resident, Pratima Institute of Medical Sciences, to please kindly accept our felicitation. They were very instrumental in organizing of this conference. They were real people who had worked 24/7. Thank you, Kambam Party. Ravi. Vishal sir went outside. Uttam. Dr. Uttam is elder son of my teacher, Dr. Kishan sir. He is student of Dr. Pawan Kulkarni sir. Next, I invite Dr. Anupam. Spurti, be ready to felicitate Kishan sir. Next, I request Dr. Kishan sir to please kindly accept our felicitation. Dr. Kishan sir, please kindly accept our felicitation. He is the real man who is behind this program. One year back, when sir had said that, Sai, we are going to conduct this conference, from that day, sir was actively thinking about for all the speakers involved, chairpersons and everything. Thank you, sir. I request all the postgraduates of Kishan sir, all the students of Karimnagar Psychiatry Society to please join for the photo session. I request Sun Pharma, Mr. Chanakya, Sitaram, Sumit. I request Anuhya, please join for the felicitation. Anuhya. Any other postgraduates? If I am missing, please join. I request Sun Pharma people, Chanakya and his team, Sitaram, Sai, Sumit. From the past 2 months, they were actively doing all the works. Thank you for all the support, academic support. ఇంకెవరైనా నాదే కదా out of time. Next, I request Mr. Ram Reddy, who is actively serving our society. I request Mr. Ram Reddy and his team. Ram Reddy. When Ram Reddy is involved, we are a bit relaxed. Why? Because he takes care of the entire program.
Now, Ram Reddy sir. He will do wonderful arrangements. Please, sir. Parle, session. Without any technical glitches, it's wonderful work. Thank you. Now the hero of the whole show, Dr. Sai Krishna, editor, Telangana Journal of Psychiatry and professor of psychiatry, and is first batch student for me. Wonderful dedication. I think he'll be future leader of Telangana IMA and as well as the Telangana Psychiatric Society.
We request Prasad Rao sir to please kindly accept our felicitation. Dr. Prasad Rao sir is the advisor of this program and he had given us free hand to conduct all this program. Thank you, Prasad Rao sir. Please kindly accept our felicitation. Thank you, Prasad Rao sir. With the permission of President, shall I go for vote of thanks, sir? Thank you, sir. It's indeed a great pleasure and honor to deliver the vote of thanks. Any good program should come to an end. On behalf of the organizing committee, I thank chief guests of today's program, Dr. Afzal Javed and Dr. Mukesh Vaishnav for gracing inaugural and valedictory. We thank Dr. B.N. Gangadhar sir, Dr. Prasad Rao sir, and Dr. Peter J. Verhagen sir, Dr. Uday Kumar sir, Dr. George Reddy sir, Dr. Praveen sir for accepting to be guest of honor for both inaugural and valedictory. We thank our President, Dr. N.N. Raju sir, Dr. Vinay Kumar sir, President-elect, Dr. Arvind Brahma sir, Honorary General Secretary, Dr. Om Prakash Singh sir, Dr. Alim Siddiqui sir for their support and guidance. We thank Dr. G. Prasad Rao sir, V.L. Naresh sir, Dr. Sanchita Ray. We thank Dr. Agram Reddy sir, Dr. B.N. Gangadhar sir for blessing the program and sharing their wisdom. We thank IPS TSB President Dr. George Reddy sir and entire IPS TSB EC for their support. We once again thank Dr. Ajit Awasi sir, Dr. N.V. Raman Rao sir and Dr. S.C. Tiwari sir, Dr. B.N. Gangadhar sir for accepting our felicitations during the program. We express our deep sense of gratitude and appreciation for all speakers, chairpersons and panelists, delegates, students who were active from the morning. Total 700 participants were there and we thank them. We thank all our organizing committee led by Dr. Kishan sir, Dr. Spurti, Sharanya, Shweta, Kamampati, Ravi, Uttam, Anupam, Anuhya and Varsha for their teamwork. We thank Sun Pharma, Mr. Sitaram, Chanakya, Sumit and their colleagues for their academic support. We thank all the technical staff for their support. We thank Hotel Taj Deccan for giving this space. Thank you. Thank you once again. I declare this program is closed. Thank you. I request all of you to join for the next oration, KPS oration at 7:30 in first floor, Synergy Hall. It is in E floor. Please join for KPS oration, which will be delivered by Dr. Peter J. Verhagen. 7:30.